Hello, my friends. Hi, everyone. Hi, Debbie. Hi, Jamie. Hello, everyone. I'm so glad you guys are here. Hi, Bobby. Bobby, while I was there, I wanted to send you love and light. Hi, everyone. I'm so excited you're here. We are going to continue reading the bind over transcripts from Mackenzie's from juvenile to adult court transcripts. One of the things that I was thinking, I know some people like to read along with me. Oh, sending you love and light, Bobby. Hi, Bobby. Hi, Debbie. Hi, Jamie. Hi, everyone. I'm so glad you guys are here. Thanks for coming. I was just thinking it would have been fun to play. I have like so many videos of one of them is really cool. I'll see if it's uploaded yet, but it's a drone that takes the exact loop, like road that Mackenzie took that the police had. That's really awesome. So why don't we do a poll? If you want to read along with me, we can do that. Or if you want, I should probably make sure they're on YouTube. If they're not on YouTube yet, I can upload them. If you want to just watch like videos of, it could be body cam, it could be pictures I've collected. If you want to do that, I was just trying to think of a way to make it a little bit more entertaining for you. Oh, because you're flying Conair. Welcome to the flight. Today, it looks like blue skies, no turbulence. We have no idea where our destination is or where we are going. And that's part of the Conair experience. We are going to read the bind over. So do you guys think we should... Hi, Kate. I emailed you a picture of... Okay. Thank you, Bobby. I have been like... I like having you this mysterious... Bobby is our mechanic. He gets us everywhere we need to go. And it's probably a very much of a different name, but Bobby makes sure that Conair is flying right. Okay, Bobby, I'll check it. I don't know why I was like, I'll look at it. Okay, so what are you guys thinking? Hello, Debbie. Hi, Bobby. Oh, our flight attendants would like a week off. Well, we can't. Oh, if you'd like to be a mod for this channel, yes, there is you'd first become a member, then become a mod. It's kind of that way there are no questions. Hi, Shay Murphy. Welcome. We can't give our flight attendants a week off, and because criminals have to criminal, and somebody's got to fly them around. So if you need a break, though, we could give you some vacation. But you're not a flight attendant. You're making sure our plane flies. Anyway, the question that I would like to ask is, if you guys want me to keep the court documents up and you can read along with me, or would you like me to put a video up that has like the Mackenzie Shirilla of it all? Hi. Oh, good. You're listening in. Oh, good. So then I know I was just trying. And if you guys are fine with the court documents, I'll be reading them. And I just want to make sure that our customers are happy. I was just thinking, technically, the states are the happiest, but Bobby, I'm sending love to your little pooch. I feel like did you know I talk to animals too? I'll look at that. My friend's dog taught it to me, like how to talk to dogs. It was so fun. But anyway, I feel like it's not parvo. We can talk about it, but what's going on? Have you done, this is probably going to be so obvious and you've probably already done it, like rice and chicken or something, like maybe chicken broth or something. No, Bobby, you're not a flight attendant. No offense. You are the number one go-to guy to make sure you're the engineer that keeps it in the air. Okay. If you guys are okay watching the court documents. Oh, wait a second. I want to write these down and I have them. Okay. I'm going to make a commitment to us. Oops. That we are going to get the swag like tonight. That's going to be my goal. Okay. So there was something that someone said and I didn't copy it or screenshot it or write it down. And it's not outside sales. It was like a pharmaceutical expert on the streets or something. It was hilarious. Yes, we need merch ASAP. Thanks, Bobby. Yes, this will become like a commitment that I'll make a commitment. Okay, I'm going to call it training because I have to be at work next weekend. So I have a whole week to get used to it at 7 and at 5:30 a.m. It's like some tournament. And so I have to start. Hi, Lisa. Hi, Lisa. I have to start training to make sure. So we cannot have late nights after. I just like to stay up late. That's my thing. I do the most work then. If anyone remembers what that, I don't know who it is. And if you're here, please drop it again. It was something about being like a pharmaceutical sales expert or something. It was implying that he was a outside salesman, but it was hilarious. All right. So for our merch, we have Strongsville Hard. I want a Strongsville Hard t-shirt. I wrote down the quote. They act like I killed 85 people or something. Bet. Conair, Big Bun. Hold on. This isn't the only list. We also have Hanging in the Wings. I'm going to put that on this list. I'm going to make one list for this. Hanging. Oh, obviously. And the Conair is like the most obvious. I made that logo. Well, I used the logo that there's a movie. I didn't even know that. There's a movie called Conair, and it has like an eagle, but I just like dressed it up a little. So the eagle is a little bit, but it's not copyrighted. So Hanging in the Wings. Okay. That's going to be for our crew. We also, what's the slang for, or lingo for in the cockpit, like making sure everything runs well? Bobby, you need your own swag. Hi, Lisa Jackson. Welcome. Oh, you put clothes in the dryer. Good, good, good. Oh, that is so funny. A lot of people do their laundry while they're listening or watching. All right. I want to do something with her bun. Anyway, I could go down the rabbit hole with this. So yes, I will make a commitment to get us swag like tonight. If I'm missing anything, let me know. Hello, I'm so glad you guys are here. Okay. Well, since no one has a real opinion and it sounds like other people, you guys all have lives doing other things, we can keep the court documents. I don't think she's in here. It's one of our OGs. It's not Cheryl within oh, maybe it is. One of our OGs loves to read along. And I literally have no preference. I was just trying to accommodate. Hi, Sonia. I was trying to accommodate the clientele. You can have one water bottle. All I remember ever hearing them eat or drink was 2 water bottles. If anyone's actually flown Conair, can you give us an update on what it's like? Pharmaceutical sales representative. Yes, that's what it was. I'm going to screenshot that. Thanks, Debbie. No, the Charlie Kirk trial, I am not keeping up with it because to me, it's just like the Brian Koberger case. It'll just infuriate me. Well, and Candace has been very vocal about the scapegoat. It's been all over Twitter. Oh, someone was asking me what my Twitter account is. It's here. I'll drop it in the thing. It's KDP 18. Those are my jersey numbers. My name is KDP or KATIEP 18. I'll find it for you. So I'll drop it in the link. It's probably in the description of this too, just so you know. Somebody wanted to send me something on Twitter. I go through phases of Twitter, but I follow all of my Karen Reed stuff on Twitter. And I do like to stay pretty active. Here's my Twitter link. Please follow me. I would love it. Don't get offended if I don't write you back. I don't know what that is. I wonder if I have some kind of trauma I need to work through. God, that'd be fun. All right, here's my Twitter link. I'll show it to you so you can see what it looks like. It's very, it looks just like YouTube. And someone asked me what my Twitter link was, and I don't know if I wrote you back or not, but it's True Crime Tarot, and it's KDP18. And I'm not verified yet because I don't want to pay for it. So here's my Twitter account. Okay. So you guys saw that. Oh, good. Oh, man. My Twitter account said it wouldn't send. If it doesn't. All right. Hopefully that worked. Okay. So that's my Twitter. And one of our friends asked me in the comments, and I don't know if I wrote you back. And anyway, it says that an error occurred every time I try to send you guys my Twitter link. It's KDP18. God, of course it is. Okay. So that's my, oh, you're not looking at it. My Twitter account. Have you seen Mackenzie's new photo from jail? I saw it yesterday. Hi, Claudia. Or maybe it was today. Here's Twitter for those of you that would like to follow me over there. Every time I drop the link in, it says that it can't go through. Why? Why couldn't? Oh, you got it, Bobby? Okay, cool. All right, sweet. Thanks. Okay. I did see somebody just post. Why don't we check it? I think Mackenzie needs a shout out. We'll do some Insta before we get into the bind over. We'll check some her Instagram and see what we can. Oh, and here's might as well show you all my socials. Here is my Insta. This is KatePutnam 18. All my jersey number was 18. And it's just KatePutnam. We are going to look. Oh, wait. I have to remove myself from the screen because I want to show you guys what the background is. Oh, thanks. Oh, you found it? Okay. Here, I want to show you guys what the background is. I am going to, here. Attorneys remind me of. I just had to show you that. I thought it was hilarious. Okay, so we're on Insta. We're going to find Mackenzie. Free Mackenzie Shirilla. Easy, Natalie. Oh boy, here we go. All right. You guys can see this. I'll make myself smaller so you get the full Mackenzie of it all. Okay, here's Mackenzie. Here's the latest. And for the record, I have no idea if she's getting Botox or not. Honestly, I don't care. But one thing I do remember, the friends that were in the same cottage that she was in are now out, and they were on a live, and she had delivered pizza to their house under the name of Mackenzie. 100% sketch. So why did I tell you guys about them? Were they the ones that said that she's getting, oh no, what they told us was these are selfies that Mackenzie sends to her mother, and her mother uses an Instagram filter and then sends it back to her, and that's what she posts. So that's what the girls that were in the same cottage as her said. All right. Mackenzie is trying to do better every day and holding on to hope. Her post-conviction relief was denied due to okay, wait a minute. God, I don't want to fact check this lady, but it was, hold on. I need to make myself bigger because I'm getting wound up. All right. First of all, this says it was a deadline technicality. I'm not even a lawyer, and I know that there are deadlines, and you guys blamed it on leap year. Okay. It wasn't a deadline technicality. It was a missed deadline. The post-conviction relief was denied because you missed the deadline. The decision has nothing to do with the contents of it. Yeah, because they didn't even bother to look at it. It was unable to be reviewed. Exactly. Because you missed the deadline. Her appellate lawyer missed the deadline by filing it 1 day late due to a leap year, which also makes him ineffective assistance of counsel. Okay, that's all true. Mackenzie and her family, and me, I'm Natalie, I'm her mother if you haven't seen me, along with everyone's help, will respectfully continue to do everything that they can so that the merits of the brief can be heard, just as everyone else would do in their position. Keep sharing everything you can, and please sign and share the petition for a fair retrial. I have seen rigged trials, and so far I haven't seen one thing. Okay, I know one of our friends in here has seen manipulated videos. I have not noticed it yet, but I probably will look at it. But so far, so good. We all deserve fair representation. And once you review her case, you'll agree that she didn't get that. I disagree. I have reviewed it. But if anyone feels obligated, please click sign and share. What I am not doing is clicking sharing or signing, but everyone has Insta, or if you don't, just Google it. If you feel so inclined that you'd like to sign the petition to get her a fair trial, please. Okay, thank you to everyone who has become her voice. Mackenzie Shirilla's support team. Hashtag free Mackenzie, hashtag Mackenzie Shirilla, hashtag wrongfully convicted, and hashtag crash. And she has 13,000 likes. I want to see who they are. Who are the likes, Mackenzie? Oh, it's been locked, of course. So she has her. Okay, I don't know what I'm looking at here. Perhaps she does have some filler in there. She has a razor, it looks like. This does not look like Mackenzie. The Mackenzie Shirilla I know looks like this little psychopath. Man, that's what she looks like. She is getting some sun, though. I will be from this picture to this picture, she's definitely making time out in the rec. Hey, Rosie, your sketch. Okay, so that is the newest and updated 18 represents the moon. I'd wear a cool 18 moon shirt. Really? Awesome. Bobby, I have designed those, not with the 18 in it. I didn't know that. 18 was my jersey number growing up. I was a soccer player. Yeah, definitely looks run through. It's hard to argue. I mean, okay, let's check the years. How many years between, this pisses me off. September 24th of 2022. So they had passed away, like they died July, like a month earlier. So when Dom died, this is what she looked like. And now we're in 2026. Hey, Natalie, I don't know if you're watching this or not, but you've got to stop with the filters. It looks so beyond fake. It's like, to me, I don't think she looks even pretty. There was potential in some of these pictures, but okay. So that's what I see as Mackenzie's. You know what I don't remember seeing? And we're not reading this. If you're interested, that's more back. That's the Mackenzie I know. Gross. Okay. Thank you, guys. All right. So now we've seen Mackenzie's new picture. She definitely looks a little bit busy. And we are going, wrong one, to continue reading the bind over transcripts. So get cozy, get comfy. Well, cougarish. This was a discussion in the chat. They were talking about it either being lipo. I heard the girls that were in there with her said that her mom uses an Instagram filter. So I don't know I have no idea. But the girls in there said that they can do it. Literally everything in there. You get tattoos, lipo. I don't know. Or what is it? Botox, not lipo. Sorry, Botox. I have no idea. So we are going, please get comfy, get cozy. We have a long flight ahead of us. Bobby said that the plane's running smoothly. We have clear blue skies. Whoa. And where is the bind over? All right. I'll leave you with this guy one more time. stage and add court. We are on the second, just to give everyone an update. We're reading the bind over trial transcript that one of our lovely dear friends, she outlined her lips. I don't know that much about makeup, but we can look at it. We're on the bind over trial transcript. The prosecutor is presenting their second witness. And if you don't know what a bind over is, can you guys see me? Okay. Here, I'll share what Notebook LM said, so that if you're interested in reading, you can read it with me. All right, bind over. In the Ohio, what is a bind over? If you're interested, a bind over in the Ohio judicial system is the legal process by which a case is transferred from juvenile court to the adult criminal system, the Court of Common Pleas General Division. This transfer allows a juvenile to be tried as an adult and face adult criminal sanctions rather than juvenile rehabilitation. Hold on, I'm going to blow this up so that you can see it. Okay. Whoa, that's a little too big. Okay. Love you. Thanks, Cougarish. Welcome to the party. Thanks. I love you. Thank you. You're the best. That just like made my day. You're the best. Thank you. Well, thanks. I'm glad you're here. Okay, so we are in what is a bind over? The bind over is just going from juvenile to adult court. It's like a fancy name. There are two primary types of bind overs identified in our sources. So the only sources that we'll do a quick review. You're the best, Cougarish. I like your name. That's hilarious. Wow, thank you so much. Yeah, thank you. Get cozy, fly comfortable. We don't offer food or drinks on Con Air, but we hope you get to your destination because we don't make any money if you don't. Okay, what you guys are looking at is my Notebook LM. I have like 6 of them. This one is the Natalie Shannon. Okay, so literally, they max out at 85. I'm sorry, at 100 sources. So like this one was mostly focused on Natalie. This one is the investigative reports. This one is like mostly Mackenzie being psycho, the psychological profiles and the linguistics. Mackenzie and Dom, a volatile relationship, and the soul contracts and the spiritual side. So they max out, and then we get to Proctor. Hey, Proctor. Oh, and this is Kendall. That is a very disturbing police report. It's not disturbing the way her texts are. It was really troubling. Like her dad, it's sad. Okay. So now you know what we're looking at. Everyone is comfortable. Here are the sources. It's only pulling from what I've added in. So these are a lot of the combined reports. Anyway, so we have 2 things that they could do. There's a mandatory transfer. That's called the binder. Okay, so we're back to reminding everyone we're trying to get out of juvenile court into big boy court. There are 2 primary types of bind overs identified in the sources. These are my sources. Mandatory transfer. A mandatory bind over occurs when a judge is required by the statute to transfer a case to adult court, removing judicial discretion. Under Ohio Revised Code 2152.12a, a transfer is mandatory if the child was 16 or 17 years old at the time of the alleged act. Oh, she checks 1. So this might be a mandatory thing. The act charged as a category 1 offense, such as aggravated murder. Okay, so this might be a mandatory bind over. Category 1 offense, such as aggravated unaliving itself, or attempted unaliving. The juvenile court finds probable cause that the child committed the act. Okay, I feel like we just crossed off all 3 of the. I feel like we got it. A discretionary. Okay, so then that's the first one. I feel like Mackenzie is in that first category. She crosses off all 3 of these. Number 2, discretionary transfer bind over. A discretionary bind over allows the judge the choice to transfer a case to adult court for certain juveniles who do not appear amendable to care. Oh, she might actually do discretionary or rehabilitation within the juvenile system, or those who are deemed a threat to public safety. This process, she's already crossed off all these. This process typically involves a Rule 30 evaluation, which is a psychological assessment of the juvenile. So, like, I know California has, what is it? Oh, God. BJ investigate all this. I am blanking on it right now. It's the California Mental Health Hold. A Rule 30 evaluation is a psychological assessment and an amendability hearing, where the judge weighs specific factors outlined in RC 215212 to determine if the child should remain in the juvenile system or be tried as an adult. The probable cause hearing. Before the bindover can occur, the juvenile court must hold a hearing to determine if there's probable cause. Oh, that's probably what we're in right now. To believe the juvenile committed the charged crimes. To establish probable cause, the state must present credible. Yeah, we're in the probable cause hearing right now, I think. I'm guessing. To establish probable cause, the state must present credible evidence supporting each element of the offense. This standard is lower than the beyond a reasonable doubt standard required for a conviction. It requires only a fair probability of criminal activity. In the application of the Mackenzie Shirilla case. In the Mackenzie Shirilla case, the prosecution sought, spoiler alerts are coming, but the prosecution sought a mandatory bindover because she was 17 at the time of the 2022 crash. She was charged with a Category 1 offense, including unaliving and aggravated unaliving. The judge, Jennifer O'Malley, presided over a 3-day probable cause hearing starting on March 2nd of 2023. The judge found no probable cause for the 2 counts of aggravated M. However, she did find probable cause for the counts of unaliving, felonious assault, aggravated vehicular homicide, drug possession, and possessing criminal tools. The transfer. Because probable cause was established for the unaliving charges, the juvenile court was required to relinquish jurisdiction and bind the case over to I wish it was Chattahoochee. What is that in Tennessee? Some county court of common pleas. And if you know how to pronounce it, I forgot to do it during our break. The lady who records all of the cell phone, the calls that we hear, she always names it. Anyway, Shirilla was subsequently indicted and tried as an adult. Okay, so that's what a bindover is. We're just going from the kiddie camp up to the big boys. So now we know what we're looking at together. We're going to head over to, oh, thank you so much, Cougarish. I appreciate you. Oh my gosh, I love you. Girl, you are so awesome. Man, we should have had the competition. Where's Kendall? Kendall, get in here. Kendall was trying to have a competition the other night because she was trying to I appreciate you guys. Yeah, your girl's got to pay the bills, and I don't mind doing this all the time. I love you, Cougarish. Thanks, boo. Okay, so what we are looking at now is, everyone grab a drink. We're going in. The second witness is now at court. Oh, you're the best. I love you. Oh, I love you. Okay. And I love Inject Some Common Sense. Oh, that's a good name. I like you too. Welcome. I'm so glad everyone's here. I love you, Bobby. Oh, Chattahoochee. Yes. Hi, Patty. Have you been covering a 4-year-old girl missing in South Carolina? No, I haven't. I didn't even know about it. I have questions about it already, though. I mean, I don't know anything about it. But thank you for asking. Bobby, Chattahoochee. That's what I'm going to call this county. No, we're doing Mackenzie Shirilla. Oh, I should do what Deb, I almost called her Deb, Emily D. Baker. We only work on one case at a time in the chat, so I don't get confused. Emily D. Baker says that. All right, here we go. We're going in. Thank you, Your Honor. Our next witness is the state calls Dr. Esther Sang from MetroHealth. Does anyone need a break before we call the next witness? Mackenzie, are you good? Do you need to use the restroom or anything? I'm okay. Oh, man, I might have to channel my Mackenzie if she's going to talk. I'm okay, thank you. Okay, Mr. McDonald, I'm all right. Okay, you can step out to get him, and then you can come back. If we need to take a break between direct and cross, just let me know, and we can do that at that time too. Okay, thanks. Everyone okay? Temperature-wise, anyone too? Man, she's a good little captain. Judge Lauren. All right. Well, okay, we're going to keep going past all this. We're swearing in Dr. Sang. We'll do Dr. Esther. Hello, good afternoon. Welcome. She's spelling her name. She's a doctor. She's employed. Oh, she's a trauma surgeon at the hospital, MetroHealth Medical Center. Oh, I'm wondering who manages your blood bank and how did Mackenzie's mysteriously go missing after the warrant was issued? As far as okay, so she's a trauma surgeon at the hospital Mackenzie was taken to. She works at 2 hospitals within the system. Partner bitches. Her background and qualifications are she graduated from medical school in 2011. She completed her general surgery residency in 2016 and completed her surgical critical care fellowship in 2017. She was hired. I like her style, just short and to the point. Where did she attend? Mount Sinai School of Medicine. That's where her diploma is from, the Mount Sinai School of Medicine. It's currently called the Icahn School of Medicine, okay? She went to Temple University in Philadelphia for her general surgery residency, and her surgical critical care fellowship was at UT Southwestern in Dallas, Texas. She started working at MetroHealth in 2017. Okay, her daily duties in the trauma unit include my partners and I provide care for trauma patients, patients with critical illnesses, patients with emergency general surgery needs, and some of my partners provide burn care as well. You refer to these individuals as partners. Are they also doctors? Some of them are physicians and some of them are advanced practice providers, meaning physicians, assistants, and nurse practitioners. While your team is working with a patient or working with an individual, are there any specific policies or procedures that you follow to document the team's findings or ongoing notes during this process? Yes, we adhere to the professional standards and the standards set out by the hospital bylaws in terms of documentation. Okay, how do you document them? In our electronic medical record. As far as these electronic medical records, are they ongoing? Okay, are they ongoing during the stay? Yeah. Does each person as part of that team have access to these records? Well, so trauma care is a multidisciplinary specialty. I think that all members of our team have access to the medical records, but you could also say that even the folks who clean the hospital rooms are part of our team. Oh, I love her. I feel like she was raised right. She just treats everyone like the same, whether they're the surgeon or they're changing the trash, you know? They're all part of our team. Oh, it's like Con Air. We don't care if you're a pilot or the hostess or the stewardess or the mechanic. We're all part of a team. Okay, yeah. All right. Yada, yada, yada. Okay, she's introducing Mackenzie's hospital records. This is States Exhibit 7 and 8. Doctor, I'm going to approach you with what has been marked as States Exhibit 7 and 8. Okay, she's going to confirm it. She's confirming that it's Mackenzie's name and her records. Have you reviewed these medical records prior to coming to court today? I reviewed some, but not all of them. The medical record prior to coming, I reviewed some of them. Okay. With that being said, I'd like to draw your attention to the same book that you were looking at. If you could go to page 13, please. Mr. McDonald. Oh, where are my Muppets? Is this Exhibit 7? Yeah, it's still Exhibit 7. Exhibit 7, page 13. Are you on page? Oh, and then she says, are you on page 13? Yep. Okay. If you could read where it says at the top in bold, starting with MetroHealth, what does that say? The word MetroHealth appears multiple times in this piece of paper, which is, okay, then where are you asking? Okay, she's asking her to confirm that the bold words are MetroHealth Division of Acute Care Surgery, Trauma Surgery, History, and Physical. And at the bottom of the page, she's having her confirm that it's her signature on July 31st of 2022 at 7:45. Okay, so now Exhibit 7 is into evidence, has been admitted. Okay, all right, now we're good. Could you please describe for the court how a patient enters and what typically happens once a person gets to the trauma unit? So we almost always begin evaluation of a trauma patient in the trauma bays at the MetroHealth Medical Center's emergency department. They can arrive by themselves, by private vehicle, by walking in, or they may be brought in by various assortment of emergency medical vehicles. Okay, with regards to Mackenzie Shirilla, or with regard to strike that, underneath where it says MetroHealth Division of Acute Care, do you see a name underneath that section? Yeah, I see a name, Mackenzie Shirilla. Okay, is there a date? Oh, hold on, you guys. My kitty is yelling at me. Please hold. I'll leave you guys with the Stooges, or the Muppets, I mean. I'll be right back. I just have to let him out. But he just wanted to like hang out for a minute, apparently. So I put a little bed for him right here, and hopefully he'll just get into it. Okay, we're going back in to, thank you guys. Sorry about that. I'm like breathing heavy. I think I ran a marathon. All right. Okay, perfect. Here we go. Underneath where it says Metro, okay, she names Mackenzie and the date of 7/31. She's okay, asking her about Mackenzie's. Okay, here. Oh, so now we're just confirming her date of birth is August 2nd, 2004. They're just confirming that she was still 17. Okay, thanks. Doctor, according to these reports, how did Miss Shirilla enter into the trauma unit that day? Well, I don't specifically remember her case. What's documented here is that she arrived by flight for life or life flight. Okay, after she arrived by flight for life, what did she do next or where was she placed? Well, it doesn't specifically say which trauma bay she was brought into, but it says that she arrived to the bay, so she was placed in one of our trauma bays. Okay, and what's a trauma bay? A trauma bay is an emergency. Well, it's a room within the emergency medical department, emergency medicine department, excuse me, which is specifically outfitted for the initial evaluation and resuscitation of traumatically injured patients. Okay, thanks. I'm going to draw your attention to the next page. If you could follow with me on page 14. Underneath the section where it says history of present injury, how do you retain that information that you put in that section? Where does it come from? That comes from the information that is entered into the medical record by our team can come from a number of sources. It can come from the patient. It can come from the medical medicine services. It can also come from family members or witnesses. Okay, and according to the paperwork or according to the medical records, did you learn what had been involved prior to Ms. Shirilla entering the trauma unit? We were informed by MetroHealth Flight for Life that she was involved in a motor vehicle collision. Okay, thanks. Doctor, I'm going to start to go through this page here underneath the history of present injury. Do you see where underneath the 5th paragraph it says inaudible? Do you see where I'm looking? Yeah. Could you finish that sentence starting with multiple? God, man. So this is the blonde girl. If you haven't seen the Netflix documentary, that's okay. This is the blonde woman, the prosecutor that Mackenzie thinks would be hot if she wasn't such a biatch. And it says, multiple drugs were found in the vehicle, including mushrooms. Okay. And then it says loss of consciousness. Do you see where I'm looking? Was there a loss of consciousness? According to the document, yes. Doctor, underneath the next section where it says initial interventions, there's another spot where it says hemodynamic status. Do you see where I'm looking? Yes, that's correct. I do. And what is the hemodynamic status of this individual? The documented hemodynamic status that we witnessed in the emergency department included hypotension, meaning systolic blood pressure less than 90 millimeter. Okay. Hypo is low blood pressure. Hyper is high millimeters of mercury. Does that mean low blood pressure? Generally, yes, it means low blood pressure. The next two sections here in bold, doctor, say primary survey, inaudible. Do you see where I'm looking? What are primary inaudible surveys? Could you explain that to the court? Sure. We begin the initial evaluation and resuscitation of the trauma patient according to the standards established in Advanced Trauma Life Support, which is the system for evaluation and resuscitation of a trauma patient that's been established by the American College of Surgeons, by the cesspool. And underneath the section where it says primary survey, let's start with airway. It says intact, is that correct? Yep, that's correct. And then does intact mean normal? Yes. Okay, she's breathing normal. Circulation, normal. Skin, normal. Texture, normal. No rash. The cat is still yelling at me. Don't worry, he has food. Just one moment. Okay. Oh boy, since when did the cat get needy? All right. Okay, so her skin is documented as normal, texture, no rashes, visibility. Okay, then it says pupils. There's an acronym, PERRL. Can you explain what that means? That's abbreviation for pupils, equally round and reactive to light. That's a normal pupil exam. Okay, and GCS, what does that mean? GCS is an abbreviation for the Glasgow Coma Scale, and we've heard it prior. But what is the Glasgow Coma Scale? It's a quick way to access a patient's neurological status. What's the highest level or score reached on that test? A 15. And referring to your records here for Miss Mackenzie Shirilla, hold on, I have to take a break. I have to take a breath. Sorry. I don't mean to keep pausing, but I'm like breathing heavy from the kitty. He's throwing me off the game. Hey, everyone, please take a drink. Enjoy your stay. You're on Con Air now. We are flying in the skies, and it's fine. Please like, share, subscribe, do all the things because we're growing, and I love you, and I really love our super chats, and I'm so glad you're here. If I didn't greet you when you got here, hello, I'm so glad you're here. All right, now I just got a deep breath, so I'm going to set sacred space. I haven't set it yet again, so I'm just going to take a moment to set some sacred space, call in the quarters, project us. I'm not looking at the chat. Oh, something going on in the chat. Is that why? I should probably look. Oh, yeah, I'm on autopilot. Thank you. All right. I'm setting sacred space. When I set sacred space, I'm creating a safe bubble around us. So you call in Archangel Michael in the south, Kuan Yin and Isis. This is how I do it. You can do it however it feels comfortable. Kuan Yin and Isis on the west. Let's do Sandalphon in the north and the Magdalena clan on the east. We'll ask the grandmothers of the universe to surround the sacred space. Okay, sweet. And now everyone who's watching is protected too. Okay. I didn't know if we had riffraff over here. I'm like, why did I all of a sudden feel like I needed to do that? Oh, God, I forgot my water. 2 more seconds and I'll be done. We're back. Whew. Thanks, team. All right. What are you guys drinking? I actually have like 3 drinks over here. I have an energy drink, but I can't drink the kind that has aspartame, so it's V8 energy. And a seltzer water and a water. Whew. I'm breathing heavy. Hi. Oh, you're so fun. Thanks, Debbie. Because you think I just worked out. Well, I'm getting back into journaling. I told you guys that like last week. So I'm doing it every day. And today's thing was a year from now, what's happening. So you like describe where you woke up and everything. And one of them, and I wrote I was working out and I was lifting again. So I think my body's like, oh, good. We're going to start exercising like hard again. Okay. Anyway. Casey Anthony and Jodi Arias. Yeah, probably. I feel like she's much more dangerous than those two are. I know they're dangerous, but she's also like a very powerful magic. She understands. Well, thank God. She's a baby witch, which means she can be dangerous because she doesn't understand her powers. those other two, I just feel like are dysfunctional. They have their own thing. Anyway, the point is, okay, everyone's taking deep breaths. Please get comfy on Conair. We're adjusting a temperature because we're getting into cruise control because this is slightly long. All right. Why can't I catch my breath? I feel like something's going on. Am I missing something? I feel like there's like something, like, I don't know. Is there something I'm missing? Is someone having breathing problems or heard something? Am I picking up something? I don't know. There's something going on. Okay. We're going to get back to the Mackenzie of it all. All right. She was a 15, so that's like fine. She was fine. If you could look at the, all right, we're back on. Let me make sure I'm not muted. God, that would have sucked. Okay, here we go. If you could start with the blood pressure pulse. What's the patient's blood pressure and what's her pulse? In the secondary survey, we documented a blood pressure of 100/53. We documented that the pulse rate of 85 beats per minute and a body temperature of 98.5, a respiratory rate of 25 breaths per minute, a height. Oh, she's taller than I expected. I thought she was petite. She's 5'7" and 90 pounds. Whoa, I'm 5'7" and 90 is small, like, and an oxygen saturation of 98%. Let's start with the blood pressure. Did you determine that it was within normal range? Oh, it could be, yeah. What about her pulse? Sure. Temperature? Yep, that's normal. And I see for the respiratory rate, it has a red 25. What's that mean? That means the number is abnormal. Okay, thanks. And why is that number abnormal? It's higher than what we would typically expect. And what would you typically accept? Okay, what are we looking at? Respiratory rate. What would you typically expect? Less than 20. Okay, and SpO2, what's that? That's oxygen saturation as measured by the pulse oximeter. Okay, what's the highest percentage someone could have? 100. And what's the percent here? 98. Thanks, doctor. Next, we have neurologic. Could you read after neurologic? What does it state? The medical record states that she was alert and oriented, appropriate strength, symmetrical, no sensory deficits. She practically crashed into a brick wall going 100 and, like, other than the broken legs, like, could walk away, is what I'm getting from this. Okay, head. What's that section? What's documented here is there are no lacerations, bony step-offs. That's a typo. Or abrasion. It's supposed to say no lacerations or abrasions. Midface was stable to palpitation and ecchymosis over right eye. What is ecchymosis? I don't know. Are there any nurses in here? Someone might know how to pronounce that. Okay, so there are no lacerations. I get that one. What's a bony step-off? A bony step-off is an irregularity in the surface of the bone that can be felt through the skin. Okay, it often implies that a bone is broken. Oh, okay. Okay, and what's a midface stable to palpitation mean? Well, there are multiple bones that are present in the face. The midface is generally considered to be below the level of the eyes, but above the level of the upper mouth, like your upper lip. Stable to palpitation can suggest that there may not be any bones broken. I'm sorry, there may not be what? A midface being stable to palpitation is normal. Oh, okay. And it implies that there might not be any bones that are broken. Okay. And ecchymosis over the right eye. What's ecchymosis? It's a medical term for bruise. Oh, she has a bruise. Okay. With regards to the eyes, you've already described that her pupils were reacting normally. Is that correct? Yeah. Doctor, please keep going to page 15. Let's go to, what is that long word? Hemotatriasis refers to bloody eardrum. Okay, so there was no bloody eardrum recognized here, right? On either side, that's correct. Okay, what about her nose? The exam was documented as septum midline, no crepitus with motion. Is that normal? Yeah. Oral cavity without trauma. Is that normal? Yep. Next. Okay, her face is fine. Oh, shocker. The midline tenderness, lacerations, or wounds. Is this a normal exam? That is a normal exam. Oh, there were no midline tenderness, lacerations, or wounds. Thank you. Her chest. Diffusely. Oh, it was tender. Yeah, it was tender. She has a safety seatbelt. Okay, it was tender. There are no step-offs, deformities, or bruising. That's abnormal. Could you explain that for us? It would not be normal for somebody to have a diffusely tender chest wall in the setting of being involved in a motor vehicle collision. What? It could imply that there was a major trauma to her chest. I feel like that doesn't even make sense. I feel like it would be really normal for someone with a seatbelt on to have a tender chest wall because she was involved in a motor vehicle accident. I feel, well, I'm not the doctor. I'm just going to keep reading. Okay. It could imply that there was major trauma to the chest. Okay. I think we're at the pulmonary and cardiovascular. The breath sounded clear, symmetrical. There were no wheezes, rails, or consolidation. Is this normal? Yep. Pulse. Okay. Her pulses are normal. Her abdomen, she was normal. Her pelvis was normal. Okay, everything's normal. She literally walked away from this, other than the broken bones. This is all normal. Extremities, muscular, skeletal, inaudible, normal. Gross deformity of the right elbow and the right knee. 2 centimeter laceration on the left knee. The range of motion intact. Okay, so it was her right elbow. Okay. The range of motion intact in the left upper extremity and the left lower extremity. Oh, so right, because the impact was on her right side. So her left is fine. Okay, an EFAS was performed by emergency department staff, and that was positive in the upper right quadrant. A chest x-ray was performed. I believe it to be a typo where it says no acute x-ray. I suspect that means no acute fractures. Okay. An x-ray pelvis is documented, no fractures. Underneath the next section, it says past medical history. Do you see that? Okay, could you explain to us how you would obtain someone's past medical history? Well, sometimes the patient can tell us. We often receive information from family or friends. Okay, and here it says, talk to mother. Oh, she's going to give her the POTS right here. Talk to mother. Do you see that? I do. And okay, would that indicate that the mother was the one that informed somebody on our team, who then entered it into the medical record? Okay, do you recall we discussed these records prior? Yep, we have. When approximately would that have been entered? I don't know when it would have been entered. Past physical history. Again, where would you have received that information? You could get it from either the patient, a family member, or a friend. Okay, and lastly, pre-admission medication. It says none. Okay, where would you have obtained that information? We could have asked the patient, a family member, or her friends. Okay, so after consultation, any of those people, the only thing listed here per her mother is per her mother. Is that correct? The only thing that's listed here. Yes, that's the only thing that's listed here. No additional medical history listed. No medical history listed. Okay, thank you. Are there any allergies? It says NKDA. Do you see that? What does that mean, doctor? That's a medical abbreviation for no known drug allergies. Okay, social history. Do you see that section? I do. And how did the staff obtain someone's social history? We can ask a patient, their family, or their friends. Do you recall in this case if the patient was asked? I have no idea if the patient was asked. Okay, under social history, what does it say? It says denies tobacco, ETOH, which is a medical abbreviation for alcohol and drug use. Thank you. Oh, thank you. Turn to page 16, doctor. I'm going to go off kind of towards the middle of the page. Do you see where it says review of system? I do. I'm sorry, what page are we on? Oh, Mr. Troop's doing this. Sorry, not the blonde lady. Oh, this is Mr. Troop. She does not have anything nice to say about him in her jail calls. Oh, I'm sorry. We're on page 16. Let's start with skin. Skin lax to left knee, a bruise above her right eye. And I think you briefly described a bruising above the left eye. What is skin lax to the left knee? Lax is a medical abbreviation for a laceration. A laceration is a tear. This indicates that on our review of systems, we found that the patient had tears on the skin over her left knee joint. Okay, thanks. And doctor, if you could just refer to the eyes, ears, nose, and throat, is it correct based off of what you're looking at in your records that both of these or all of these are negative for symptoms? That's correct. Okay, thanks. Next, we'll move on to respiratory. If you could explain for us what the finding was with regard to Mackenzie Shirilla's respiratory system. We documented no symptoms of cough, shortness of breath. She's fine. She was normal. So her cardiovascular system was normal. Is that what you thought? Yeah, her respiratory system was negative for any of the stuff. I'm sorry, her respiratory system? Oh, she quoted it wrong. Oh, cardiovascular. Okay, now she said, I'm sorry, her respiratory system. Next is cardiovascular. Negative symptoms of chest pain, pressure, tightness, palpitations, something else, something very doctor, shortness of breath, very much more doctor, and headache or vision change. Okay, so she didn't have any of them. And gastrointestines, normal. Everything's normal. We've gone through this. No urinary symptoms. She wasn't like peeing blood. The next is neurologic. Man, they're really ramming this home for this poor judge. Yep. If you could describe what the statement says. The statement here is that negative symptoms of seizures, negative for seizures, weakness, gait problems, numbness, burning pain, tremors, or memory loss. This is like checking to see if she had a stroke. What is syncope? Syncope is a medical term for fainting. Oh, that's a fancy way of saying fainting. Oh, so no, she didn't faint. Okay, so there was no sign of fainting, wheezing, seizures, or weakness. Can I ask you a question, doctor, with regards to this section? Does that mean a negative symptom currently, or if you had any type of knowledge that this patient or a patient that had a history of seizures, weakness, would you note those in this section? As we discussed yesterday, the timeline for documentation of symptoms and the review of symptoms is not always clear. Okay, if we believe that the symptoms are contributory to the patient being injured, well, I imagine that most of my partners and I would document them right here. So for example, if we received a report from the emergency medical services that the patient had suffered a seizure prior to their traumatic injury, we would have noted it here. Thank you. Next is psychiatric. Negative for sleep disturbance, anxiety, memory loss, disorientation, inattention, and feelings of depression. Oh, Natalie. I think it's time for the Free Mackenzie Shirilla tour to end because they are right now discrediting every single thing. Oh, okay. And the last one is hemometalogic, lymphatic. Oh, she was negative for anemia, bruising, or bleeding. And I'm sorry, the last section is endocrine. Endocrine? Wait a minute. Where's my highlighter? I think I'm sharing our friends, so I can't highlight it. And I'm sorry, the last section is endocrine. Negative review of symptoms is what's documented here. Thank you, doctor. The next section is basic labs. Do you see that? I do see that. Okay. If you could explain as far as a trauma patient, how you decide what his basic lab is. So when a patient arrives at MetroHealth for trauma evaluation, there's a standard set of labs that we get on virtually every patient. That's what's been documented in the basic labs. Okay, doctor, we're going to go through these labs starting with page 16 through page 18. I'm going to draw your attention here. There are a lot of labs on these pages. If you could you explain, starting with the first lab, what you see here that is not normal for Miss Shirilla, that does not come back to normal standards for a normal person who did not suffer interrupted. So the first lab value that is documented under the basic, this doctor's over it. She's like, look, I know what you're about to say, and I'm going to tell you. The basic lab section that's flagged as abnormal in the basic metabolic panel. That's the glucose result, which is 167. And that's high for our laboratory. Okay, and just for the sake of rephrasing or re-questioning my question, I'm going to ask you. I'm going to draw your attention up. Do you see that? I do. Okay, I asked you if there are any results here that are abnormal. Let me first ask you with regards to ethanol. What is a normal value for ethanol in an individual? Our laboratory value is less than 10. Okay, so if you're less than 10, that means that there is none or little ethanol detected in your system. Is that correct? Detected in the patient's blood as determined by our lab. Okay, what was the result for Mackenzie? Mackenzie Shirilla, her ethanol level. It's documented as being less than 10. Okay, do you see where it says reference? Yep. What does it say there? Non-detected. Okay, thank you. Wait, what's that? Oh, the ethanol is the alcohol or something? Okay, let's get back to my first question, doctor. You said the first lab here is abnormal or high is under the basic metabolic panel. That's on page 17. Is that correct? And you said that the glucose level was high. Is that correct? It is documented as being high. Yes, that's correct. What else is next on here that you see as abnormal? The next value we have documented here as being abnormal is the lactate listed under lactate. Wait, I know this word. Lactic acid. Can you explain why that's abnormal? The reference range for a laboratory of normal is 0.5 to 2 something per liters of blood. I'm just disappearing so that you guys, or I'm just got off camera. Okay. The value that, okay, so the reference range for a laboratory of normal is 0.5 to 2 mill something liters per blood. The value that was returned was 3.7, so that is high. Okay, and next. I don't see any of the other lab abnormalities. Why can't I pronounce on this page? I'm going to turn to the next page. Please do that. Page 18 for the record. Thank you. The next values that I see as being abnormal on page 18 are listed under the hepatic, I don't know how to pronounce it, function panel. These numbers are ALT and AST. Those are the liver enzymes. Oh, okay. If you could explain why those liver enzymes are abnormal. Liver enzymes can be abnormal for many reasons, including traumatic injury. Okay, and next, please. The next set of values listed as being abnormal are the complete blood count with differential. The white blood cell count is listed as being abnormally high. Thank you. An additional value that is abnormal is the hemoglobin of 12.3, which is listed as being low. Okay, thanks. The next value after that being listed as abnormal is the neutrophil. That's 81%. The next number after that is listed as being abnormally high is the neutrophil number, which is listed as being 16. And the next number after that that's listed as being abnormal is the lymph node count, which is 15. That's low. Doctor, what are neutrophils? Neutrophils. Neutrophils are the type of white blood cells in our body. Okay. And lymphocytes are another type of white blood cell. I bet you the nurses or doctors in here are like, wanting to rip out their hair. Sorry, guys. Doctor, these levels that you just described, high glucose, high lactates, high kidney levels or enzyme levels, high white blood cells, high neutrophils, low hemoglobin, and low lymph nodes, something, are a result that could be consistent with an individual that suffered a traumatic injury in a motorcycle, in a motor vehicle. Yes, ma'am. Okay, wait. Now we're back to the female? I don't know. We're on the same page, doctor. Page 18. I'll direct your attention to radiology. Do you see what I'm looking at? Okay, a CT of the head. What's a CT? A CT stands for computed tomography. It's a machine that uses many x-rays to generate 2D picture of a patient's body part. Okay. Oh, is that normally known as a CAT scan? Yeah, that's commonly known as CAT scan. With regard to the CAT scan of the head, would you start with the injury found? Was there an injury found? Nope. Underneath the findings, it says no accurate intracranial abnormalities. Do you see that? I do. What does acute intracranial abnormalities mean? It means that as reviewed, okay, there was nothing wrong with her head. There was nothing to see on the CAT scan of the head that indicated an acute traumatic injury. Poor Kendall. If you did a CAT scan of the head, doctor, would that reflect ongoing disease that was occurring in the head or the brain? Oh, I see where they're going with this. A CAT scan may not always detect an ongoing disease at the time in a patient's head, but if a person suffered a stroke, would you be able to, might you be able to see those results? It's possible that we could see that on a CAT scan. Okay, and again, there's nothing here noted here or seen. Yep, that's correct. There was nothing there. CAT scan of the face. Could you briefly describe, were there any injuries found? According to this document, no. Okay, what about the testing of her neck? According to this document, are you referring to the CT anagram of the neck? Yes, the CTA of the neck. According to this document, yes, an injury was found. And what was that injury? Bilateral internal carotid and left vertebral artery dissections. And can you explain in layman? Yeah, can you explain that to me? I don't speak doctor. Sure. Sometimes there are certain injury patterns that can cause the stretching of the arteries, carotid and vertebral arteries. These arteries are the arteries that feed blood from the body to the head and the brain. Sometimes when these arteries are stretched during the course of a traumatic event, the lining of the blood vessel can tear, and that's what's detected here in the CAT scan. Wait, so she didn't break her C? Wait, is Natalie dumb enough to lie to the detective? Well, yeah. Okay, and again, what's the injury that's consistent with a motor vehicle? Oh, and again, is that an injury? So these are just stretching of the arteries, and I don't mean to downplay it, but this is not saying anything about a broken vertebrae. Remember, Natalie? Well, anyway. Okay, doctor. The next page. On the same page, do you see a CT finding? I do. Was there an injury found? Can you explain for the court, please, what that injury means in layman's terms? So okay. The documented finding here isn't, I don't even know what any of these words are. Okay, there's a fracture, I get that one, of the left, I don't know, and I am so sorry. The human skull connects to the first, okay, maybe this is where the broken to the first cervical vertebrae. The human skull connects to the first cervical vertebrae at the something very doctor. There's a left one and a right one. In this situation, the left one was fractured. Okay. So Natalie didn't lie to the detective. Okay. Got it. Thank you. Doctor, I'm going to bring your attention down to where it says CT left knee. What do you see? Yeah. Do you see that? Were there any fractures in regard to the left knee? The CAT scan did not document a fracture of the left knee. Oh. It says CT right knee impression. What does that say? Fairly displaced, severely comminuted fracture of the, some more doctor language. We're going to wait till it gets to layman terms. The far end of the femur bone was fractured. Oh, gross. That sounds painful. Okay, and lastly, it says CT right elbow. Do you see that? If you could read what the CT right elbow says underneath it. Yikes. This does sound gross. Displaced T-shaped fracture of the humerus with a 45-degree rotation of the doctor words, minimally displaced fracture of the sublime cervical. Okay, was there a fracture or a break in the elbow? He's like, can you talk to me the way I understand it? Yeah, that's what it means in layman's terms. Okay, so she broke her elbow. Thanks. Oh, okay. Doctor, in your view of these medical records, did you come to learn as you were reviewing these medical records if there was ever surgery performed on first Mackenzie Shirilla's knees? What? I don't think he meant first, but yeah, I believe there was a surgery performed on her knee. Did you come to find that there was a surgery Oh, okay, I'm sorry. So looking back on it now. In your view of these medical records, did you come to learn as you were reviewing these for court, was there a surgery performed on her knees? Yes. Did you come to find that there was surgery performed on her elbow? I believe on review of her records that there was surgery on her elbow. And for the record, you did not perform these surgeries. Is that correct? Yes, that's correct. Doctor, with regards to the medical records, are you aware if there were any referrals made after? Strike that. Let me rephrase. Were there any referrals for any kind of follow-up on her cardiac or her heart system? Are you aware of that? No, I'm not aware of it, but it certainly could have happened. Okay, same thing for neurological. Are you aware if she was referred to? I am not. Okay, I know this is going to be kind of hard, but I'm going to hop forward in your book to page 360. Mr. McDonald, just think of the Muppets. What page? Page 360. Thank you. Just let me know when you're there. Okay. On page, thank you, doctor, on page 360, I'm looking at the top of, could you see where the box, where it says neurological exam? There's a box on that page. Do you see that? I do. Okay. And do you see where it says neurological exam? I do. I'm going to reference where it says level of, I'm sorry, strike that. First, I'm going to draw your attention to the upper left-hand corner. Do you see a date and a time on that document, doctor? It looks like the date and time is July 31st at 7:24. Okay, thanks. So July 31st, 2022 at 7:24. Wow, this is amazing how fast they got them. Like an hour, I guess that would make sense. An hour after she was extracted, put on flight for life, flown to the hospital. They've done all of these things, you know, tests. It could just be a visual test, but in like, it's been an hour, not even an hour. Okay. Underneath it says neurological exam, level of consciousness. Can you read that on the record, what it says? Alert. Okay. Paralyzed? Nope. Okay. It says neuro comments. Is that correct? The words neuro comments do appear. And what does it say next to those words? Alert, oriented to the name and current circumstances, but without recall of collision. Okay. I'm going to direct you all the way down to that box, doctor. Do you see where it says mental status? Yeah, at the very bottom. Yes, at the very bottom. I do see the words mental status. And what are the words next to the words mental status? If you could read those for the record, please. Oriented person, oriented place, oriented time. Oh, so this must have been the test. They oriented her to the place, the time, and the event. Thank you. Doctor, on the next page, page 361, I'll draw your attention all the way to the bottom of that page, where underneath where it says addendum. Do you see that? Okay, if you could read for the record, please. What is the date and time of this addendum? The date and time is listed as being July 31st, 2022 at 9:08 Eastern EST, Eastern Standard Time. And the comment section starts, 17-year-old female, is that correct? Yes. Could you read that? 17-year-old female, apparent driver of car, collided against. Okay. So now if you go to the next page, page 362, do you see where it says, okay, patient without recall. Sorry, it's very small. It's just the next portion of the page. Patient without recall of circumstances or timing of collision. Do you see that? If you could just start, you can start reading from the top of that page. Okay. Building with heavy vehicular damage. 2 other occupants unalived per EMS. Unknown time of accident. Found by passerby sometime later. Patient without recall of circumstances or timing of collision. Would you like me to continue? Oh yeah, I do. Unknown LOC, which is an abbreviation for loss of consciousness. Okay. Brief extraction from entrapment by an ambulance briefly prior to our arrival on the scene. Patients awake, alert, appropriate, clearly articulating verbal responses, and reliably following commands. Complaining of pain with movement of the right knee or right elbow associated with they're obviously broken, but intact sensory. But other than when they move her right side, chest and pelvis benign. Okay, do you see page 363? Yep. And what is documented here on page 363, as far as you know? What this test is? What does this test reflect? What is it? It appears to be an electrocardiogram. Okay. EKG? Yeah, it's an EKG. And what does an EKG monitor? It's an evaluation of the electrical activity within the heart. Okay. And what were the results of the EKG for Mackenzie? To me, this appears to be normal. Okay. Thank you. And again, this is July 31st of 2022. Is that correct? Yep, that's correct. Thank you. Now we're going to flip over to page 372. Are you there? Okay, now we're here on page 372. Do you see the middle of the page where it says interval history events? Do you see that? Yep, I see it. And what is this section? When our division documents a daily progress note on the patient, we like to keep a little section updated with how the patient came to be at the hospital, how it came to be in our service, and the relevant events that have transpired since admission. And under hospital course, okay, do you see right here under hospital course? Yeah, at the bottom where it says 8-6, oh God, they're confirming her birthday like 100 million times, 8-6-22. I do. Okay, at the bottom where it says 8-6-2022, do you see that relevant event? I do. And what relevant event is noted there on 8-6-2022? Could you read what it says for the record, please? Patients in, okay, so this happened on the 31st, and about a week later, the patient insisted that she goes to her deceased boyfriend's funeral on 8-7. So, oh boy. The patient wants to go to Dom's funeral. She threatened to leave against medical advice or unalive herself if she's not allowed to go. Multiple attempts were made to redirect and reason with her that were unsuccessful. Well, thanks, doctor. Doctor, we're almost done. My next couple of questions are based off of the medical records, number 2 in the binder. If I can draw your attention to that. Is this Exhibit 8? That is Exhibit 8, yes. Are you on State's Exhibit 8, doctor? I am. You see, as far as the State's Exhibit 8, doctor, the front page, is that the certification page or another certification page as you described prior? Yep. I'm going to draw your attention, if you could, to the page starting to page 46. Just let me know when you get there. Okay, I want to draw your attention to the bottom of page 46 where it starts to read art therapy notes. Do you see that? Okay, and if you could, doctor, starting with the narrative note where it says narrative note, art therapist, can you please read into the record what the medical record reflects underneath the narrative note? Oh no, Mackenzie, you're screwed. God, I cannot believe it. Art therapist. Okay, this is what the note says. Our therapist entered the room. The patient was getting into bed from nursing care and presenting as frustrated. The art therapist introduced self-therapy service, role, and benefit to the patient and her mother. Ugh, God. The patient initially accepted. On the next page, could you continue? She declined art therapy service at this time, but she agreed to a discussion. Our therapist attempted to begin session with a structured intervention for the patient to color a coffee filter, leaf cutouts with marker. Oh, so she okay, got it. She's there to do a job. She wants her to just color. Patient stated she would be interested in attempting to color and then declined to focus due to her grief. Okay, so technically this is the second time we've ever heard of Mackenzie coloring. The other one was the night of the accident. Patient then became tearful. All right, does this have a date? Sorry, I missed the date. Oh, there is no date. Okay. All right. Patient, okay, so there wasn't a date. I'm just going to assume that it's the same date as the last one. Patient shared feelings. Okay, patient became tearful, processing heavy loss and depression since her accident. Patient shared feelings of grief, guilt, and shame. Patient stated she wanted to unalive herself, well, die, and that it was her fault that she killed her boyfriend. Our therapist acknowledged these feelings as normal and part of grieving, and also noted the blame patient and noting the blame the patient was putting on herself. Thanks, doctor. And the last page I would like to direct your attention to here is page 50. I'm going to draw your attention about halfway through underneath where it says narrative. Could you start with at beginning of the session? Do you see that? Okay, can you just read starting from there? AT began session. Okay, so art therapist began session with a structured intervention for patient to engage with coloring coffee filter paper for building verbal engagement and processing grief. Patient made independent choice of color and composition, choosing blues and greens for a maple leaf. She stated the design represented a pot leaf. What? Mackenzie? Oh. Patient began. Oh, I'm sorry, doctor. Can you go on to the next page if you could, please? Oh, man. There's part of that note. I'm going to pick up with you where it starts to say, it's the last one of that section. Parent created artwork. If you could start there. Patient responded to art therapy with goals related to increased self-expression. And she keeps saying, I'm sorry. And so I was reading ahead. Okay, patient responded to art therapy with goals related to increased self-expression. I'm sorry. That's okay. It says patient created artwork. I am so sorry. That's okay. Patient created artwork depicting a marijuana leaf with a heart in the center. Okay, thank you. Doctor, overall, as far as your review of these medical records, did all of these injuries that were observed by you that Ms. Shirilla had, were those injuries consistent with a motor vehicle crash? Yeah. Along with her blood work. They were. Doctor, while you were treating this individual, did you yourself observe any indication of any emergent situation or an illness that could have affected this car crash, that could have caused this car crash? Oh, he's about to discredit her POTS thing. Based on my evaluation of Ms. Shirilla on July 31st, I did not find any reason for her to have crashed her car. Thank you, doctor. Nothing further. Oh, damn. Natalie. Oh, where's my Muppet thing? I feel like I need a Muppet on here. Because now we're going to the Muppets. For one moment, I am going to let you guys watch the Muppets. I think the Muppets just fit this situation. All right, so where are we? We're just gonna scroll past the break. Courts in recess. Okay, we're back on the record in the matter of the state of Ohio versus Mackenzie Shirilla in case number 2211363. The doctor remains on the stand. Mr. McDonald, you may inquire. Thank you, Your Honor. Doctor, my name is Jim McDonald. How are you doing? What? My name is Jim McDonald. How are you doing this afternoon? Question, answer. How are you? And then he says, not so well, I guess. You're doing okay. Wait a minute. That's like, what a weird thing to say. So the doctor literally, this Muppet, Jim McDonald, literally says, how are you doing? You know, everyone's supposed to just say fine, especially while under oath. She's like, I'm fine. How are you? He's like, I'm not so well. Okay. I'm going to ask you a series of questions. If at any time you don't understand, just let me know. How much time did you spend with Mackenzie? I don't recall. Could it have been as little as 5 minutes? It could have been. Okay. You're working all the time and you just simply can't remember this particular case, right? I don't remember this particular case well. Okay. I noticed in the records and the specific pages that you were directed to, there was, oh, excuse me, Jim McDonald. This is good. There was POTS written down, but you weren't asked any questions about that, right? I do not recall being asked any questions about POTS today. What is POTS? I believe that it's referring to postural, okay, no disrespect to anyone who has POTS or knows someone who has POTS, but we're just going to keep calling it POTS. And if you would like a deep dive, Nate Eaton, not Nate Eaton. Who's the other kid? Brian Enton interviewed a woman with POTS. It's a disease. Okay, POTS is a disease in which a patient sometimes have low blood pressure and a high heart rate. You know why they didn't do it? Because the only person who verified it was Natalie. It's not a disease I treat, so I don't know. Would you agree that some of the symptoms are lightheadedness? It could be. With fainting, it's possible. Difficulty thinking, it could be. And concentrating, that's possible. Fatigue, it could be. Headache, that's possible. Okay. Blurry vision, palpitations, tremor, nausea. You were asked some questions about seizures. Oh, we know about seizures, and we know how to say it in Carney Talk. Someone could have a seizure and 5 minutes later appear to be normal, right? Yeah, I think that's possible. Not only, now, okay, so the attorney went from being an attorney to a doctor. Not only is it possible, but it's not even abnormal. I would object. Objection. You're not a doctor. I would not be able to answer that question in the affirmative. Okay. And is that because that's outside the scope? Yeah. And it's outside of yours too, McDonald. Because, okay, what's the scope of your expertise? I'm a surgeon. Didn't you hear me? I'm a board certified surgical critical care. I'm a certified general surgeon. I have more education than you, Mr. McDonald. Don't F with the doctors. Okay, and board certified means you're not only a good doctor, but you took a test and you're better than most. Oh my God, he is insufferable. It means I completed a course of training that allowed me to sit for a certification exam that I passed. Okay, you're a surgeon. That's correct. Okay, blood oxygen of 82. Does that signify to, what does that signify to you? What are the units of the 82 out of 100? When they give you that, you put so you mean a blood oxygen saturation of 82%? Thank you, yes. What does that mean to you? That seems low. I think Mackenzie is about to become her lawyer because this is like, all right, Mackenzie's voice. We're going to channel Mackenzie's voice for the lawyer because this is like too much. Okay, so, all right, Mackenzie, we're going to channel you for this. I wish I had a stand-up desk. So, all right, so I need a break. I'm coming over to say hello to you guys. These questions are hard. Coming over. Hello, my lovely dear friends. Whoa, hi, everyone. Hello, welcome. Wow. Hi, everyone. Claudia injects some common sense. Oh, you and your 3 friends have POTS? Kate, maybe you're picking up on her symptoms as you're reading it. Oh, maybe. Hi, Jamie. Hi, Debbie. Oh, here we have someone who actually has POTS. Miss injects some common sense. Please help us. Okay, wait. I just saw the thing. Hi, Claudia. Oh, high anxiety, hypervent. Dude, my chest was so tight. I wonder if that's what it was, Jamie. I don't know, but it was so tight. I couldn't catch my breath. Gotta run, Cheryl with an S. Have a great night. We love you. Okay, wait. I saw a comment that said, I have POTS. I think it's inject some common sense. I'm going to post these inject so we can all learn from you. Okay. Sharon, I think we did find a lacerated surgery. Who was it? Inject. If you're the one with POTS, can you leave that comment again? I can't find it. These are I'm very excited that I can't find it, but I thought I saw. Okay, it has to be you. I thought I saw someone say, I have POTS, and I wanted to post your comments so we can all learn from you. Okay. Oh, wait, I found it. Okay, here we go. Now we're going to learn from someone who really has POTS. Okay, inject some common sense. Thanks for jumping in. All right, so we have POTS. And then it says, okay, we have so many questions about POTS. Claudia asked, is there any kind of a warning when you're going to black out? Do you drive? Kate, maybe. Oh, yes, Jamie, thank you. I think you're right. And then Inject said, I don't drive long distances anymore. I was told I had an anxiety attack while driving years ago. It made me panic, but it could happen again. I was afraid to drive. Finally, diagnosed with POTS 18 years later. Wow. I had a few years of high anxiety. Okay, hyperventilate. It's a very complex. Okay. I'm just putting this. It's a very complex. I would Google that. Me too. I don't even know how to pronounce it. I have good days and no go days. So you have good days and bad days. And if I have a problem, my heart rate goes up, not down. It's okay. Wait, where did the next comment go? I would think marijuana would be excellent for POTS. Most people with POTS don't drive for fun. I used to. It relaxed me. But if something happened, you'd go limp. You would not stiffen. And yes, you definitely have a warning. So my blood pools. Heart will race. It's called a tachycardia. To get the blood back up to the brain, blood pressure can vary depending on the type of POTS. We are heat intolerant, and it can make us very ill. Oh. Okay, she'd be in prison without air conditioning, and she's doing fine. Oh, yeah, good point. Interesting about the heat. Excellent point. There is no heat in jail. Hi, Dom. Welcome. This is wild. Well, I thought we did read that she had a neck thing. Remember? Hold on, I'll find it. I thought we read that something did happen to her neck. Except if it did, they blew right over it. I don't know. I thought we did that. I don't remember now. Okay, this is wild. All right. Oh, so Phil, welcome. Bobby, just in case you're listening in the background, we're learning about POTS from someone who actually has it, not pretend. And I don't know if she pretend has it or not, but okay. It's been said. All right, so I'm reading these in case you're not watching. So she's in prison doing fine without air conditioning. It's also been said by several people during 100 degrees she's outside. Oh, she's laying outside in the heat with baby oil on. Yes, and she did have a femur fracture. Okay. They have it down to a science. Things can happen very quickly. Watching the rest tomorrow. Good night, Danby. Oh, it's 1 a.m. Good night. Sweet dreams. Good night. Okay. Oh, everyone's trying to help me pronounce. Thank you. I appreciate you guys. Okay. Claudia, I'm convinced. Okay. She has anger management. Okay. Thank you very much. Inject some. Hi, freedom fighter. Low test Steve. Yes. Yes. Low test Steve won't be able to say there's no smoking gun here. The transcripts are awesome. I agree. Holy smokes. Can you believe that they're going on their free Mackenzie Shirilla tour? And our friend that found these or had them, I don't know where she found them. And if you're in here, claim your fame. But she sent them over and everything. Okay, remember when we wanted to help Chris Cuomo discredit Natalie? Now all we need is the transcript. And you could just put it into the PDF, be like, oh, she says this, and it's not there. Hi, Freedom. Yes. Okay. Their heat. Okay, so POTS makes you heat intolerant. Oh, Bobby's here. Wow. Oh, Bobby, if you're depressed. Oh, is he at the vet still? Oh, boo. Can everyone send love and light to Bobby's puppy? His buddy is needing a lot of love and light. Oh, Bobby's here. Okay, so our friend inject some common sense. Oh, that's a good name. Has POTS, and so do her sons. They're heat intolerant. So Mackenzie laying out on the jail, like on the yard with her baby powder or baby powder. Her baby oil is like not realistic. Okay, Lisa Jackson will be back. Oh, they're both at the vet for a week. Oh, Bobby. Boo Bear. I'm sorry. All right. Well, now that we're all up to date on POTS and we spoke to someone who actually has it, thank you very much for injecting common sense into this. Oh, that name goes well with this too. I appreciate you. And now I think we're going to have to just read these as Mackenzie. And if you hate the Mackenzie voice, I am sorry, but I don't think I can read them with all I can think, literally all I think. So if you guys don't mind, I think we're going to channel Mackenzie because it'll just make this defense attorney seem much more fun. Otherwise, this might be really long. All right. Well, here we go. I'm going to take a drink. I might go off camera too because here we go. Actually, I'm just going to run to the ladies' room. You know where. I'll be right back. Oh, no. There's no audio. Wait. Can you hear me now? Oh, no. Oh no. Can you guys hear me now? Oh, phew. Okay. Whew. Oh, thank God. Thanks, Kendall. Someone just texted me, and one of our friends, one of our lovely dear friends, Kendall, just texted me and said she couldn't hear me. Oh, thank you. All right, we didn't get very far. That would have sucked. Okay, phew. Now, oh, well, that was a warm up. Oh, darn. Her, a lawyer is as insufferable as she is. Well, thank you everyone for letting me know. Thank you for putting it in the comments. I'm going to move my thing over here. Oh, phew. Okay. That would have been a long day. God, that would have sucked. Okay. And her lawyer so far is as insufferable as she is. So let me get back to where we were. Thank you guys so much for the heads up. Man, flying Conair is an adventure. You never know what's going to happen. Sometimes the cockpit loses. All right, wait a second. We've gone through this. Oh, he is insufferable. Not as bad, well, pretty much as bad as she is. All right, here we go. Ooh, I'm going to stay right here so I can read the chat. Yes, I can't really read the chat because then I get caught up in the chat and not in what we're reading. I love reading the chat. Okay. I have the chat right here now, and I have my phone over here, and all right, here we go. It's going to be fun. Okay. He is as insufferable so far as she is, which you would expect. I mean, she did hire him and paid for him. Oh boy. Okay. I'll make myself small. And I'll just make myself go away. All right. Take two. Here we go. All right. Oh, I need a drink. He's insufferable. Not really. This will be fun. Okay. Thank you guys so much for flying Conair. Please sit back, relax. We have blue skies ahead, and we are channeling our inner Mackenzie up here in the cockpit. Okay. All right, wait a second. I just want to make sure I'm in the right spot. Okay. There's something about an 82, though. Sorry, I know some people don't like it when I scroll, so I'll bring myself back for rather look here. I'll bring myself back. You know, it's really cool. This is random, but my sister wears Miss Dior, and I absolutely love it. And we went shopping the other day, and I sprayed it on this sweatshirt from a store, and now it smells so good. All right, so, oh, where is she? Okay, we got to the POTS part. You guys heard, wait, hold on. You guys heard the POTS part, the real part, right? I'm assuming you did. Because we were somewhere around, there's something about an 82. Oh, it must have been a blood pressure thing. Okay, here we go. Found us. All right. Okay. Whew. Here we go. Oh. All right. Okay, this is, so if you're coming in, welcome in. If you've been here, welcome. We are using Mackenzie's voice as her lawyer and normal voice, like, for the answers. So the questions are her parent is the Mackenzie voice, and the A is the answers. Someone can have a seizure and 5 minutes later appear to be normal, right? Yeah, I think that's possible. Not only is it possible, but it's not abnormal. I would not be able to answer that question in the affirmative. Okay, and is that because it's outside the scope of your area of expertise? Yep, that's correct. Because what is the scope of your area of expertise? I'm board certified in general surgery, and I'm also board certified in surgical critical care. Okay. And board certified means that you're not only a good doctor, but you took a test and you're better than most doctors because you passed that test, right? No, it means that I completed a course of training that allowed me to sit for a certification exam that I passed. Okay, and you're a surgeon? That's correct. Okay, blood oxygen of 82. What does that signify to you? What are the units for the 82? Out of 100, when they give you that, you put so you mean a blood oxygen saturation of 82%? Yeah, thank you. Yes. What does that mean to you? That seems low. That's really low, right? Well, it seems low for a normal adult human being. Okay, how many people do you think you've treated in the emergency room over the course of your career? Hundreds or more? Hundreds or more? Hundreds would mean that you work 250 days a year. You've been doing surgery for how long now? I've been in practice since 2017. That's 7 years. So you worked over 1,000 days, right? Yeah. Okay. And you've seen approximately how many patients on an average day? On an average day, it could be as few as 0 and as many as, I'm sure there's a day I've seen 30 or more. Okay, so let's just go to the middle and say 15 and on an average day. Fine, that's sure. So 15 times 1,000 is 15,000 people you've seen, right? Would you accept sure, that sounds reasonable. Okay, how many people have you seen with a pulse ox of 82? Well, that's a very specific number, and I'm not going to testify under oath to how many people I've seen with the exact number of 82. Well, I'm not asking for an exact number. Give us your best guess. Well, I'm sure I've seen many people with an oxygen saturation of 82. So out of the 15,000 people, you've seen maybe 10, right? I think I've seen more than that. More than 20? I think I've seen more than that. More than 30? I think I've seen more than that. I mean, we could keep going, or you could just tell me what the number is that you think to the best of your ability. Well, I don't feel comfortable swearing one way or another. I'm under oath. I think I've seen a number of people with an oxygen saturation of 82 at some point in their hospital stay. Like less than 100? Oh, Your Honor, objection. Overruled. It might be more than 100. So is it rare? In my line of work, a low oxygen saturation is not necessarily uncommon because the patients that we see are critically injured or ill. And one of the things that can happen when you're critically ill is that your oxygen saturation can be low. So you were asked some questions about drugs. Yeah, I was asked some questions about drugs. About mushrooms, right? I was asked to read a line containing the word mushroom. What, if anything, do you know about mushrooms? They're fungi. It's also a slang term for some type of drug that are obtained illegally. Are they hallucinogenics, right? The substance that are used as illicit drugs, I think, can be hallucinogenic based on what I've heard. Sure. And learned being in the emergency room and in your studies? Yeah, that's correct. And it makes people hallucinate, right? Yeah, sure, it can make people hallucinate. Now, you talked a lot. You testified for about an hour. And wouldn't it be fair to say that for most of it, you have no independent recollection of what you testified to? Objection. God, somebody object. Well, there are things that I testified to today that I do not have independent recollection of. That's correct. And certainly don't know how that information was put into these medical records. Well, it was probably typed or dictated into the medical record. But you don't know who provided that information. The notes have an author. Okay. Which implies that they're the person who put it into the medical record. Is your name anywhere on there as the author of any of these notes? Yes. For how many pages? I don't know how many, approximately. I don't know how many pages it comes out to when printed on a piece of paper. But you don't know how the information was received or when, right? In general. In all of her medical records, sir? Yes, that's correct. Well, some of the information documented in the medical record would have been generated by our laboratory or by our radiology department. Some of the information in the medical record would have been written in there by the staff at MetroHealth Medical Center providing care to Ms. Shirilla. There are documents listed in this medical record which seem to have been scanned in from EMS run sheets, for example. Well, you were asked to read portions where the record said that Mackenzie had no recollection, right? I did read those words. Yeah. And it was consistent throughout the medical records that she had no recall of the event, right? I did not review every single page listed in these two binders, but from the selections that I reviewed today in the court, that is correct. But that's not abnormal as it relates to someone who is involved in a serious accident, right? It is not abnormal. That's correct. And in fact, it's actually typical. I don't know if I would describe it as typical. Many patients come to us having a perfect recall of the traumatic event in which they were involved. Oh, snap. Oh, girl, that was good. That was perfect. And other patients do not. Well, you talked about some reads blood levels that were abnormal, right? I did talk about that. Were any of those readings consistent with someone who has POTS? POTS is outside my scope of practice, so I do not know. Okay, high glucose. Does that mean that you have high blood sugar and that you're likely to faint or could faint? It means that your blood sugar is high. Oh, this doctor is not playing. And how many people faint when they have high blood pressure? And do many people faint when they have high blood pressure? That is not the case in my experience. Okay. Then finally, you were asked about some art therapy notes and a patient insisting that they go to the funeral, right? Yes, I did read those things. And you read them? Yes, I did. Thank you. No further questions. Any redirect? Yes, Your Honor, just briefly. Doctor, counsel just asked you several times about the 82 or 83 blood oxygen level. Is that correct? Yeah, he did. Okay, let me just reiterate. Your response to that was in your realm of trauma. 82 or 83 is not uncommon for blood oxygen. Is that correct? It's not necessarily uncommon. Yeah, that's right. Okay, if you recall, when you were going through the medical records, doctor, I had you read from your medical records that a blood oxygen level of 98. Do you remember that? Yeah, I do remember. And do you remember that it was on July 31st at 7:44 in the morning? I do recall reading that. Yes, thank you. And counsel asked you a couple of questions about POTS. Do you recall when you were reading through the medical records, the section where it says medical history and it said POTS for mother? Do you remember reading that? What? Natalie has POTS? Yep, I remember. Okay. Do you remember describing that it was information that would have been provided? Oh, information provided by the mother. Is that correct? Yes. Okay. With regards to the mother providing that information, did it say in that section per EMS, POTS with medical history? I'm sorry, one more time. Did it say in that section for reporting medical history where it said POTS for mother, did it say that the POTS was reported by the ENT that transported her to the hospital? Did it say they reported it? Nope, those words do not appear in that document. Did it say that the patient herself reported the history of this? Nope, it doesn't. Nope, I don't think it said that either. Okay, and did any other doctor or any other medical record indicate that this was a history? Nope, no, thank you. And again, the last question, doctor. I may have asked you this. You reviewed many neurological testing, an EKG, there was blood pressure taken. Is that correct? I think you read 2 portions where there was blood pressure that was taken in the morning. Yep, that's correct. And you note that the blood pressure was normal. There was at least 1 blood pressure reading that was normal, and there was at least 1 blood pressure reading that was abnormal. Okay, and with regards to her heart and her neurologic testing, objection. Do you recall that was normal? Overruled. Man, they did not go to the Amber Heard, who is Johnny Depp's lawyer, the badass one who said, please stop all talking after I object. Do you recall that was normal? Overruled. I do not recall reading anything in the record suggesting that her heart, what was the other organ you asked me about? Her neurological system. And her neurological systems were normal? And her neurological systems were normal. Both of her systems were normal. You said you did not recall reading. I do not recall reading anything in the medical record documenting that her heart or her neurological systems were abnormal other than this diagnosis of POTS provided by her mother. Is that correct? And that the history of POTS was provided by her mother. So no other doctor or ENT on the scene provided that information. Is that correct? To the best of my knowledge, on July 31st. Thank you, doctor. Nothing further. Mr. McDonald, anything else? Nothing. Oh, wait. Mr. McDonald, anything else? Nothing. Doctor, thank you so much. Okay. All right. So the doctor is off the stand. Do you want to come gather these exhibits, please? Is she getting the next witness? Who is it? The next witness is, Your Honor, the state calls Sergeant Adam McQuaid. Hello, okay, hello. He's getting sworn in. He's a sergeant. Oh, sidebar. We're back on the record. Okay. Present in the courtroom. We're back. Oh, wait. Bring the jury. Oh, I wish I had that clip of from Alex Murdaugh's case that Emily D. Baker has. We have a sidebar. Okay, so let's see here. Present in the courtroom are all of the assistant prosecuting attorneys that have been attending throughout the course of the trial. Attorney James McDonald with his client, Mackenzie Shirilla, as well as Shirilla's mother, of course. We did have a sidebar, and Mr. McDonald, based on the information from the sidebar, you had a conversation with your client. Would you like to place that information in front of me? Sure, Your Honor. Oh, sure, Your Honor. May it please the court. The prosecutors kindly provided me with report number 2208677, Strongsville Police DVR analysis. I neglected to read the bottom. Whose fault is that? This sounds like her appellate attorneys. I neglected to read the bottom part. Whose fault is that? I neglected to read the bottom part of that page where it says Sergeant Adam McQuaid, who is a Brooklyn police officer and works with other clients and other cities to do this type of work. I am the Wait a minute. Her defense attorney is the current prosecutor for the city of Brooklyn. Why would you hire him for defense? Okay, wait. Hold on. This is awesome. Hold on. Oh, man. Okay. I don't even know what this is awesome. All right. So according to our friend, oh my, I just need to stand up because I'm like cracking up. Okay. So Mackenzie's defense attorney had a sidebar, and he said that he neglected to read the report that the prosecutors gave him until this exact moment. And oopsies, by the way, I am the prosecutor in the same town as this cop. Okay, I can't believe, what an idiot. All right. The prosecutor I can't even read this with Mackenzie's voice because it's so dumb. This is like almost as bad as the appellate thing on a level of embarrassment. I'm not a lawyer, but okay, so they just called up the next witness. We went through the doctor and we met someone else probably, or was she the first witness? And right now, Mackenzie's attorney is putting on the record that the prosecutors gave him a report number 220877, a Strongsville police DVR analysis. I neglected, and he is stating on the record that he didn't read the bottom part of the page where it says that Sergeant Adam McQuaid is a Brooklyn police officer, not Brooklyn, New York, Brooklyn, Ohio, and works with other cities to do this type of work. Oh my God. Do we have any graphics that I could put up? I am the prosecutor presently for the city of Brooklyn. I have dealt with Mr. McQuaid on a number of occasions. This just came to my attention. Oopsies. Whoopsies. That's why I asked to approach the bench. And then I had a conversation with my client, Mackenzie, who's right here, and her stage 5 clinger mother, who's also here. We discussed it, and they would like me to proceed. They understand what the situation is and the relationship. Okay, he is the prosecutor. Why would you ever pay a defense attorney who's a sitting prosecutor? No wonder Christine said he's a prosecutor. She said that. He's a prosecutor. What an idiot. Okay. We discussed it and they want her to do it. We talked about this as soon as we got the report. Okay. All right. So her stage 5 clinger mom is here and he discussed it with them. They would like me to proceed. They understand what the situation is and the relationship. On the other hand, they also realize, and we talked about this as soon as we got the report, that this portion we would have a right to question. Oh my God. If I were the prosecutors, I would be rolling my eyes on the inside. Okay, so this is Judge Lauren. So you don't even plan on, just go outside of your working with this police officer. You weren't even planning on asking him any questions. As long as they ask the 5 things that are in here, fine. Does the state have any objection to a potential conflict? No, we have no objection. They're idiots. Okay, Mackenzie, have you had enough time to... Okay, sorry, this is the court. Okay, Mackenzie, have you had enough time to speak with Mr. McDonald about this with your mother? And do you understand? You can sit down. You don't have to stand, but thank you so much. Do you understand how this could potentially be a conflict? Yes, Your Honor. Okay, and you understand how this could potentially be a conflict because he's representing you, but he also works with that person on a regular basis in a different capacity. Oh my God. This is what Chris Cuomo could have used for the judge. He kept saying, oh, because Cuomo was like, they're not related. Oh, well, they have a working relationship. Okay, Mackenzie agrees. Yep, Your Honor, great idea. Okay, and you've had enough time to speak to your stage 5 clinger mother about this? Yes, Your Honor. Okay, fine. And if for some reason you feel uncomfortable with Mr. McDonald continuing to represent, oh my God, they're giving her another out. Oh. All right. And if for some reason you feel uncomfortable with Mr. McDonald, the Muppet, continuing to represent you, you have the right, because this could potentially be a conflict, to seek a new lawyer. Oh, you guys, I think I need to make a copy of this because I can't. Oh, wait, if I put a comment on this, I don't know how many people this is shared with, but I really want to highlight this. Okay, all right, I'm coming back for a second. This is like beyond awesome. Hi, I'm back. Hi, Lisa Jackson. Okay, I'm going to make a photocopy. I mean, not a photocopy. I'm going to make a copy of this bind over because basically the judge is giving her another out. Like, Mackenzie, this is a conflict of interest. You don't have to take it. Do you need a new lawyer? No, fine. I even asked stage 5. Stage 5 said it was fine. Okay. we are in the bind over. I'm going to make a copy of this so I can highlight it, because I am definitely going to I want to remember this. Thank you for holding. This is so wild. Oh. Hi, Jamie. Hi, everyone. I'm back because I'm making a photocopy. I'm making a copy of this in my Google Doc because our friend that shared it with me, and I didn't realize that there was going to be so many wonderful moments of WTF. Why wouldn't I think that? I don't know, but I want to highlight this, and I also I'm in the Canton cover up for my notes. This is really nuts. I'll recap this. How many outs is this so far? So far, it's just officially technically 1, but I mean, we're only on page 111 of like 500. I mean, we are already, let's flip the switch. We're already on page 500. I mean, we're already on page 111. This is really, I will recap this. If you're just joining us, yep, she should have taken that out. I agree. Okay. Where did the bind over? Oh, you this is really awesome. I don't know why I'm so excited about this. I think basically because it's like, okay, here's the bind over. Well, it also shows the complete incompetency of her attorney. He's like, I didn't read the report the prosecution gave me until the witnesses literally getting sworn in. And he just like skimmed it or something. I don't know how he found it or what, but that Muppets thing. Okay, here's a copy of it. So now we are. Yeah, a new sub. Welcome. Hi, Just Misu. Welcome to the family. We love to have it because we love truth. No, it's not the same lawyer that filed late. This is but basically they're like all the same. And the state, okay, the appellate one was state appointed. It was like but they're paying for this one. They went and got a defense attorney, according to Christine Russo, and I trust her. She hasn't lied to us about anything. Okay. So this is so wild. All right, I just want to make sure I can highlight this. Okay, here we go. Now we're talking. And we are on page 124 of 154. As soon as I get us there, I will. Yeah, this is so awesome. I'm not anti-Mackenzie, but I am pro-truth, and I appreciate truth. Okay. So let's make sure everyone can see this. This is so wild. All right. So we're going to get back to the beginning, and we're going to read this from the beginning. Why do I think this is so awesome? Okay, here, now we're there. No wonder Christine Russo in an interview said she wasn't worried about this lawyer. I know, and Christine even said, I thought it was a past tense thing, like he was a prosecutor. Oh, you guys, do you like the comments on the stage? Do you care? If you don't care, then I'll take them off. If you like them, I'll leave them. Okay, welcome, everyone. If you're just joining us, welcome. Thanks for coming. Thank you so much for being here, liking, sharing, subscribing, doing all the things. We are reading the Mackenzie Shirilla bind over, so juvenile to adult court hearing, the process. In the process of reading this, we are on, I think, witness number 3. We had the doctor, I can't remember before that, and now we have a police officer. The police officer is getting sworn in, and Mackenzie's lawyer asked for a sidebar. When I hear the word sidebar, I think of sidebar, like they do for Karen Reed's case. And they had a sidebar. At the sidebar, hi, Niana Owens, welcome. No, yeah, this is real. If you're not in the, I mean, if you're just listening, this is the perfect one because we're reading court documents. But in the sidebar, it came, he's putting it on the record that he is the acting prosecutor for Brooklyn, not New York, Brooklyn, Ohio, which is a surrounding town that I'm guessing responded to the Strongsville accident. He works on a regular basis with his cop. So, and we're going to reread this. I'm just getting us all caught up so we're on the same page. I'm so glad you're here. Welcome, just me, Sue. That, and hi, Nam Owens, and everyone else that's here. New subs, welcome. Oh, super chats. Keep your girl and yeah, let's get the super chats going. Anyway, the judge asks Mackenzie right now, we're going to reread it. Are you sure you would like to proceed with this attorney? Because this is a conflict of interest and you have the right to a new representation. And Mackenzie and her stage 5 clinger mom said, yeah, no problem. So that is, I didn't realize. And when Christine Russo says this in the interview, she said, I don't even remember the last time he worked a defense case. Like, he's a prosecutor, but I thought for some reason it meant, hey, bet. Oh God, we need that shirt. Maybe we should get coffee mugs that say bet. That's my commitment to you tonight. As long as we're not up until like 3. That's what, on Con Air, it's all a little dependent on what city we land in. So we are going to reread the section where this is for this bind over hearing, the first real out so far that we've gotten for Mackenzie. And who knows how many more we're going to get. But if you hear me reading in Mackenzie's voice, that's because her attorney is also so I cannot believe. All right, so I got us back to that section. And yeah, you don't need me. Oh, wait, I can make that. Oh, I think I can make it bigger. If you would like it bigger, I will check. Okay. Let's see here. Oh, there we go. Hopefully everyone can see that. Okay. Oh, Jamie! You guys, thank you. Thank you, thank you, thank you. We love super chats. We love super chats. I'm singing. Thank you, Boo. You're the best. I love you. Thank you, thank you, thank you. What an awesome surprise. Yes, bet, Your Honor. Oh my gosh, maybe we should get one that says bet, Your Honor. That's a good one. Jamie, thank you. I love you. Oh yeah, do you guys want these comments on the stage? If not, I'm going to delete them. I mean, I'm just hide them, not delete them. And you can read them. Okay, so we're back here. I want a t-shirt that says, I don't need to be really. Yes, 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 yes. Okay, wait. So glad you guys are here. You guys are hilarious and fun. All right, Jamie, thank you. I love you. Hornet Gags wants a t-shirt. This is funny. That says, I don't need to be rehabilitated. What the fuck? And how do you spell eventually? Oh my God, yes, those are all awesome. Those are all awesome. I'm screenshotting this so I remember. Yeah, those are awesome. Oh wait, I'm going to screenshot it and write it on our list so that, wait, what is the other thing that she says? She just said it in that jail call. It was, the mom was like, hella, she's got hella, whatever. Yes, thank you, Jamie. I love you. Yes, on Hornet Tags, I just took a screenshot of that so I don't forget it. Okay, so now we're all on the same page. Everyone can see. I'm hiding. Jamie is the best. I love you guys. Thank you. You're going to go try to grill something. We are portable, Bobby. Just take that little phone or put some headphones in. It'll help. Oh, hella noodles. Yes. Oh, the church visit. Yes, the baptized in the church video. Oh, that's a good one. Oh, yeah. Oh, boy. So many good things. Okay. All right. Hopefully everyone's comfortable and cozy. Bobby's going to grill for us. So pull up a table, a chair. This is a big airplane and there's enough room for all of us. Conair flight crew. Oh my God, yes. Yes. Oh, the mod should have, I wonder if I can make you guys different. Hold on. It feels weird when I can't see you. I feel like I'm talking between something. I wonder if I can make the mods have different icons that, like, I can make you guys an airplane. That would be awesome. I love the Conair flight crew. Thank you for the summary. I came in late and I appreciate the quick catch up. Man, no problem. Sorry if I just butchered your name. Oh, good. I'm glad that you appreciated that. Well, this was so wild. I had to stop everything. Okay, so we are going back in now. And we have, all right. So the court, okay, this is how this happens. Your Honor, the state calls Sergeant Adam McQuaid. Hello. You can come here, get sworn in. You can take a seat. Excuse me. May we approach for a second, Your Honor? Sure. They had a discussion at sidebar. Okay, and Judge Lauren says, the court, we are back on the record in the matter of the state of Ohio versus Mackenzie Shirilla in DL 22-111-363. Present in the courtroom are all of the assistant prosecuting attorneys that have been attending throughout the course of this trial. Attorney James McDonald with his client, Mackenzie Shirilla, as well as her stage 5 clinger mother. We just had a sidebar, and Mr. McDonald, based on the information from the sidebar, you had a conversation with your client. Put it on record, you dumbass. Just kidding. Would you like to put that on record? Sure, Your Honor. May it please the court. The prosecutors kindly provided me with report number 2208677, Strongsville Police DVR analysis. I neglected to read the bottom part of that page where it says that Sergeant Adam McQuaid, who is a Brooklyn police officer and works with other cities to do this type of work. I am the prosecutor for the city of Brooklyn. Oh, wait a minute. Then how did they even get him as a defense attorney? I mean, the lawyer, has done prosecution and defense work. I get that you can do both, but as an acting prosecutor, I just don't. How did Mackenzie get this lawyer? I don't know. I'm the prosecutor for the city of Brooklyn. I've dealt with, I am the prosecutor presently for the city of Brooklyn, and I've dealt with Mr. McQuaid on a number of occasions. This just came to my attention now because I didn't read the report that the state gave me. That's why I asked to approach the bench. And then I had a conversation with my client, Mackenzie, who's right here, and her stage 5 mother, who's also right here. We discussed it, and they would like me to proceed. They understand that the situation is and the relationship. On the other hand, they also realize, and we talked about this as soon as we got the report. No, you didn't. That's a lie. You are an agent of the court. He said, we talked about this as soon as we got the report. No, you just said 2 paragraphs earlier that you didn't read the report. I didn't read that part of the page. You didn't talk about it until Sergeant Adam McQuaid got called as a witness. Those are little things, but now that we found him in a lie, it's like everything sticks out. Okay, we talked about it as soon as Adam got called in as a witness. In this portion, we have a right to question. What? Okay, wait. This is Judge Lauren. So you didn't even plan on questioning him? What? Outside of your working with this police officer, you weren't even planning on asking him any questions? As long as they ask the 5 things that are here. All right. Does the state have any objection to this potential conflict here? No, Mr. Troop. Nope, we're good. No objection here. We're good. Okay, Mackenzie. Have you had enough time to speak with Mr. McDonald about this and your stage 5 clinger mother? And do you understand? Oh, you can go ahead and sit down. You don't have to stand up for this, but thank you. Do you understand how this could potentially be a conflict? Yes, Your Honor. Okay. I talked to my attorney. Oh my God, I can't even believe this. Well, highlighting this one. I also am going to highlight oopsies. I am the prosecutor for the city of Brooklyn. Man, Ohio is like a little mini New York. I am also highlighting I neglected to read the bottom part of that page because how much are you getting paid? Like $2.50 an hour? Like, at least read the police reports, you dummy. Okay. On the other hand, okay, so Mr. Troop. Oh no, we're good. We have no problem. And okay, and you understand how this could potentially be a conflict because he's representing you. But he also works with a person on a regular basis in a different capacity. Yes, Your Honor. Okay, you've had enough time to speak to your stage 5 clinger about this too? Yes, Your Honor. All right. And if for some reason you felt uncomfortable with Mr. McDonald continuing to represent you, you have the right, because this could potentially be a conflict, to seek a new lawyer. Oh my God. Why? I am glad Chris Cuomo could absolutely destroy the Shirillas now. Is that something that you wish to do, or is that something you wish to do, or do you wish to proceed here? I want to keep him. Okay. Keep Mr. McDonald and perceive and waive any potential conflict. They are crossing their T's. Yes. Okay, thank you. And stage 5, same thing? Yeah. Okay, fine. Let's pause the record and get everyone else back in. Oh my gosh. That's why they didn't argue ineffective assistance of counsel in her appeal. She waived it right here. Oh. And I do like the nickname stage 5 for Natalie Shroom. Higgins is a stage 5 clear, if you know anything about the Karen Reed case, and he got that nickname too. Okay, everyone, welcome back. I have got to get that Bring the Jury by that Emily D. Baker from the Alex Murdaugh case. That would be perfect right now. The witness has resumed the stand. Okay, this is the court. All right, we're back on the record. The witness has resumed the stand. I think we only got as far as swearing you in, right? Yep. Okay, so Mr. Troop, you may inquire. This is the direct examination of Sergeant Adam McQuaid. Please introduce yourself to the court. Hi, I'm Adam. I'm with the Brooklyn Police Department. Man, this is really a mini New York. We should start noticing how many New York names. This is the second one, but I can't remember what the first one is. But I'm also the regional coordinator for the regional crash unit that involves 11 cities. Okay, in what capacity are you employed with the Brooklyn Police? I'm a patrol sergeant. And what training and experience? Well, I went to cop camp. Oh, you guys a college degree? I think they should make that mandatory for cops, actually. I think all cops should have a mandatory 4-year education. And I just think that because I don't know, the Nazis did the 2-year program, and look how well that turned out. And that's real. Okay, I have a college degree. Good. Then I went to cop camp. I've taken multiple crash level courses. This is no Paul, Trooper Paul. If you don't know the Karen Reed case, that I just referenced the Karen Reed case. Okay, so he went to college and he went to the cop camp. He took courses. This is no Trooper Paul. Man, Alan Jackson's the smartest defense attorney ever. Okay, advanced anxiety reconstruction and event data. I wonder what that means in reference to a vehicle. And event data recorder analyst school. If this is taught by the FBI, I am going to lose my shit. Okay, and in connection with this case, the crash that happened in Strongsville back in July, what function did you perform in that case? I did the event data recorder analysis. Did you do anything else? No. What I'm showing you on the screen is State's Exhibit 9. Your Honor, okay, so he's bringing him the exhibit. In this document I handed you, okay, so now he's confirming. Exhibit 9 is the crash data retrieval report that was pulled directly from the event data recorder. Okay, Tell us something about that document. What does the document represent? It represents a computer readout of an event that was triggered by the event data recorder in an event that triggered like in a crash or a rollover, or any type of thing that would cause the computer to wake up inside the car. Okay, hold on. I just saw a good question. I'm coming back. Claudia, I'm on my way back. Okay. Well, I'm not an attorney, and I'm not an attorney in Ohio. So I don't actually know the answer to that. It might be a bi-state thing. The question is, I'm hella pleased, Your Honor. Oh my God. Phil, that's a good one. That's a good one. I'm taking a screenshot of that. I'm hella pleased, Your Honor. Yes, that's a good one. You guys, we should do a bingo thing that we could make general across all the cases. Okay. Claudia, this is a great question, and I am not an attorney. If anyone is, well, why don't we just Google it so we're all getting the same information? I'm not going to guess. I am going to take a screenshot of this, and we are just going to Google it together because I don't know the answer, and I don't want to guess it because that's not my area of expertise. And based on my training and experience, I know the government's fucking with us. All right. So we are, I think, well, you know who would, all right, here we go. I'm going to share this with Google, and we are going to check the Google. I'm literally just putting it in exactly as you wrote it. Oh, of course, but it's not there. And yeah, you did read it right. And I don't want to give us the wrong answer. So we're just going to the lawyer, you know this. In Ohio. Sorry, it's not copying and pasting. Okay. In Ohio, how can a sitting prosecutor also be a defense attorney? Let's see what this says. In Ohio, our friend Google said in Ohio, sitting. Oh boy, I don't know. I am sure that this got there, but what it says is in Ohio, a sitting prosecutor cannot defend someone in the same jurisdiction where they prosecute cases. So perhaps it's a different county or something. It creates a direct conflict of interest. However, an attorney can serve as a part-time prosecutor in one county or a municipality while taking on private criminal defense work elsewhere, provided they strictly abide by the state ethical rules. How the dual role works. A part-time prosecutor, many smaller municipalities, villages, and some countries in Ohio, that has to be county. Yeah, counties. I was like, country. Counties in Ohio hire private attorneys to act as part-time prosecutors because they are not state employees full-time. They are permitted to maintain a private law practice, but you can't cross state lines. Okay, that doesn't apply to us. There are federal exceptions. Some dual capacity attorneys handle local state prosecution while taking on federal criminal defense cases in Ohio. That's interesting. Strict ethical boundaries. To legally operate on both sides, these attorneys must carefully follow the Ohio Rules of Professional Conduct and the Ohio Supreme Court guidelines, the same judge rule. A part-time assistant prosecutor cannot appear as a defense attorney in front of any municipal county court judge who also employs them as a prosecutor. They cannot use their office resources, public position, or relationships with law enforcement to benefit private defense clients. It looks like a pretty gray line, and I don't think there's really an answer. And maybe that, I don't know. I mean, I don't know the answer. The answer is like it's a little bit of a gray line, but basically as long as there's not a conflict is what I got from it. And if there's any lawyer in here, please jump in. He must be a part-time prosecutor, yeah. I also looked at the name Brooklyn. There are 13 citied Brooklyns around the world named. Oh, yeah. Well, the only one we care about is the Brooklyn in Ohio. But I don't know. So he must just be a part-time assistant or a part-time prosecutor. Okay. All right. I'm going to take myself off so it gets bigger for you guys. And take that off. Okay. Welcome back. All right. So if anyone's an attorney in Ohio, jump in. But basically, the question that we were just answering is, how can you be a prosecutor and a defense attorney? If you are doing it in a different county with a different judge and there's no conflict of interest, you can do it. And you also must be, why don't we just Google, is McDonald the part-time prosecutor? That'll be way easier. I'm going to find that. McDonald, where are you? What is his name? Jim McDonald? There he is. Why don't we just Google if he's a part-time prosecutor in Brooklyn? Has anyone done that yet? I am looking for the exact name. Okay, I'm just going to Google. Is he the prosecutor? Okay, is Jim McDonald still the prosecutor in Brooklyn? Yes, he's still the city prosecutor in Brooklyn, Ohio. Okay, so he's still there. I have way more questions now. That didn't really help me. Okay, Brooklyn. There's Kyle. Hi, Kyle. You're nice. I just want to see if it says if he's a part-time or Jim McDonald. I wonder. I don't know. Oh, salary ranges. Maybe it'll say it right here. Okay, let's see here. It doesn't say. Magistrate. Yeah, okay, part-time. All right. I think all of the part-time are law. Okay, I guess we already found it. Part-time law, part-time. Okay. If someone finds something else. Court police records coordinator. Oh, wow, that's for FOIAs. Okay. Part-time law enforcement, part-time jailers. These are all part-time. Okay. All right. Well, I think we've solved our question. Oh my gosh. Oh, okay. I was like, please don't tell me that you can't see this. All right. And now you have our friends. Okay, I had to refresh. I didn't want us to not. Okay, I looked up. Well, he's still there. All right, yeah, she can't get a new attorney when she said that she understood that it could be a conflict of interest. That cut her out. All right, we are going back into our Mr. Troop. I have no objection. No problem, Your Honor. Keep it coming. Okay. So, okay, recap. If you're new or if you're just joining us, welcome. I'm so glad you're here. We are reading the bind over court documents for Mackenzie Shirilla to go from juvenile court to adult court. Right now, the transcript is giving us more information than you could have possibly even thought we were missing. And we just learned that the defense attorney for Mackenzie is also the prosecutor for a neighboring town. And he didn't read the report that the prosecution gave him and didn't realize that there could be a conflict of interest. That means he didn't even read the witness list. We have the witness list, and I'm sure that kid's on it. Okay, well, he's apparently a part-time prosecutor for the city of Brooklyn. There's an officer named Adam something that's about to take the stand. He's already been sworn in, and he works as a crash reconstruction, and he has a 4-year degree in anyway, he has a 4-year degree, and then he went to cop camp, and now he's a crash reconstructionist. The judge asked Mackenzie if she and her stage 5 clinger mother minded if he kept representing her. They said yes, and so she's waived her right. She can't. That's, I bet, my guess is that's why she didn't say ineffective counsel for the first trial in her appeals, because she waived her right just now. Yeah, and I'm sure she thought she was going to get off, Jamie. Good point. Yeah. So that's what. So we just went down a detour. One of our lovely dear friends that's in here. Hi, Kate. Still needing a mod, and thanks for the update. Yes, Cynthia. Earlier, not in this live, in the last live, we did 2 today because I needed to take a break and go outside. I'm doing the journaling, meditating, and praying. I'm back on the kick. I'm on this thing. And it wouldn't let me add you as a mod. Are you a member here? You don't have to be a member, but a subscriber. There are only 2 rules. Don't be a dick and act like you're in English Lit, not on Facebook. So we don't do like personal attacks, none of that. That's how you can be a mod. And then literally I just ban people. I just don't play. But if you have a heart and you want to like give them a chance, you can put them in timeout. If anyone else would like to be a mod, please let me know. It is an exclusive club, and you are flying Con Air. This is a team effort. We have pilot, we have the engineer, mechanic that works on the plane. We have our ladies that open the doors, and no, you can't sit next to the door without your parachute on because you can't jump off of this plane. I've tried. So yes, I would love a mod. If anyone's interested in being a mod, let me know. I like to share the love because there's no, we will start once we have a set schedule, then we can work it out. But right now, all the OGs are mods, and I don't know if they even know it. But anyway, thank you for asking. Yes, it wouldn't let me add you as a mod. Please like, share, subscribe, do all the things. Your girl loves cash tips. If you're happy with this flying experience, feel free to tip her. The tip jar is here. And now we're going to go back to see what kind of shit show we're about to watch, because now, I mean, if Chris Cuomo had this, literally, no matter what the Shirillas say now, read page 124 of the transcript and it's over. It's like, I know you have a lot of big feelings that you don't know how to process, but it's over. You're done. You're done. Oh, I think we have that sound effect. You're done. I hope so, because it feels like appropriate. Well, we have this one.
Tell you, that rotten son of a father of hers never said a frickin' word to me. I bumped into them at the cemetery. Of course, my place have to bump into him. And that bastard never even said, hello, how are you? I'm sorry. Nothing.
I just love it when Christine calls him a rotten son of a bitch. Okay, you're done.
You're done. You're done.
That's for Mackenzie's family. Okay, back to comments. Thank you, everyone, for being here. Freedom Fighter, welcome. I'm so glad you're here. Cynthia Nicole, so glad you're here. I don't know. I am butchering this. I'm going to call you 9590 so I don't butcher your name. Thanks for looking it up. Yeah, it was a group effort. And We looked it up. Yes, you can. Hi, I'm late. Oh, there's no such thing as late. Trust me, time is an illusion. Okay. Welcome, everyone. Thanks for coming, being here. I love you all very much, and we are going to get back into this. Mackenzie, we're on literally day one of trial. According to this document, we're on day one, witness 3. And Mackenzie's, it's done. You're done. Okay. I'll just reread that. No. Okay. So, all right. Does the state have an objection to this potential conflict here? Nope. No objection. Okay, Mackenzie, have you had enough time to speak to Mr. McDonald about this with your stage 5 clinger? And do you guys understand? Oh, you can sit down. Go ahead and sit down. You don't have to stand up, but thanks. Do you understand how this is potentially a conflict? Yes, Your Honor. Okay. You talk to your attorney. Okay. And you understand how this could potentially be a conflict because he's representing you. And he also works with a person that's about to be our witness on a regular basis in a different capacity. Yeah, I get it. Is this something you wish to do, or do you wish to proceed here? Well, that wasn't the exact, that's not really what you meant, but we all know what you meant. Is this something you wish to do, or do you want new counsel is what you meant? I just want to change this color. I guess it's fine for now. Okay. Okay. So, Mackenzie, I want to keep him. Keep Mr. McDonald and proceed and waive any potential conflict. Yep. Bye-bye. You're done. Okay. Sergeant Adam McWade has already been sworn in. He's going over his background. He has a 4-year degree, and he works as a patrol officer for the Brooklyn Police Department. He, has taken multiple crash level courses to include accident reconstruction. I don't know what advanced anxiety reconstruction means in the context of a vehicle, but so I'm just highlighting in green so I remember. An event data recorder analysis school. Okay. And now we are okay, he did the event data recorder analysis, and this is State's Exhibit 9. He's confirming that what he's holding is State's Exhibit 9, the crash data retrieval report that was pulled directly from the event data recorder. Tell us something about that document, okay? What does it represent? This represents a computer readout of an event that was triggered by the event data recorder in an event that triggered, like in a crash or a rollover, or any type of thing that would cause the computer to wake up inside the car. Okay, what is an event data recorder? It's a computer that's put inside of the car, usually in the airbag control module. It's not always recording. It only starts recording in the event that there are forces acting on the car that cause that computer to wake up. Once the computer wakes up, it then takes a snapshot back to a certain point. Every manufacturer's is slightly different. In this instance, it goes back 4.75 seconds from the time of wake up. I'm just double checking that you guys can hear me before I keep going. Okay. 4.75 seconds from the time of wake up, and it gives you information such as the forces acting on the car. Well, these are interesting words in a spiritual battle, such as forces acting on a car. That is interesting verbiage. Okay, it can also give you information such as, was the accelerator depressed? Was the brake depressed? Was the seatbelt engaged? Depending on the manufacturer and what they chose to put into their EDR. Okay, so is it fair to say that State's Exhibit 9 is then a data printout of that event data recorder? Yeah, this is the raw data that's been generated by the computer. Are you trained to analyze this raw data? Yes. All right. And did you do that in conjunction with your investigation? Yes, I did. Okay, so they had 2 event data recorder people there, because I know Ohio State Patrol also did an accident reconstruction too. Maybe these are 2 different things. Did you document your findings as a result of your investigation? Yes, I did. Okay. And is that contained in the report? Yes, it is. May I approach? States Exhibit 10. Okay. Do you recognize this? I do. What is States Exhibit 10? This is my event data recorder analysis report based on the CDR information that you've already provided me. So it's the same thing that's on the screen? Yes. Okay, I'd like to go through your report then. First, tell us how you came to be involved with this case. Well, I'm not exactly sure who reached out to a colleague on my crash team about possibly doing an EDR analysis. Her name is Captain Tanya Zach with the Parma. Oh, those Parma bitches. Wait, Parma came? I thought Parma was like 20 minutes away. Well, I guess when you're dealing with fatal accident. Okay. From those Parma bitches, police department. And then she reached out to me and provided me with the data. I then performed the EDR analysis based on the request from Strongsville Police Department. Okay, how many EDR analysts are there in the Southeast Accident Investigation Group? There are 2 of us. Oh, so he's regional. Okay, that makes sense. He's like, I don't know who his real, maybe his employer is the government or something, but the Southeast Accident. Okay, so he's part of a regional group. Okay, yourself and Captain Zach? Oh, and if I'm saying that wrong, all respect, I'm sorry. Okay, once you got the assignment, what steps did you take? I start by making sure that the event was a complete event, and it is listed I have it listed on page 2 of my report that the recording status diagnostic was listed as complete. And then I make sure that the key cycles of the end, this is giving me PTSD on the Karen Reed case, key cycles of the engine would make sense in the crash. And every time an engine is turned on, it generates a key cycle. I was able to determine that all of the data from this CDR pull was from the same event because it was under the same key cycle of the engine. And the only other key cycle after the fact was when the engine was turned back on in order to pull the data off. So I first made sure that the CDR data was an accurate representation of what happened in that car during that crash event. And were you satisfied with the data provided? Did that provide a satisfactory answer to that question? It did, because all trigger events inside of the CDR were for the same key cycle, and the most recent prior key cycle was greater than 37 seconds before. That's high on the high end of what it will record. So I know that the prior key cycle was not a part of this event, and the other one immediately after could be documented as part of the pull of the data. What triggers the event data recorder to start recording events? The best answer would be forces. Okay, this is a spiritual battle, and we are using words that are, all right, I'm resetting sacred space, and I'm calling in the quarters because I am not trying to summon anything, any forces acting upon a car. Please hold while we call in sacred space and set the quarters. I'm waiting. Oh, actually, I know some people are learning, so I just rang my bell. And for me, I was taught to ring a bell to clear air. It would be kind of like, you know how you smell coffee in between sniffing perfume, Miss Dior. It's just like a cleanser. It just cleanses the air. Then I'm lighting sage, and I'm going to call in Archangel Michael on the south, Kuan Yin and Isis on the west. I'm going to do Archangel Sandalphon in the north and the Magdalena clan on the east. I'm going to ask the grandmothers of the universe to surround the sacred space and protect everyone watching so I hear the right words and say the right words. Okay. I am not trying to have any forces acting upon us. The linguistics here is a little bit of a conundrum. Okay, so we just reset sacred space, and we are reading the EDR report from Mackenzie Shirilla's car. Transcripts from court, from the bind over hearing. Okay, would the best answer be the forces acting upon the car, whether it be a frontal impact or a side impact, triggering a rollover? Okay, wait, sorry. All right, there are no actors to play in this part. They're both just normal dudes, not being psycho. Okay. All right. So, okay. So he's just like re-explaining that every time you turn on your key, like your car, it has a key cycle. He is within the same key cycle. So he knows that this is the 4.75 seconds that the EDR recorded. And what triggers the EDR is, and so we stopped and set sacred space because we are in the middle of a spiritual battle. And it's literally like the most, I mean, this does not sound of the highest and widest light to me. The best, okay, so what triggers the event data recorder to start recording? The best answer would be forces acting upon the car. We have gotten that she was possessed, and the girl that has now redacted her thing said that Mackenzie told her that she was like pretty much possessed. That's wild that it says that. Anyway, man, okay. Whether it be okay, so the best answer would be the forces acting upon the car. This to me is like literally saying she was possessed. It's something outside of the car. But that's on a metaphysical level, not on a human level. Okay. Whether it be a frontal impact or a side impact triggering the rollover, it has to be substantial enough that the car thinks it's being either involved in an accident or a wreck. So just simple hard steering doesn't usually trigger an event. It needs to be strong enough force acting on the car. Oh my God. It has to be a strong enough force acting on the car. Wow. From a metaphysical sense, this is wild. That the computer thinks the car is wrecked. And is there anything specific to the event data recorder in a Toyota that was pertinent to your investigation? Yeah, a lot of different companies, when they put an EDR in, once the event is triggered, it will continue to record a singular event until the event is complete. Toyota doesn't do that. Toyota will break up its events into multiple events inside the same crash. For example, oh, that's very helpful. For instance, this event, oh, that is very helpful. In this event, there was a hard steering. Okay, wait. In this accident, there was a hard steering event, which triggered a rollover event. That was the first event recorded. Okay, well, you know what this was? This was the boys, a hard steering event. And this triggered the, oh, Mackenzie, even the transcripts are telling on you. Well, it's not. I mean, it is what it is. Okay. This, okay, we got it. Thanks. Okay. So that was the hard steering event. Oh, the hard steering event. This is the boys. All right. Then there were multiple impact events that were also triggered, and it generated a separate trigger for each one of those. But you could overlap them and see that they were all happening right around the exact same time. Okay, so for the purposes of your analysis, how many events did you locate in this data? There were 9 total events, but the ones that were highlighted as far as crash events, there were 3 different events that were highlighted for crash events that were pertinent to this accident. Why would you highlight those 3 events? Because they were the first event, okay, so now he's explaining his diagram. The first events I highlighted were the events of when the car made contact with the wall. And then the second one I had was the other frontal crash event. And then the other event I highlighted was the initial event, which woke up the computer. Okay, so this is backwards. So the way that we're reading it would make more sense to explain it. I highlighted the initial event that woke up the computer, which was a hard steering event. Okay, so this was for us. The initial event that woke up the computer was a hard steering event. and the computer thought that it was in a rollover. Then she hit the sign. The second one was the other frontal crash event. So then she hit the sign. This is going to be. And then the last one was contact with the wall. See how, for me, that just makes more sense to do it in the order that it happened. Okay, so then she hit the wall. All right, so he highlighted 3 key times. The first one was the jerking of the wheel. Then when she hit the sign, that's the frontal crash event, and then she hit the wall. The other events were triggered based on airbag deployments. They didn't have any data as far as change in speed over time. They were just triggered by the computer because the car was activating safety mechanisms, but they weren't caused during the crash. Okay, so you're here primarily to tell us about the 3 events that you located? Yes. Okay, start with the most significant to your investigation, please. The most significant to me was the trigger event number 11. Wait a minute. I have this report and I want to read this now that I understand what all these are. All right. Okay. Trigger event 11. It's listed in my report as trigger event 11 or TRG-11. And the reason I was able to determine that it was the most substantial event was because it had the highest delta V value, which delta V is a change in velocity over the change in time. Okay. Well, and if you have a high delta, like a high delta V value upwards of 40, which we had 37.2, then you get to those values. You're looking at a serious injury. Okay, so for him, the most important trigger was the impact with the wall because it had the highest velocity over change in time. Okay, so for him, the most important event data trigger was the wall. Okay, that's fine. I would think the most important event would be the one that turned on the computer, but he went to cop camp. So, all right. And you're looking, okay, so with this change in velocity over the change in time, you're looking at serious injuries with the possibility of fatalities for a belted person and a significant risk of fatality for an unbelted passenger. All right. I have on the screen here, this is page 4 of your report. There's a box titled TRG-11. Is this what you're talking about? The most significant event that you analyzed? Yes, I am. Okay. There is some highlighted information on this exhibit. Did you highlight these spots on the exhibit? I did. I highlighted them to emphasize what I was writing in my text portion of the report. Okay. And what is the highlighted portion meaning for this purpose on this table? This is the event type. It's a frontal rear side crash listed. Frontal rear side crash listed. It means the crash was significant enough that it triggered. Oh, okay. This crash was significant enough that it triggered all the sensors inside the car. Okay, do you know what it was that caused this event? Well, based on the report and what I found, I concluded that it was when the car made contact with the wall. Oh, well, yeah, okay. Okay, yes, got it. Check. Okay, what significant information can you provide about TRG-11? Well, all I can provide, I should say that during this event, the crash was substantial enough that it destroyed the camera or the computer, I'm sorry. So at some point during the crash event, you'll start to see invalid is listed or just zeros that are grayed out. Oh my gosh, you guys, I have pictures of the inside of her car and her stereo is shattered too. I can grab them, but that means that the camera or the computer could no longer record. Once that happens, there's no more data after that point. But you do have all the data leading up to that point of destruction, which included a delta V value of 37.2, which is substantial front-end collision, slowing the vehicle down at a very, slowing the vehicle down, at a very fast rate. That's the only event in here that has a delta V high enough that would cause this kind of damage to the car. Okay, that's what cued you in? Yeah. And would it be fair to say that the fact that the event registered frontal, rear, and side crash all simultaneously? Yeah. Besides the event data recorder that was given to you, did you review any other materials in your investigation? I reviewed the initial accident report. I reviewed the box CDR data that you provided me, and I reviewed the scene diagram and the scene photos. Okay, I want to take you to page 3 of your report. There's a photo contained therein. That's one of the scene photos that you, is that one of the scene photos you were provided? Yes. Okay, is it fair and accurate depiction of the Toyota Camry in these photos that were provided to you? Yes, that's the exact photo provided to me. Okay, let's get back to your report. You talked about 3 events. You told us first about the TRG-11. That's the impact with the wall. What's the next event that was significant? The next event that was significant, I believe, was TRG-119. Okay, do you address that in your report? I do. What page is that on? It's written out on page 3, directly under the picture of the car that you just showed me. Did you make any conclusion from the data that you analyzed on TRG-9? Yes. TRG-9 was also listed as the frontal crash event. However, the delta V was only 2.9 miles per hour, which is low impact. It may not have even triggered the computer wake up had it not already been awake from the previous event. Oh, shit. So the sign, when this little psychopath, the prosecutor says one of the boys tried to save themselves. Like I think it was Davion, but I don't know. When the boys tried to save themselves and she jerked to the right and went off the road, that's what woke the computer up. Her impact with the sign, Petco or whatever the name of that company is, Pledco, didn't even register, or it wouldn't have woken up the computer. So if they hadn't had that steering wheel, one of the boys grabbed the wheel, then the EDR wouldn't have been on for the event. That's wild. Wow. During that event, I noticed that while the accelerator pedal was still on 100% depressed position, the engine throttle significantly decreased. Oh, so after they hit, she kept her foot on the pedal. POTS, you say. According to one of our friends in the chat, POTS makes you go limp. Mackenzie, not psycho. The engine throttle is significant. Okay. That led me to believe that for some reason, the drive wheels of the car were not making contact with the road. Oh, that's the sound you can hear in the surveillance video, that screeching. That's the air, I'm guessing. I'm not an accident reconstructionist, but it's all making sense. That led me to believe that for some reason, the drive wheels of the car were not making contact with the road because they were spinning freely. I think this is when that sound you can hear right before the crash, it's like a high-pitched squealing sound. I have that little recording, but I think her foot is still on the pedal. What I also think, based on listening to Samantha at You Don't Belong Here, is they didn't take her serious. It was the little boy that cried wolf. She always said psycho stuff, and so that's why neither one of them were afraid at first. But this part right here, I think, is when she was airborne. After they jerked it to the right, she corrected it and is flying over the road right into the sign. I think that she was actually in the air during that time. There was no friction on the road. Yeah. Okay, that makes sense. Oh, that definitely makes sense. Okay, so then I reviewed other scene photos to try to explain what would have caused it. And one of the scene photos, which I have in my report, it's on page 6, shows tire marks approaching a curb. Now, according to the data on the computer, the car was still traveling in excess of 95 miles an hour at this time, and it made contact with that curb right there, which causes the front, which I believe caused the front of the car to lift off the ground, and that caused the tires to spin freely. Okay, yeah, we're all on the same page. Not making contact with the ground, and then the car made contact with the ground again. It's literally like, where the stop sign is? It's almost the way I'm understanding this, she flew over the road and then made contact again right before she hit the sign. That's the way I'm reading this. And I could be wrong. And if I am, let me know. Okay. All right. So he's saying she made contact again with the ground and it caused the car to slow down enough to register that Oh, yes. Okay. We're nailing it. Yes. Man, maybe we should have gone to accident reconstruction school. Okay. So now what this is saying, if you're just listening, we don't have pictures, although it would be way easier to explain with pictures. Actually, let me see if I can just find a picture really quickly, because that would be really helpful in explaining what I'm imagining or what he's explaining. Please hold. The airline, we don't have any drinks available. What are you drinking? I'm just grabbing, I have this kid's report or this man's report, but I don't. This is a little bit, okay. What I don't want to see is Daniel Graham. Okay. I'm just looking for, I just want to show you guys a picture so you can visualize it. If you're watching, if you're not watching it, don't worry. This will take me like 2 seconds. I'm just finding a report to explain what we're looking at or what he's explaining. I do better with pictures. Okay. All right, so we have the pictures. All right, I'm just putting together a quick PDF to show you the pictures of the car that this kid's talking about. And I guess we could look at his report, but we're just going to do this quick, fast and dirty, like Mackenzie. Hardy har. God. All right. So this is her being a little psycho. These are the crash reports that he is explaining. And I just need to find the Ohio traffic. Thank you for your patience. Please enjoy flying Con Air. We are off cruise control while we get dinner ready for everyone. Bobby's cooking. Ask Bobby what you're in the mood for. He's on the grill. Okay, this is the crash report. If Nick Balance showed up in this, I was about to say we are going to have a big problem. He's he's a nightmare. All right, crash reconstruction report. Mackenzie. Okay. So I'm just putting the pictures together that this man is talking about, and I'm going to grab the diagram of the car. I literally was just looking at it. It is, let's see if it's right here. My ChatGPT remade a picture of Mackenzie's dad making a duck face, but it's a close-up. It's hilarious. All right. Thank you for your patience while I find a picture. And if you don't need a picture to visualize it, then just press pause. You can come back. Actually, why don't I pause you and run to the, please go to the bathroom. I'm going to run to the bathroom really quickly while I find this anyway. And I will be RB. I'm looking for the police report. I'm sorry, the picture, and I do need to use the restroom. So please hold. Oh, I was just reading the comments. I'm back. I was just reading the comments, and one of them was like, dude, I thought that it took us off again. No, so I'll find us some music. Hey, Reels, welcome. Hey, Amy Carey. Hi, guys, welcome. I'm so glad you're here. Yes, Phil, I saw this about you saying the boys woke it up. Yeah, that's how I read it too. And I am, I can't play anything that'll get copyrighted because that would be a tough, we are not doing that tonight. But I can put on some just like elevator music. That sounds like very, I'll just put it on in case you're not watching. You don't think that we left you. I'll just make it quieter. This is just background music while I think I'm not thinking, I'm just finding something. But if you are listening in the background, we didn't get kicked off. Hi, Reels. I saw that comment. That's why I was like, ah. Okay. Let's see. Where is this? Okay. I think I found it. Oh, yeah. All right, I'm just going to do it this way. Instead of trying to put it all together, I'm just going to make a PDF and then put them together that way so you guys don't have to wait. I appreciate your patience. Thanks for flying Conair. I am so excited you're here, and I have no idea where we're going or where we've been. Oh, I wonder if inside here it will, I wonder if inside here it will explain about the seatbelt discrepancies that are available. All right. Thank you for flying Conair. Your happiness is our happiness. While we, for those of us that like visuals, and I am definitely one of those people, this will just make a lot more sense. And thank you for riding Conair. Please leave a review, tip your waitresses, your servers. Okay, so that's the picture he was just talking about, and here is the road. Oh yeah, we are so good. She's screwed. Why would she do? I don't know why she took this. Well, whatever. She thought, you're right. One of our friends said she didn't think it was going to matter because she thought she was going to get away with it. And you're probably 100% right. I heard someone say that they didn't think that Mackenzie was a psychopath. And I think that I don't agree at all. I do think she's a psychopath. And I think that Dominic pretty much told her that he thought she was too after Kendall got pushed down the stairs. She fell 10 feet on her face on concrete. In my opinion, after reading the report, you can't, literally, I don't think you could convince me otherwise. She didn't hit any of the stairs. You don't just fall down the stairs flying. Okay. I'm also going to put the evidence in this PDF, so we'll have it all. 29th, 34. Oh, I don't want. I mean, we can have a picture of her getting arrested. That'll feel good. Okay. Thank you for flying Conair. We are going to do visuals very quickly. His report is really meticulous, actually. All right. We're about 3 minutes away. The movie will start shortly. Please adjust the sounds accordingly. Okay. Thank you, Acoustic Cinematic. We can't get dinged for copyright. All right, welcome, everyone. I'm so glad you're here. Right now, we are putting together the video. Okay, the pictures from here. I'll come back up here, say hello to everyone. Welcome. I'm so glad everyone's here. We are listening to, Phil, stage 5 clinger. Yeah, man, she is. What we are doing right now, we're reading the transcript for the bind over hearing for Mackenzie to get out of juvenile court into big boy court. The officer on the stand right now is explaining his EDR report, which is the event data recorder that was triggered by the hard jerk of the wheel. And the boys did save themselves. I saw that, Phil. The hard jerk of the wheel. That woke up the event data. And in this time, Davian has told us in a reading that time stopped. Like there was no, and time is a construct, but it literally, like there was no time that it happened really fast. It just like unfolded, like time stopped. And in that time, what he's explaining is that the wheel jerks, which the prosecutor said it was the boys. She jerks it back, and from the stop sign, I'm seeing if this is all together. Yeah, it is. Okay. So now we are going to save these and we're going to talk it out. So then I'll show you where at the stop sign, she's airborne. Then she lands, hits the sign, and then hits the wall. So now I'm going to share this tab with you. Okay. This is our, so that's just her. Okay, this is what this guy is talking about. I am going to, okay. So let me see what you're looking at. Everyone can hear me, right? Okay. If you can't hear me, let me know. If you can't see me, let me know. All right. What he's talking about, the cop on the stand, is saying, this is where the boys jerk the wheel right here. The curb airbags are deployed. So this is what they're calling a curb. When I think of curb, I think of like a street curb, but what they're saying is like it's not on the street. So this is the curb, the airbags deployed. This is where the event data recorder turns on. She's also, according to his report, airborne from about right here, almost to like, where's the sign? Right here. Here's the sign. It sounds like she's airborne this time, like through here. So she's airborne at least over the road, according to his report. She's at 88.86 miles per hour. Here she hits the sign. That's the second event that's recorded. But had the boys not jerked the wheel right here, it wouldn't have turned on here because this wasn't enough of an impact. It literally like brushed side it from the way it sounds. And then when she hit, she was at maximum velocity. She hit going 97 and the car spun or flew 15 feet over here. That's not been in the report yet. I have read that in a different report though. So that's what he's explaining, all of these events. And it's just easier sometimes for me to visualize. So that's what you're looking at. Now, we'll get back to our boy. Where are you? Bind over. There he is. Is this? Nope, that's not the one I can make a copy of, or highlight. Okay. So, okay, here we go. So now I'm going to share that screen with you. Okay, so now, according to the data on the computer, the car was still traveling in excess of 95 miles per hour. Oh, wait. Can you hear me? Oops. Bueller. The car was still traveling in excess of 95 miles an hour at this time, and it made contact with the curb right there. So, made contact with the curb right there. Which I believe caused the front of the car to lift off the ground. And that caused the tires to spin freely, not making contact with the ground. So she was airborne. When the car made contact with the ground again, it caused the car to slow down enough to register that. Oh, whoa. So what I think he's explaining is she was airborne. I don't know why I'm laughing. It's wild. She was the way I understand. Okay. Can you see that? Okay. The way I understand what he just explained is she goes airborne from here to the sign. Oh, I wonder how far it's not to scale, but I wonder how far that feels. Oh, actually, we don't have to wonder. We have the picture. Please tell me it's in this report. Of the road. Darn. That might have been important. The picture of the road, because that just feels like a long time to be airborne. So the way that this kid's explained to me, the way I'm understanding this kid's report is she comes off the road right here. The boys like jerk the wheel. She readjusts it. It turns on the EDR. She's airborne from right here to the sign. What? Okay. That's the way I'm understanding it. And so that caused the tires to spin freely, not making contact with the ground. When the car made contact with the ground again, it caused the car to slow down enough to register that negative 2.9 delta V. That's her hitting the sign. That's what he said above. And that's TRG9. Yes, that's TRG9. Okay, so moving to the third event that you said was significant. Tell us about that. It would be the first event that was recorded. So he did it backwards because by the velocity of the crash, obviously, I mean, not obviously, but to me, obviously the wall, the impact was the most significant event. Then the sign, and then the boys, okay? I just showed it to you in the way that the events happened because that's the way my brain was working. It'll be the first event that was recorded. This is TRG-5 that's listed on the page. It starts on page 6 and goes on from there. Now, TRG5 is not a crash event. It's listed as a rollover event. And that doesn't necessarily mean the car rolled over. But what it does mean, it just means that there was enough side-to-side force, so the boys pulling on the wheel, like jerking it to the right, force on the car that the computer thought the car might be rolling over. And it was determined that that's what caused that. And you can see it, TRG-0 at the bottom of the table. You can see that negative 142.5 degree turn. Oh my God. That's how hard they pulled the steering wheel. Maybe that's when Donovan, I'm just guessing, Donovan like realized this wasn't the boy who cried wolf. And maybe that's why he dove over from the back seat into the front seat to like pull on it. It looks like it was 142 degree turn. That's a lot of turn, which is a hard turn to the right. Yeah, exactly. So if he jumped, and this is a guess, I don't know, obviously, but I'm guessing he jumped from the back and pulled the wheel with his weight. And that would be like taking the hand on top of the wheel and bringing it all the way almost down the bottom of the wheel in a matter of a quarter of a second. That's what I think happened. This is just my personal opinion. I think Donovan jumped from the back seat to the steering wheel and grabbed it with both hands and jerked it. Like he used his weight to jerk it 142.5 degrees. So that would be like taking the hand on top of a wheel and bringing it all the way almost to the bottom of the wheel in a matter of a quarter of a second. That caused the in-car computer to think the car was rolling over. Well, you know what? She also had superhuman strength to straighten it out. Well, the forces on the car, that caused the in-car computer to think that the car was rolling over. And that's what caused the computer to initially wake up. That's the first event that was triggered. Yes, they did save themselves. I think that's what happened. And that's what caused the force. And what caused that force was if you've ever been on a freeway and you've had to avoid something and you're going 60 miles an hour and you make a hard steer, you're thrown to one side of the car. And at the speed of 90 plus, that force is even greater. Is there anything else significant about the TRG-5? Other than the fact that the speed listed was in excess of 90 to 95 miles an hour, the main significance of the TRG-5 is the hard steering event. Wow, that is awesome. Okay. What if any, easy Lally, what, if any, conclusions were you able to draw based on your analysis of the report? Well, keeping in mind, my analysis is based on a total of 5.8 seconds. Oh, Steve Shirilla couldn't even get this right. God, if you're going to quote stupid stuff, quote it right. That's the entirety of what the computer recorded. I was able to conclude that for that entire time, 5.8 seconds, the vehicle was traveling in excess of 95 miles an hour. I also think, okay, so then he says the gas pedal was fully depressed. At one point, there was a hard right turn, and for probably like 2 of those seconds, it was airborne, I think, based on what he explained. The vehicle then made contact with the curb. No, I think that the vehicle, okay, whatever. I don't have to break it down, but in my mind, the hard jerk on the wheel made contact with the curb, and then it struck the brick wall. And at no point was the brake ever applied. And even though I don't have any data prior to that 5.8 seconds, that's not to say it wasn't traveling at that speed longer than 5.8 seconds, because it would take, I don't have the exact data of how long it would actually take, but it would take time for that car, I used to own a Camry, to accelerate to 95 miles an hour. Yeah, didn't she have like 25 seconds? Or somebody's broken it down. It doesn't happen in 1 or 2 seconds, not in a Camry. Thank you. Mr. Troop, one moment, please, Your Honor. Oh, never mind. I have no further questions. Oh, Mr. McDonald, do you have any questions? Oh, I do. Of course you do. All right, everybody, put on your Mackenzie. We do need like a Mackenzie Shirilla sweatshirt or something. That's why I wanted my Conair sweatshirt, because it's time to, I need a drink before we go into Mackenzie. Ooh, gross. That drink is hot. Hey, Conair. Hey, waitress, I need another drink. The captain would like a fresh drink, please. Oh, God, here we go. Here's McDonald. All right. Cross-examination of Sergeant Adam. So, you're familiar with Progress Avenue, correct? I'm not actually that familiar with the avenue. You didn't go out to? I did not go to the crime scene. Oh, he didn't say crime. I did not go to the scene. I just did. You just did an EDR, period? Correct. Okay. The first significant trigger was 5, a sharp right turn? That's what the computer said. Again, I didn't go to the scene. Okay, hold on. Now that this guy is making a big deal about this, I want to find the picture that I was thinking of. You know what I should do also? I'm going to start uploading it to YouTube right now. It's only 6 minutes long, but it's really cool. It's a drone of her drive. Well, from, I don't know Strongsville, so I wouldn't recognize anything except when she takes the right. But it's really cool, if I do say so myself. Don't worry, we didn't get kicked off. I'm uploading a really cool video that I found in the documents of the FOIA request. Thanks, Plunder. Thank you, prison. Phone calls from prison. Okay. This should take a minute. All right. So that's, ooh, I almost dropped my phone. 5 minutes left of uploading. And I am just going to download this picture. I think the police submitted this picture too. It's just like, oh, I love this picture. Okay. I'm going to download 2 pictures for you, actually. This one is a picture of Progress Road or Progress Drive with approaching the sign, so we can watch it. It just will visualize it one more time for anyone who likes visuals. Well, that's the building now. Uh-oh. For some reason, that just downloaded her Snapchat selling herself, her body, for $2,500. Okay. Page. Don't worry, it didn't freeze. I feel like I need one of those airport automatic. Thank you for flying Conair. We'll be with you in a moment. Page 246 and 247. Oh, and they haven't fixed the side of the building yet, because it's like, I don't misquote it. I have the report, but I thought it was like $500,000. And because it's a structural support beam, like that corner, it's going to be a much bigger project. Okay. 265 and 267. These are just pictures of the wall. They haven't been fixed. All right, where's this? Okay, we have 3 minutes left of our drone, but don't worry, we'll keep reading. I just want to, I love the picture that ChatGPT made for us. Here, while this is getting ready, I am going to share a picture that ChatGPT made. Okay. Thank you for flying, Conair. Our captain is redirecting us. We are going to a different airport. All right, here's the building. Okay, we got all that. But what I'm looking for is a picture from the road. It's just a really good picture, and it'll help us visualize. If you don't like visualizing, just fast forward this part. Do zoom like Emily D. Baker. Okay, the next one, I can show you guys this. Well, not while I'm working on it. I just have one more picture to find. Then we're going to do. So apparently the defense is going to go after this kid not going there to the scene. Okay, well, he's already doing a much better job than they did in the Karen Reed case. Well, that. All right. Have you guys seen the picture of Natalie when she was younger? Yikes. I don't know if I've showed it to you, but I will. All right. If I can't find this picture in this one thing, then we're just going to keep going. Okay, I can't find it. All right, we're going to just keep going. Okay. So, alrighty. So, we are looking at, this is the building as it looked. I don't know if this is recent, but I'm guessing this is from Google Earth. So this is what it looks like. Okay. I love this picture that ChatGPT made. What these pictures are, obviously, is the building. But I have to find that other picture. I'm going to see if the drone thing is ready because it's really cool. And if anyone lives there, I know there are people on Reddit that live there. Since this isn't Reddit, I don't know. All right. Come here. Okay, we have 20. Oh, wait. Oh, now it's checking to make sure we're not violating anything. Okay, so we'll give that a second. And I'm just looking for one more picture that her defense attorney is about to start arguing. All right, oh, here it is. I found it. Okay, thank you. Thank you for your patience. I found it. All right, so we're going to use, oh, these are all great pictures. Okay. 62 through 70. All right, these are all great pictures. So thanks for your patience while I'm getting this ready. I usually obviously like to have everything done before we get on a live, but sometimes you just have to go with the flow. And sometimes our lives are as wild as Con Air. You never know where you're going to land. All right, now we've got it. While this, okay, so we still have a few more minutes on. I'm going to share this with you for a minute so that you don't have to watch me scroll through this. Oh, are you kidding? All right, we're just going to dump them in and hope that they go in the same order. It didn't download it as a PDF, so there we go. Okay. All right, we'll just keep going with this guy. And then as that's uploading, it's working on it right now. Okay, so you just did the EDR period. Yeah, that's correct. All right, this is ready for us. Okay, the first significant trigger was 5, a sharp right turn. Yeah, that's what the computer said. Again, I didn't go to the scene. I didn't do any vehicle inspections. I just, okay. You said is there a jury in this, or is the judge the trier of facts? Oh, I think she said, if it gets bound over, then it'll go to a grand jury. Okay, you said it was driving 90 miles an hour. It was traveling in excess of 95 miles an hour. Okay, Mackenzie is literally the spitting image of her attorney. Like, let him finish a freaking sentence. In excess of 95 miles an hour, correct. I have to look for the exact number. Okay. It was traveling for those seconds. It was traveling 96 to 100 miles per hour. And you used your hands. The first event was at the speed of 180-degree turn of the wheel. No, it was 142.6. I just told you that. Okay, so you had exactly 142 degrees, 142.5 degrees, yes. So he must be looking down, reading the actual report. To the right, yes. Now, before that, had the car had some turns to the right and to the left? It did. It had a 10.5 degree turn to the right, and then it had 10 degrees to the right. Okay, Mackenzie, why don't you let the witness finish? A total, the most substantial turn to the right was 28.5 degrees. Okay. Then it had a 9-degree turn to the left. So did you have to go 28 degrees plus 9 equals 37 degrees? Yep. Okay, you might have gone to law school. Did you go to cop camp? Okay. And then it had 142.5 degree to the right. And okay. And were you able to determine how quickly, what period of time passed from the first 20-degree right to the 7-degree left to the 140? Oh, so they're jerking this whole time. Wait a second. Yes, it was 4.25 seconds. Okay, hold on. Oh, I get it. Okay. So what he's saying, my guess, this is, I'm not an accident reconstructionist, but what I think he's saying is right here. All right. Please tell me that this is about to get not blurry. Where are you guys? Okay, yeah, it's blurry for me too, but this is what it's, see, this is what he's saying. I'll re-download it. What he's saying is it's coming here. It gets, and it's not straight. It got jerked over here. So it's doing like a right, left, right, a dance. Then I think it's airborne from here to here. Then it hits the sign, then it hits the building, and then it lands right here. This is Paul's house. Okay, so, oh, no, I don't think this could possibly still be it, but this is where the boys, I think. So it's what he's saying right there was that the wheel jerked left, right, left. I think what he's saying is the hardest jerk. Like, I think, maybe this is one of the idea. Maybe Dominic he pulled it from the front seat, like, because it didn't go that much. It just went like slightly to the left. And then she pulled it back. And then maybe that's when Davion jumped and used his body weight to pull it to the right. That would make sense. So she's airborne. Where is this thing? Come here. Oh, that's good. Well, I wouldn't say there are good pictures, but they tell the story. So she's airborne from back here. We don't have the picture on here. Back here, they're riding on the grass right here. And I think this curb, I guess it is a curb, comparatively speaking. I think being on the grass down here, she's flying through the air. She hits this side of the corner of the sign and then hits right there, I think is what we're looking at. Okay. Yeah. So I think this is, if I had to guess, I think what happens is Dominic pulls it to the right and it's not a hard pull. It is 100. Okay, wait. So you have to go. Okay. This is what I think happens. I think there's a 10 degrees to the right. I think this is Dominic pulling it. Then I'm going to highlight this. I think Dominic sitting, just thinking of his location in the car. Then it had, so 10 degrees to the right and then 9 degrees to the left. That's Mackenzie, I think. Mackenzie pulling it back. So I think this is Dominic. This is Mackenzie. And then it had Davion jumping from the back seat into the front seat using his body weight to pull the wheel. 142.5 degrees. I think that's how it happened, if I had to guess. All right, that's my guess. Okay. And you were able to determine how quickly, what period of time passed from the first, I think this is Dominic pulling it to the right, 20 degrees. Like, because his position in the car, he wouldn't have had the momentum that Dominic did. So that Davion did. So I think this is Dominic, 20 degrees to the right. Then this is Mackenzie. She's weaker, like literally just smaller and weaker. So she pulls it back 7 degrees. And then I think Davion jumps from the back seat using his weight to pull it 140 degrees to the right. And that was the 4.25 seconds. Oh, wow. I can see what he meant by the time stopped in there. That's a lot going on. Yes, it was 4.25 seconds. 4.25 seconds? Yeah. Yes. And after those 3 turns, it hit a curb. Yes. Okay. So I think the force of the 140 degrees, whatever we're calling it, was what made it go off the grass right here. Oh, whoops. What is it preparing? Oh, now it's preparing to edit. Okay, thanks. So we'll come back over here while that's editing. I think that, yeah. And I think this 140 degree pull made it go airborne because it hit the curb at the same time. Yeah. Okay. Were you able to determine where on the curb it struck? No. I would just know that it hit a curb. And then from the curb, there was the accident. Oh my God. This guy is really giving defense attorneys a bad name. Like, you don't have to be insufferable. Look at the lawyer you know. He's hot. What is that other kid's name that always makes fun of his hair? Loophole lawyer. He's funny. Okay. Nope, I just know it hit the curb. And then from the curb, there was the accident. Well, before the accident, it triggered when it hit. Is this thing still loading? Ugh. From the curb, it hit the sign, and then it hit the wall. And someone else should be able to tell us the distance from the curb to the point of impact. Why would anyone else be able? I don't know if somebody. Okay, of course, Mackenzie can't let him finish the sentence. I don't know if somebody. You don't know that. That's not his job. If somebody can tell you that, no. You weren't asked to do that. No. And that's all you know. Correct, because his job is EDR. He's the event data recorder. He doesn't know where on the curb it hit. Right? Okay, oh my gosh, the defense attorney literally lays it out. Dominic, Mackenzie, Davion, right there. I think, yes, we just said this. The hard right led to the curb, which then led to it being airborne. Yes. Go team. Go team. Don't worry. You're in safe hands. Yes. Okay. Dominic, Mackenzie, Davion, curb, airborne, sign, wall. And that, ladies and gentlemen, is how you reconstruct an accident. That's thanks. Man, this defense attorney just laid it out for us. Yes. Thank you. The court. So this is Miss Lauren or Judge Lauren. So it was right. Yes, 28 degrees. So right, 28 degrees. Okay, so Dominic, if you're really anal about the numbers, don't worry. All you have to know is I think Dominic from the front passenger seat grabbed the wheel and jerked it, and it registered 28 degrees. And then this little psychopath minion jerked it back 7 degrees. Or she's saying, okay, it says 7 up here, it says 9 down here. Go with it. And then I think Dominic dove. And oh my gosh, that explains why he was on Davion. I mean, okay, then sorry, not Dominic. Sorry, Dom. I think that's when Davion dove from the back, used his weight to pull on the steering wheel. And when he pulled it, he fell onto Dominic's lap. And that explains why Davion was on his lap. Yes. Oh, go girl. All right, this is all making, now it's all coming together. Well, okay, so then where's this 10 degrees to the right? It wasn't. It was 28, then 9. And the court asks, where's this 10 degrees to the right? Well, the 10 degrees is that 4.75 seconds. It's at 10 degrees. Okay, so what he's saying, and the way I understand, what is going on with this? Come here. You stop preparing. I need you to. I need you. All right, this is what I think he's explaining. Sorry, we're just going to have to work with this. It's not clear. But what he's saying, okay, so Dominic pulls here. And so that starts taking it over here. Psychopath Mackenzie pulls left, like say right here. Then Davian dives up onto the front seat. And what the kid just said, or this man, the witness just said, the 10 degrees is the car is traveling at 10 degrees. See, there's got to be another report or another picture of this because these are accident. Okay. This isn't a good representation of what he's explaining, but what he's saying is the car is at 10 degrees. Like it's not straight. It's not going straight down the road. Like it's not coming straight down here. It's at a 10-degree angle. I have to find another picture. So we must have it. That totally explains so much. I don't have it here. And I appreciate all of your patience, and I don't want to keep asking you to wait. But hopefully, oh my gosh, yes. Okay, so this makes sense. All right. Let me make sure you guys are watching this with me. Okay, this is what I think now. So we have see how Dominic, he'd be sitting right here. He pulls it, but he's not really at the right angle. So it comes over 28 degrees. Then little psychopath pulls it back 7. Then I think, oh my gosh, look at Davian's position in this thing. That makes sense. So then Davian dives up to the front, pulls on the steering wheel with all of his weight, and it goes 140 degrees, and he falls onto Dom's lap. She sees the wall and also dive. Why would she dive into the impact? I don't know. No one said she was that smart. Oh, and we have Dominic's hand out the window. I forgot about that. That doesn't explain why his hand's out the window, but it does explain this body position. Okay. So see here, this is a good explanation. What the kid's trying to explain is, see how this would be heading straight, like a 0 degree. I'm just making that up. And what he's saying is it's at a 10-degree angle. See how this is at an angle? That's what he's trying to explain. Okay, that makes sense. All right. So the car itself was at a 10-degree angle. That's the 4.25 seconds. For half a second, it's gliding further. Ooh, gliding. That's airborne to me. I was just giving you the extremes. Okay, so the court asks 10 to 28 degrees to the left. Hold on. The court is confusing me. I don't want to get confused. And if you understand this, I'm skipping over the court because she's trying to talk it out. But I guess, okay, we don't have to talk it out. So the witness says, yeah, just to give you a snapshot, every half a second, it's at 10.5 degrees to the right. Yeah, they were definitely struggling. I think we nailed it. I do think that's what happened. So what he's saying is like Dominic probably back here a little bit more pulls. I'm going to pull this back so you can see it. I think back here before this map starts, Dominic pulls it the 28 degrees. Then little psychopath pulls it back. Oh, yes, that makes sense. Okay, so Dominic's back here. He pulls it 28 degrees. Little psychopath, say she's getting here, pulls it 7 degrees. Then Davian dives from the back seat to the front, and that is what causes it to come over here. And it's 140 degrees. It gets airborne. This is all from this point right here, all the way to here, I think is airborne. And that's why Davian is on top of Dominic, because he used his weight as the momentum to jerk the wheel. And now the court is confusing me. So okay, she got it. What page is all of this on? It starts on page 6 and ends on 7. Okay, thanks. Any redirect? Mr. Troop. Yes, Your Honor. Okay, this is the prosecutor. I just want to be clear. Does a 142-degree hard right turn happen before or after the Toyota struck the curb? Yes, before. Yes, we did it. Guys, we should have gone to school for accident reconstruction. Yes, okay, yeah, it was right before it, yes. One moment, sure. I don't have any more questions. Anything else, Mr. Mackenzie? No, Your Honor. No, Your Honor. Thank you so much for being here. Okay, bye-bye. How many more witnesses do you have? Just one left for this afternoon. Detective or someone else? No, this afternoon we have an accident reconstruction expert from the Highway Patrol. Oh my gosh, you guys. Good thing we did our homework before we got to this bindo over hearing because, well, we did more than I'm going to call him Mr. Mackenzie. No, this is the accident reconstruction expert from the Ohio State Patrol. All right, it's now 3:30. Is everyone okay with putting the next witness on? Sure. Okay, Mackenzie, do you need to break it all? No, thank you, Your Honor. Okay, this is your last Okay, and this is your last witness for the day? Yes, Your Honor. Okay. Hello. How are you doing, Your Honor? Okay, good. Come down here, get sworn in. I'm Trooper Elliot D. Rawson. Yes, we read this. Oh, I don't know if we read it together. Oh, it didn't get read the night that, you know what happened. But this is with Detective Awesome's report is Elliot D. Rawson. Okay, so this is State Trooper Elliot D. Rawson. Mr. Troop, the direct examination of Trooper Elliot D. Rawson by Mr. Troop. Okay. Hi, where are you employed? Ohio State Patrol. I am a state trooper currently assigned to the Crash Reconstruction Unit out of District 3 in Cleveland, District Headquarters. Tell us a little bit about your experience. Oh, and okay, I have a bachelor's degree. Oh, good. These are 2 cops with 4 degrees. Good. I think it should be mandatory. If you're carrying a gun, I think that that's my own personal opinion. Okay, I graduated so he went to college for 4 degrees, or 4 years, got a little life experience. He's not walking out of high school and then a cop. And then I went to the Ohio State Patrol Academy. I wonder if they have a better record than the Massachusetts State Patrol Academy. Graduated in 2013. From there, I have additional training. Have you testified as an expert? Yes, okay. We'll stipulate. Wait. What does this mean? We'll stipulate. Thank you. I'll accept your stipulation. What does that mean? I have to look this word up. I don't understand what we will stipulate. I think it means like we'll agree, but there wasn't a objection. Excuse me, not a lawyer. Looking it up for us. Okay, we'll stipulate. In courtroom, stipulate means the opposing sides in a lawsuit formally agree on a specific fact. It's a strategic tool used by attorneys to save time and streamline the trial. Thanks, Mrs. Mackenzie. Like, what? How did Mackenzie find an attorney as annoying as she is? And if there's a Mackenzie lover in here, I'm not going to sugarcoat it. I just read evidence and facts. And okay, so he interrupted this cross-examination to say, we agree. Thanks, we didn't ask. Tell us how you came to be involved in this case. I was contacted by my supervisor. Oh, Ryan Fox also has a report. Sergeant Ryan Fox. Or it could just be Ryan Fox's name. In early December. Whoa, December. What was happening in December? Wait a minute. December? Wasn't she already arrested then? At the time, he advised me that a request for assistance had been made from the Strongsville Police Department reference in this case. He kind of brought me up to speed and apprised me of the known facts and circumstances surrounding the case, as well as previous work he had done on the case as far as downloading the vehicle involved for the Strongsville Police Department, and indicated that a video had been, this video, whoopsies, Mackenzie, whoops. This is literally like going to Walmart before you kill your wife. You know how Paul from the sofa always makes fun of killers, that everyone goes to Walmart first? That's pretty much what she did. Yeah. Okay. As in downloading the vehicle involved, indicated that a video had been obtained, requested that I do a video time analysis, distance analysis of speed leading up to the collision. His report is really well done. It's no proctor. And you did, in fact, do that? Yeah. Did you document your investigation in a report? I did, and it's in Detective Awesome's file. Your Honor, may I approach? Okay, this is Exhibit 11. Thank you. I'm handing you Exhibit 11. Do you recognize this? Okay. Okay, yeah. They're bringing evidence in. Yes, I did. I reviewed the crash report and case investigation conducted by the Strongsville Police Department. The DDR, the CDR report obtained from the download as it was conducted by Sergeant Fox, as well as 3 video files that were also obtained by Strongsville Police Department investigators. The 3 video files, that's the surveillance, and I have those. Maybe I'll upload those too. I might already have them. Actually, I already have them. Okay. I am just looking to see how our drone footage is going. Oh, good, it's uploaded. All right, I'm gonna come say hi, I'm gonna come say hi to you guys and take a little break from the old court docs. Okay. Hi, Cindy. Hi, Cindy. Yeah, sorry. If I said Davion Dominic wrong, I apologize. Thank you for correcting it. I might have said it wrong once or twice, but you get the idea. I said it right. I said what we were doing was figuring out the road. Yes. Thank you, Cindy, for correcting that. Thanks for coming. Welcome. Hi, Amy. Hi, Cindy. Hi, Jamie. Welcome. Welcome, everyone. You're back. You're finally home. Oh, you're fine. Don't worry. So I had been totally convinced of something else, and now I want to believe she's evil. Well, I wouldn't say evil. I would say that she didn't do any of her work and her parents didn't help her. She's just a wounded little girl who gets to come back and work through that's her trauma. That's what it is. She's not really evil. She dabbled with the dark side, though, and she's a very powerful witch. But we had a good reminder. Baby witches can be very dangerous. Thank God she didn't have a good mentor. Okay. Wait, Cindy, please start at the beginning before everyone gets confused. I am so glad you're here. Welcome, everyone. Thank you guys for coming. If you are confused or you're trying to correct anything, please start like a half an hour ago and work up and then jump in. Right now, we were just watching, or we're rereading, or we are reading the bind over hearing transcripts to get Mackenzie into adult court out of juvenile court. If you're just driving, welcome. Please rewind it and catch up and then jump in. Right now is confusing and it's not right. And please don't. It's confusing me and it's confusing me. So what we're doing is we are reading the transcripts. We just figured out the motions of the car. The car is if you please don't jump in the comments right now unless you've watched the evidence or the witness presentation of the cat crash report. If you're just getting here, I'm so glad you're here. Please start back there, though. It's confusing. It's confusing me, and it's not. I can't. Okay. So what we just listened to was the EDR report. What the troopers, or he's a police officer, said was he was explaining the motion of the car from the EDR report. The soft, well, it was like a 20-degree angle to the right, then 7 degrees back to the left. Then I think Davian dove forward, used his momentum and his weight, and jerked it to the right 140 degrees. That sent them along this curb. Oh, and she's going 88 miles an hour. Sent them along this curb. This curb right here sends them airborne. I don't think she hits the ground again till right here, and that's just a swoop. And then hits this, and the car lands here. The tires were not on the ground, I think, from here, from C. Oh, well, the curb airbags deployed. Okay, from C through E. I think she was airborne. Then that explains why Davian was on Dominic's lap. Then she makes contact, and it flew 15 feet over here. Okay, that's where we are. If you are just joining us, welcome. I'm so glad you're here. Please don't jump in the chat yet until you've gone back a half an hour or an hour when the second witness gets on the stand, because it's confusing and I can't read the chat when it's confusing because we just figured it out. Then we are about to go into a state trooper's reconstruction of the accident. I have a drone video that I just uploaded from the FOIA request that is 6 minutes long. I've never watched it. It just says drone. So we can, I don't think there's sound. Actually, there's not sound. Okay, well, that will give everyone time to catch up to, please don't jump in the chat until you've watched the second witness testify. Or I'm sorry, listen to him testify. Then jump in. But it's too confusing right now, and it's confusing me. Okay, there's no sound to this video of the drone, but it's really cool. And it's okay, we're on Con Air. We're not at the Ritz. We are going to... All right, it's uploading for us right now. And there's no sound. So if you're not watching, I will try to explain it. But there's not, I mean, it's a drone. Just come back later. Okay. We are... Oh, and I'm going to hide myself. Yay, welcome back. Actually, I'll just stay down here. Okay, there is no sound. What we are watching, I'm going to put it on like 2.5 or something because this is going to be a really long 6 minutes. Okay, oops. Okay, that's a little too fast. We're watching a drone video that was in the FOIA drop. And it's, the police did it as part of their evidence. So it is flying above the intersection. Why is that car going backwards? Oh, the cop. Oh, okay. I see what it's doing. Okay, so we're getting oriented. We're driving down the street. And now we're going to take a right onto Progress Drive. I'm guessing. Yeah. Okay. What in the heck? Oh, they must have set this all up, like stop traffic to do this. If this is going too fast, here. It is going, I just want to tell you in case it's too fast. It's like, I'll slow it down. 1.25 there. Okay. Okay, they did stop traffic. So this is Mackenzie. She's driving. She's taking the right on Progress Drive. It's a beautiful day in Ohio. And now that was a very controlled turn. She's driving down Progress. And you can see like the road is bumpy. I mean, it looks like everything in New England. Just kidding. But anyway, so we're driving down Progress. This is, I think she's building momentum. There's no sound at all to this, but that's really cool. They stopped all the traffic. Oh, no, they didn't. Is that a cop car or a regular car? No, it's just a regular car. Okay. So this is a drone flying down the street showing us Mackenzie's Drive. This was in the FOIA drop. And they're just showing us how, I mean, she has all, this is a straightaway. She has all this time to build speed. In a Camry, she would need it, I think. Okay. So the drone is still driving. It still looks like it's on a straightaway. So it's driving or acting like Mackenzie, driving. And she's building speed. I think she's like probably going 70 by now, if I had to guess. So she's driving along. It's a beautiful day in Ohio. Passing, it's like a bumpy, well, it's concrete, but I mean, it's an industrial part of the city, I think. And it's landscaped nicely. And she's going to make the first, so the road itself does like a left and then a right and then straight. They all talk about it in the interviews. So there's so if she had passed out, one of the things I think maybe it was Christine's interview, she couldn't have navigated these turns. They're not like sharp turns, but they're enough that you don't just go straight the whole way. So we're driving down. This is Mackenzie. I bet you she's like to 80 miles per hour by now, I'm guessing. And still drive. Oh, is that the dead end right ahead? Okay. Oh, yeah. I see. Whoa. Okay, so now panic, I'm guessing. So Dominic is going to jerk I think that's a dead end. Yeah, so Dominic, like, past this driveway, he's going to jerk the wheel to the right. And then our little psychopath, okay, right here, Dominic jerks it to the right. Then she jerks it. And then I think Davian dives forward, jerks it to the right, gets him on the grass. They go across the grass. Now they go across the grass, literally flying through the air. They hit the side of that Petco sign or that sign. Then they hit the wall. Oh, that's cool. That's the end of it. Well, almost. They just show you from this view, like what is around here. That's cool. Okay. So that was the drone fly through of their ride. I thought that was so cool. And I haven't seen it yet, but I liked it. That was awesome. I thought that was really cool. It felt like we were really there. Okay, so now, Con Air, your captain just needs a break. I just need to get a fresh drink and refresh. So, I could have done it while we were watching that. We'll watch it. I'll press play again for you guys. In case you're just joining us, welcome. Thank you. I'm so glad you're here. Please, if you're confused, please go back to the second witness on the stand. His name was Adam. And that was the first time that Mackenzie had a conflict of interest. She could have asked for a new counsel. She didn't. And I think that's why she didn't ask for or argue in her appeal ineffective counsel. All right, I'm going to play the drone again. There's no music. I can put elevator music on for you. The background is Mr. Mackenzie, her attorney, who's interrupting everyone and not letting anyone finish. And if you say that's what defense attorneys do, no, they don't have to be rude, in my opinion. But we see a number of rude defense attorneys. It's rare when we see good ones. So I'm going to show you guys this drone thing again. I just need to go get a drink, so I might be right back. There is no sound. I will play some no copyright sound so that if you're away, you don't think that we got kicked off. We'll do some night driving. That's okay. Well, I'm going to press play. I'm just going to go get a drink. Please grab a drink. Where are you guys coming from? Is that a new email? I'm going to refresh just in case. Okay, it's back. Woo. Oh, thanks. We got our audio team on it. Thanks, Bobby. Woo. Okay. I just got an email. Thank you, Jamie. Woo. Okay. Woo. Thanks. Thanks for your patience with Con Air. We don't know how old this flight or this plane is, but we're here. Okay. I just knew that was the yellow wire. All right, let's go back into this guy. And we're going to, okay, so what the court is asking Mackenzie right now is, I noticed that you keep turning your head from the screen. Are you okay? And what I'm guessing, because these were also with the FOIA dump, is these pictures were submitted into evidence. And I just saw Bobby mention something about a yellow wire. Wait, I'm going to go to the top of these so that I can figure out where we are. These are the evidence. Okay. There's something I just saw Bobby say about a yellow wire. You know what I did? I was pulling a Gritch. Hi, Gritch, if you're here. I don't know if you are, but I was magnifying everything just to see where things are. And why is there blood way back here? If Davian was up in this mess. All right. So I'm coming back to see. That was a reference to no sound. I was joking about the plane having a faulty yellow wire. It's all fun and games. And if anyone's actually flown Con Air, feel free to jump in and let us know. We're just making it up as we go. And I can't believe that was a reference. Oh, that was funny. Okay. Whew. Wooly, it's a drone video. Yeah. Oh, yeah, there's complimentary. Yeah, there's, I don't know. All I've ever heard anyone mention about flying on Con Air is they got 2 water bottles. And that's basically from like listening to kids on YouTube or people on YouTube. So I don't know if we get anything complimentary. Yes, Wooly. Hi, Amy. Thank you. Cindy, thank you. Mama Owens, thank you. Yeah, we just roll with it. Okay. Bobby, we need maintenance. Oh, there was turbulence. Yes. Maybe what we should call Bobby is our engineer. I don't know what you're really called, Bobby, but you are an engineer to us. You're our engineer. You're the sound guy and the food guy. Okay. The point was, okay, so that was a joke. Okay, good, because I was just trying to find a yellow wire. So what the court is asking Mackenzie right now is, I think she's, well, we're going to read it because I think she's asking her if she's okay because she is turning her head. And you guys, there we go. You don't need to see me. Unless you miss me, let me know. Okay. So the court, Mackenzie. All right, hold on. Oh my God, no way. You guys, I have never even read this. And the drone, well, I'm assuming the next video, they are literally, I saw in the comments, like, oh, I bet Mackenzie was shitting her pants when she saw that drone video. I was just showing it to us so we could all visualize it. And literally, They're literally submitting that drone, I think, because, all right, hold on. All right, so I think like the next paragraph is going to tell us they're watching this drone video. All right, I'm catching us up and then I'll move myself. I'll just come down here. I think literally they're about to play this in that drone video we just watched in court. All right. Your Honor, may I approach? Okay, so now this was, oh shoot, I can't remember. This is a trooper from the Ohio State Patrol. Okay, tell us how you became involved in this case. I was contacted by my supervisor, Sergeant Ryan Fox. We saw his name in Detective Awesome's report. There's something about December. Something came back. Oh, maybe this is when they get Dominic's cell phone, or when William Ellis submitted his cell phone videos of Mackenzie berating Dominic, acting like a real psycho. There's something significant about this December, like why they pulled more. Oh, I can't remember. We'll figure it out. All right. At the time, he advised me there was a request for assistance that had been made from the Strongsville Police Department referencing this case. He brought it up. He kind of brought me up to speed and apprised me of the known facts and circumstances surrounding this case, as well as the previous work that he had done on the, I'm going to remove, I just like it without a camera while I'm reading. Okay. Of the previous work he had done on this case, as far as downloading the vehicle involved for the Strongsville Police Department, and indicated that a video had been obtained. And he requested that I do a video time distance analysis of the speed leading up to the collision. Okay, these are surveillance videos. And we have them. Actually, I will find them while I am... I'm just going to find them so that when the court shows, or when this trooper shows them to the court, we can also watch them. Please hold. I'm just looking for these surveillance videos. So when they go, excuse me. Oh, excuse me. The captain is not tired. I just had a little yawn. Don't worry, we haven't been deleted if you're listening. I am just looking for... Oh, actually, this would be a good thing to watch. I have not been able to find this. Hold on. I'm going to share this with you guys. I've not been able to... Whoa, that's a little loud. Okay, here is just a clip of the...
Mackenzie Shirilla at the...
Whoa, that's a little bit loud. I'm just getting this already. This is the court that, like, I don't know what day this is, but we're just going to watch this, kind of get an idea what's going on in real time. So while we're watching that, I will also look for, hold on, how's this sound?
It is day 2 in the trial.
That's a little bit loud. I am just going to turn it down a tiny bit in case you have your headphones in. I don't want to blow your ears off.
Trial of the strong...
Jeez, this is really loud. All right. Hopefully that's okay.
Strongsville teen charged with murder in the deadly crash. Mackenzie Shirilla, at the time 17 years old, is accused of intentionally crashing a vehicle with her 20-year-old boyfriend, Dominic Russo, and his 19-year-old friend, Davion Flanagan, in the car. Now, the prosecution says she was going 100 miles per hour when she crashed into a building in northwest Strongsville in July of 2022. Those 2 young passengers died. Today, Russo's mother took the stand, at times in tears, as she recalled the death of her son. She said Shirilla has always maintained that she could not remember how that crash happened and told her in a text that her vision faded to black in the minutes before. Shirilla even telling her she wanted to get hypnotized so that she could remember exactly what happened. The prosecution presented that Shirilla's behavior toward Russo had become hostile, and to show this, they played a recording of Shirilla outside of his home just weeks before that crash.
Without you human heart, telling the bird to be caught out. You direct human part is I out stuck in the house, yes.
She threatened his property. She cracked right into his house.
Correct.
Did Dominic threaten the defendants?
No.
How would you describe Dominic's tone on these videos?
Very calm.
How would you describe the defendant's tone on these videos?
Irate and angry.
Coming up at 5 o'clock, we hear from Shirilla's defense team, who presented that everything was fine between Shirilla and Russo in the hours leading up to that fatal crash.
Sure, Jan. Okay. Oh, I love that interview. Okay. So now I'm going. Oh. Okay, that was loud. All right. Where are you, my loves? I was just looking for the first, the survey. Oh, please tell me you guys could see that. Okay. All right. Oh, she has a sling, and in the Netflix I can tell I'm getting tired. In the Netflix thing, the prosecutor asks why she has it in a sling. I thought it was the wrong arm, but that's the right arm. Okay. In the court. So that's just where we are in trial. That's a little snippet of trial. What I am looking for are here they are. Found the surveillance. Okay. And I'm going to try to do the exact same ones that the court is doing. Oh, I think this is it. I'm going to slow it way, way down. I think. All right. We're not looking at it yet. I just found it, but we will look at it shortly. And. Oh, Bobby. No, I haven't looked at that, but I will look at it. If you didn't notice, your captain is a tiny bit busy, but I will look at it. Yes. Thank you for sending it over. Okay. So now we're going to find our document, our court document, so that when they press play, we're going to press play. All right. Back to court. Oh, yeah. The hypnotist, I don't even think it would work because she doesn't want to know what happened. Whoa. Somehow we are in full screen over here. Okay. All right. So he's explaining how he got involved. Okay. Yep. I submitted it. Okay. Your Honor, may I approach? This is Exhibit 11. I'm handing you a copy of State's Exhibit 11. Do you recognize it? Yeah, I do. I reviewed the crash report and the case investigation conducted by the Strongsville Police Department. The EDR/CDR report obtained from the download that was conducted by Sergeant Fox, as well as 3 video files. Oh, it's pouring. I was like, what is that sound? That were also, excuse me, Con Air needs to close its windows. We don't want to go down with the ship. Okay. That were obtained by the, okay, these are the 3 surveillance videos obtained by the Strongsville Police Department. Okay, and you reviewed the 3 video files. Would you recognize these videos if I were to show them to you? Yeah, I would. I'm going to show you what's been numbered as State's Exhibit 1. Is there sound on the video? No, there's no sound on this video, Your Honor. I'll stop it right here just so the video is on the screen and pause. Oh, that's what we're doing. And I slowed ours down because, I mean, this is like a 10-second video. Unless he says it's another one. We have a 10-second video and we have another one that is 33 seconds. So we'll see which one they're playing in court so we can be on it. Okay, I'll stop it right there just so the video is on the screen. And I'll pause. Okay, we are doing the same thing over here in... Do you recognize this? Yeah, I do. This would be the oldest chronologically in the order of the videos. Judge, this is not an objection. I would like, with your permission, to allow my client to leave the courtroom during this portion. She is okay with that. Oh, you don't want to watch yourself murdering people? Mackenzie, I can tell just for purposes of the record, obviously, that you are turning your head away from the screen. Is this something that you wish to leave the courtroom for? Oh, yes, Your Honor. Okay, you obviously have the right to assist in your defense. So I just want to make sure that this is your choice, that it's something that you want to do, which is totally fine. Mackenzie Shirilla left the courtroom. Oh, that's annoying. No, you should have to watch it. Thank you. Thank you, Judge. Sure, you may proceed. Thank you, Your Honor. I'm going to stop at 22 seconds. Oh, we have the wrong video pulled up. We have a different one. We are going to pull up the 33-second video that is now playing in court. And we are also going to stop it at 22 seconds. Oh, none of them? I hope. I don't know. Oh, whoa, this one's going fast too. All right, please hold. Okay. I might slow this one down too. I mean, this isn't that fast, comparatively speaking. Okay. Oh, hey. All right. Now. All right, what did Troop just say? Let's see what the prosecution's doing. Thank you, Your Honor. Okay, I'm going to stop at 22 seconds. Okay. So does he play it? Did you visit the scene at Pearl and Progress? I did drive through the area, yes. Okay, and just for the record, can you describe the clip of the video that we just saw? Oh, and he's going to stop it at 22 seconds. So are we. Okay. It's just like we're in court. All right, so this has no sound and we're stopping it at 22 seconds. This is the right turn from Pearl to Progress, okay? Thank you for coming to court today. Bet you're on. Oh wait, I just got distracted, sorry. Oh, nice controlled turn. Okay. And he stopped it at 22 seconds. Well, we'll stop it at 20. Okay. Now I'll go back to court documents. And just for the record, can you describe the clip of the video that we just saw? So that was the vehicle involved in the crash, the black Camry turning off of Pearl Road onto Progress Drive. There is a timestamp on this video for the record. What is the timestamp? If you can see it from here. Oh! We can. Oops. Oh my gosh. Golly. This FOIA dump was amazing. Oh, wait. I can't click on it with our thing now. Okay, so in the top left-hand corner, if you're not watching, it says 534. I stopped it at 36 instead of 38, but that's because they stopped it at 22 seconds and we stopped it at 20. Is there a timestamp on the video for the record? Yes, it's 5:34:36. I'm sorry, 5:34:38, July 31st, 2022. Are you trained as a traffic officer as well? Yeah, don't they all have to be trained as traffic officers? At cop camp, I think that's part of it. I don't know. Do you have any comments that you would like to make about your observations of the car making that right-hand turn? Well, it's early in the morning of a somewhat lit area. That vehicle was controlled, a smooth, methodical turn with the use of a turn signal. Yep, slow, methodical use of a turn signal. You can still see it blinking, okay? And I'll just leave it on the vehicle turning as we talk. Okay, I'm going to show you another video. This is State's Exhibit 2. Do you recognize this? Yeah. This was the second video that I was provided with. It was obtained from Lincoln Parma Movers, Inc., located on Progress Drive. Could you summarize what Exit 2 depicts? It depicts the Toyota Camry involved in the collision traveling west on Progress. I'm going to play. Okay, so wait, first we have to play 2. Hold on, slow down, troop. Okay, you guys are seeing this? Making sure before we press play. Okay. Yeah, we are lucky that corner had a camera. All right, so we are going to play. This is Exhibit 2. Or perhaps this is all of Exhibit 1. And, okay, that's Exhibit 1. Well, we have Exhibit 2 waiting in the wings. And I slowed this way, way down because let's just say this little bitch is going really fast. And it's muted. I muted it. There's one video that I hate hearing the crash. Like the actual sound of it. I don't know. So anyway, okay, so now we're watching Exhibit 2. And I slowed it down to half speed. And I probably slowed it down before I uploaded it because it's so fast you can't even see it. So we're watching. Oh, wait, share this tab. Okay. Now we are going to keep your eye, if you're watching, on this top right-hand corner. Okay, that's where we're going to see this car. And it's at half speed right now. And here comes the car. That's half speed. And now Exhibit 3. I don't know if I have the other surveillance video uploaded. I can't remember. Let me just check really quickly so we can really be on. Well, I guess the last one. I have not uploaded it yet, but I do want to watch it for the sake of either proving or disproving Rosie wrong. That there's a 40-minute surveillance video. And I will upload it, but not right now. I'm getting tired. Now I just want to read and be good. Okay. So now we are back to court. Okay. This was obtained from Lincoln Parma Movers, Inc. Okay. Could you summarize it? It depicts Toyota Camry involved in this collision. Okay. Summarize states 3. This video, there are 2 cameras here obtained from, this is a lot of oil. Eurofin's test oil located on the corner of Progress Drive in Alameda, if I'm pronouncing that correctly. This depicts the Toyota, shows the Toyota traveling west on Progress Drive, approaching the T intersection, traveling through the T intersection, and striking an industrial business sign before colliding with the building. Wait, that's not in the FOIA drop. All we can always ever see is just a little bit in the corner. Or maybe I'm wrong. I don't know. Okay. Before colliding with the building, which I believe is the Plidco building located along the west edge of the intersection. Were you able to audibly hear the car as it traveled toward the Plidco building well before you were able to see it? Oh, yeah, we can. Where is that video? I have that somewhere. I'd like to go through your report. When you get to the scene of this crash, oh, you know what we have? What steps do you take in your investigation? We have all the first responder things uploaded. Okay, so I responded for the first time notified of this on December 7th, the court. 1 second. Do you want her to come back for this, Mr. McDonald? Are you going to play anymore? I'm not planning on playing anymore. Okay, sure. Mackenzie returns. Poor Mackenzie. She couldn't watch herself murdering her friends. The court. Okay, Mackenzie is back in the courtroom. You may proceed. Thanks. When you arrive on the scene, what steps do you take to complete your investigation? Oh, does anyone remember why this is in December? Something happens and this triggers this December. I can't remember what. All right. When you arrive on the scene, what steps do you take to complete your investigation? So I responded the first time on December 8th. At that time, I had not viewed any videotape from the Parma Lincoln Movers. I did not have that in my possession, but I had reviewed the one from Eurofin's test oil. So that was the site that I responded to. Upon arrival, I conducted kind of a scene walkthrough. Excuse me. I examined the area, got a lay of the land. Oh, we can examine the area and get a lay of the land. Okay, we're examining the area and getting a lay of the land. I observed, okay, so to speak, I observed and identified the 2 camera vantage points that the video had been obtained from. At that point, I deployed a, whoa, this is like some dorky stuff that I am not in. I don't know anything about robotics, but I'll bring it back to this. I deployed a Trimble SX10 robotic total station set that up, went through the setup process and procedure, and began to do a forensic mapping of the scene with the intent of conducting a time distance analysis based upon the video. So I'll stop you. Tell us a little bit about the Trimble machine. It's essentially equipment commonly used in surveying. Oh, that makes sense. For construction or road building type purposes. Yes, Cindy, one of the things in Mama Christine Russo's interview is they tell her that they think that Dominic had an iPad and no one's found it. Well, coincidentally. Okay. Tell us a little bit more about this. Okay, it's used for surveying. That makes sense. It's a robotic. It has a head essentially to do it. I mount it on top of a tripod. Oh, that's cool. At this point, I measure the height over the ground, so I know the distance of my ground point. And from there, I can take shots essentially using precision lasers, either reflectorless shots or shots with a reflector with a prism on top of the pole that I've got. Okay, so, hey, Canton, Ohio is making you guys look like idiots, as if you couldn't anymore. Go. So far, I'm impressed with Ohio. I'm impressed with the judicial system and professionalism. Okay, so go on. Continue to walk us through the steps that you're taking after you set up this Trimble and start to take the precision shots. So immediately, the first thing I do is that I laid out a nylon tape measure, the way I can take a measurement point and verify the precision of the instrument. And then I proceed to go ahead and begin mapping or creating a forensic map, shooting all the different points of interest of the surrounding landscape at the scene. This is in Detective Awesome's report. I remember him talking about it. Okay, and there are various diagrams of these steps that you're taking in your report. Is that correct? Yep. So once I was done mapping it, essentially, I brought those files back to my computer at the office and imported them into a CAD program in order to render a scaled diagram based upon these measurements or the measurement points that I took. That way, I can take additional measurements off of that scaled diagram. Okay, I have a diagram here. I want to find the diagram. I know we have it. This is page 2 of your report. What does the first diagram indicate? So the top image is labeled endpoint name identifier. So that's all of the points that I shot on the first scene setup. The court. What's with the red marks on it? The witness. Yes, Your Honor. Near, actually, the green little cross mark or the points, as I go through and take each of these points, I label them. Oh, or I tag them. The gray ones you said? They're green. Oh, hold on. The background's gray and they're green. I want to find this report. And then there's red tags that I put on everything so I can identify what point was what. Okay, I got it. Thank you. I'm going to ask, do you guys want me to, should I find this report? I'm curious, but anyway. And there's 2 diagrams for this map, the precision check. Correct. So I laid that nylon tape out so I had known measurements there. I shot points at various intervals along there. That way I could verify the precision of the instrument, both pre and, okay. What they're saying is they don't fuck around and find out, like Canton, Massachusetts. This is a lot of interesting, fun data that if you'd like to read it on your own, please do. He's just like making it perfect. And I love that. Like he gets it down to 0.02 feet. The precision of the instruments were found to be within 0.02 feet which is a little bit less than a 1/4 inch at the beginning of the survey and within 0.012 at the conclusion of the survey. We're about to start talking in millimeters. Okay, I'm moving on to page 3. The first diagram. I want to find this report. I wonder what it's called. It'll be way easier to watch it. What is the guy's name? Okay. I'm just scrolling back so I can find the report. I want to see what this report's. I know that this guy, Detective Austin, put it in his report. Okay, Shirilla leaves because she's cool. Oh, actually, while I'm scrolling, I'll share this with you. I'm not reading. I'm just scrolling. All right. I wonder if I find it in exhibit. I'm just going to try to find that report. I remember seeing it. Oh, if I can't find it, I'll look at the kid's name. Exhibit 11. Oh, I might have already found it. Oh, Jennifer McCabe deleted evidence, Exhibit 11. All right, is this our guy? Oh, I think this might be our man. Let me check. Oh, no, this is it. Oh, wait, is this it? Well, did we find it? I think we just found it. Okay. What's this name? One last thing. I just want to double check that this is the right report. God, I love doing this stuff. All right. What is this kid's name? Trooper Elliot D. Rawson. I'm going to just check this one more time. Make sure it's the right report. Rawson. Okay, sorry. Thanks for holding. I just want to find this report because all right. Oh boy. Oh my gosh. Rawson's all over these reports. Okay. Oh, here it is. Yes. Go team. All right, we found it. Oh, yes. Oh, gosh. The captain is got your back. All right. This is the report of the trooper Rawson, E.D. Rawson, that's on the stand right now. Oh, wait. Let me make sure you guys can see this. Okay. He's on the stand. And he is right here. Okay. I'm not going to read all of this. If you'd like to read it, the FOIA drop is available, or I can send you a link. I just want to see the pictures of what he, okay. So this is what the judge was just asking about. Like, what is all this stuff? Well, let's check. Oh, okay. This is where the West camera is. Oh, wow. That's cool. Okay. What this guy is testifying to is, oh, this is the build. Okay, let's back up. Building and flagpole. Okay, so she comes right through here. There's a tree, AC. I don't know what all this is. There was a camera. Okay. All right. That's what the court was just asking. Like, what is all this stuff? So then, now that we've seen to the like millimeter, points and point name identifiers. Okay. Holy smokes. This is a forensic map excerpt of the precision check. Okay. Ohio, you really are winning at accident reconstruction. Oh, and this is him explaining it all. I mean, I'm just trying to figure out where the judge is. Yeah, okay. Here he's saying, explaining what's what. Wow. This is impressive. I must say, Ohio, you are pretty good. All right. Back to this. So, oh, shoot. I'm going to show you guys the map again. I have to scroll through it and get us back to where we were. All right. That's impressive. I'm really impressed with Ohio. They're not Idaho, and they're certainly not Canton. Or even Kylie Rodney. No, none of that. Okay, she's back in the courtroom. He's explaining all of these pictures, what we're looking at. The red marks, yep, we read that. The green ones, okay. Got it. These are precision checks, correct. Okay, here we go. So I laid the nylon. This is how the officer got these. It was like down, I thought we were going to get into millimeters, like her exact path. Okay. So I laid the nylon tape. So I had a measurement there. I shot points at various intervals along there, and that way I could verify the precision of the instrument both pre and post, at the beginning and at the end of my survey. Oh, so he's like a surveyor. Okay, that's cool. And how precise were you shooting? So with this one, okay, I'll show you guys what he's saying while I read it out loud. So with this one, the precision instruments were found to be within 0.02 feet, which is a little bit less than a quarter inch at the beginning of the survey, and within 0.012 at the conclusion of the survey. Okay, I'm going to move on to page 3. So are we. Okay. All right, so now we're on page 3. Oh my gosh, you guys, it's like we're in court. Yay. Okay, so now we're on page 3. We're sitting with the cops. We're sitting with the courtroom. Okay, so we're on page 3. I'm just going to back this out so we can see the whole thing. Forensic map, scale diagram with point codes. Whoa. All right, we have to get it a little closer so we can see what he's talking about. Wow, this is unbelievably cool. All right, so now I am moving on to page 3, the first diagram. So what you guys are looking at, the first diagram on page 3 at the top, that's essentially the same diagram as the first page with all the points that I shot. However, I kind of complete the diagram to make it recognizable as far as the top-down view of the crash site and approaching the roadway leading up to it. Okay, and then the second diagram on page 3. Wow. Imagine, I just must say, I am so impressed with Ohio right now. Everything about it so far, so good compared to some of the other states we've seen. All right. And I thought that Florida was going to be the only one that didn't get screwed. All right. So now this is the second diagram. That's the exact same thing with the point wire turned off. Okay. So now you've got your crash scene reconstructed. Is that right? Yeah. I've got a forensic map of the crash scene. Yes. Okay. Now let's go on to page 4. Okay. Moving on to page 4. Whoa. This is the video analysis detail from Eurofins test oil. Oh, that's the camera location. Got it. Okay. Back it up. So south building face. Okay. There's the camera. Got it. Okay. Oops. All right. So then he's going to ask us, we'll move on to page 4. That's kind of a video analysis. These are images that I took through the camera function of that same Trimble SX10 robotic total station of the two faces of the Eurofins test oil building, and the yellow circles are the 2 cameras that captured the footage related to this crash. Okay, so there's one, and there's the other one. Wow. Holy smokes, I am so impressed with Ohio. Okay. All right, so he explains that. Then why is the location of the camera important? The location of the camera is vital to the time distance analysis. Essentially, the origin that, because I took that photo with the total station, that is where I set the total station up, where I could have the best vantage point to everything that I needed to shoot while I was out there. So I also shot the actual camera lenses because as far as placing a vehicle for a time distance analysis, I needed to place that vehicle based on that camera's vantage point. What? This guy is badass. I am so impressed. So by knowing where the camera is camera's located at. Essentially, I can use those reference points and place that vehicle along the roadway as it approached the crash site. Okay, on page 5, you've got a table here at the bottom of page 5. Okay. Are we on page 5? We have a table. Oh, yes, we do. I've taken screenshots of this. Okay. All right. Oh my goodness. Wow. This guy is good, I must say. Why don't we land in Ohio tonight? Because if you're going to get in an accident, you want these detectives and these cops to solve it. Wow. Oh, that is so cool. Oh, here's the stop sign. Okay. And then, well, he's going to explain it. I'll let the court explain it. Hold on. Okay. All right. Okay. On page 5, you got a table here at the bottom of page 5. What is that? Those are screenshots that I included in my report. They were measurements taken by the Strongville Police Department officers during the initial investigation at the scene. Unfortunately, in this case, I was at the disadvantage of a lot of the physical evidence from the crash scene, being that we were months after the fact and it was gone. So I imported their measurements into my scale diagram for the sole purpose of helping to align the vehicle where it was on the roadway leading up to the crash. Okay. You're trained to do this. Yeah, he's definitely an expert. Yes, this is a task I've done before. All right. What about the video analysis? The in-depth video analysis section on page 5. Okay. Whoa. Are we on page 5? Yeah. Okay. Oh, wait, that's page 5. Oh, this is the video analysis. Okay. Sorry, team. We got ahead of ourselves. And I can't make it any bigger or it won't all fit. So essentially, this is just based upon the review of the video footage. I kind of identified some key points to the video at what specific time intervals, at what time intervals of interest, at like what was happening on the video. And what was the purpose of doing that? Just to provide the reader of the report a synopsis of what we're about to get into with more in-depth stuff on the following pages. Okay, page 6, the first diagram. Okay, now we're officially on page 6. Okay. Page 6, first diagram. Can make this a little bigger. Oh, wow. Yeah, these guys are good. Okay. And Proctor, take notes if you could ever be a cop again. Okay. All right. So we're on page 6, the first diagram. That is the imported measurements. Basically, I recreated the steps that the Strongsville officers took to take these measurements in order to place their measurements onto my scale diagram. And then the second diagram. Whoa. Okay, so this is the second diagram. Oh, he's showing us where the cameras are to get. Okay. Screenshot. All right. So then the second diagram. The second diagram shows my scale diagram. Within the red circles is the camera locations of the 2 cameras. Okay, we got that. I can make this a little bigger. Oh, so, okay. The 2 camera locations that captured the footage that were equipped on the Eurofins test oil building, and the bright green lines represent the approximate vantage point or the camera angle views from each of those cameras. Okay. Whoa. Oh, okay. So this is exactly where the camera was facing when she drove by like a little psychopath. And this camera. Whoa. Okay. All right. Can you explain this diagram on page 7? Yes, page 7. I'm sorry. Okay, so, excuse me, troop. We're coming. We have to get our help. Ooh, okay. Oh, I see. Okay, this is cool. We just watched this video. Okay. Wow, this is beyond. I must say. All right, so Ohio, if you're going to get in a fatal accident or an accident, the Ohio cops are the ones you want. All right, this is what they're showing in court right now. The above image displays a screenshot taken from the southern camera's vantage point at 5:39:41 a.m. Oh yeah, 5:39:41. Man, imagine if Canton had actual timestamps. The Toyota can be seen entering the camera frame from the left, traveling west on Progress Drive. Yeah, we just watched it. Okay. Now, what's court saying? Okay, so page 7. The first diagram is the point of interest in the video as far as the time distance analysis that occurred at 5:39:41 a.m. The right front headlight of the Toyota came into the first camera frame view. So in the inset where I'm essentially just showing the process of how I place that vehicle on the scaled diagram. So we get the top-down view of where that vehicle was located at that specific time interval. Wow, okay. So it's fair to say that the square here, oh shoot. Okay, so it's fair to say that the square here, oh, okay. So it's fair to say that the square here, the red spot here is your indication of the first time the collision begins to appear in the video frame. Does that coincide with where you've got the model car in your diagram on the inset? It does. Okay, and then the next diagram. So this would be the next 1 second time. And oh, so these are going by in seconds. And this is where it is on the road. So we've done the left. Wait, we did right, left, right. And so the car is right here. And this is the camera that took the shot. Oh, excuse me, Mackenzie. When you were planning this murder, you probably didn't count for these. Okay, so, all right. So now where are we? Troop. The next diagram. So this would be the next 1 second interval. Okay, so we're going to the next diagram. Oh, I see what he's doing. Okay. So it's literally showing it traveling. It's this, I think, camera that we have 40 minutes. So if Rosie was really there or not there, we can watch it. All right. So now we have that diagram. I just have to come a little bit bigger. Oh, why don't I do it? There we go. Whoa. We don't need to fit one page, fit to width. Okay. So where are we? What are we looking at here? Oh, okay. So this camera is set back here. Oh, the same camera is catching her airborne. Literally, she's airborne right here based on our reconstruction. And it's also catching her hitting the building. Okay. All right. So what does Troop say? Okay, the next 1 second. This is showing where the Toyota had advanced to 5:39:42. 5:39:42. Well, excuse me, Troop. It's like we're sitting in the courtroom. And then again, on the inset or the smaller image of my diagram, the overlay there, that's just where I was able to line up and place the Toyota at the specific time interval. Okay, we're moving on to the next page. Okay, that's pretty much the most badass thing. She's so screwed. If I were her, I would be throwing up. There is no chance. Look at how meticulous. So this one camera has her here, here. Oh, they have different angles of the same. Oh, the other camera was back here. Okay. So now we're here. Now what does Troop want to tell us? Okay, next page. We just did that. Essentially, we're doing the same thing. This is at the 5:39:43. 5:49:42. Where's the timestamp? I don't know, but it's the same thing 1 second later. Okay, got it. All right. Am I missing a timestamp? I guess I'm getting too into this. All right, the Toyota has continued its western movement, and it is now off the roadway. So this is when Davian jumps on the steering wheel, and it's beginning to collide. Oh, wait, it's off the roadway. Oh, no, this is past all that. She hit the sign. Okay, where's our sign? I have pictures of our sign. What is this? Okay. Wow. These guys are so good. Even the fire department did a really good like a forensics diagram. Okay, I am looking for a picture. Oh, here it is. Okay. This is also another picture that was submitted into court of the sign. So see how she just clipped it? I get it. Okay, so remember earlier when we were talking about how the boys like saved their lives or like turned on the EDR for us so that we could record this stuff? Because she just literally clipped the sign, it wouldn't have triggered the event data recorder. And when you look at this, it does look like, I mean, compared to it, it's like a clip. Okay, now we're on the same page. At the bottom, this is bouncing through the other camera that was obtained from the Eurofins test oil building. Okay, there was a 1 second timestamp discrepancy. God, these guys are so anal. There's a 1 second timestamp discrepancy between the two videos. So for the purpose of my analysis, because of that, I did not merge that video analysis together. Okay. I treated them separately and independently. Essentially, the vehicle is at the same place at the same time, but the timestamps, for a reason unbeknownst to me, are 1 second apart. God, this guy is so anal and so awesome. But this was from the other camera vantage point. Again, this is at the 5:39:41 timestamp for this specific camera vantage point. All right, wait, are we missing some reports? Oh no. This is just speed, velocity, distance. What class did I learn all this in? This guy, we learned this. I remember my teacher was Miss Town. I don't know why I was learning this, but I remember learning it. Okay. I am going to read these. S equals speed in miles per hour. V is the velocity in feet per second. D is the distance in feet. The measurement taken from the forensic map. And he used that Trimble SX10. T is the time in seconds. The time established per surveillance camera footage of the crash. Toyota total. Okay, velocity equals distance divided by time. Yeah, we get that. Okay. Speed is the velocity. Whoa. I bet you Proctor and Trooper Paul literally, imagine if, God, what is his name? AJ, Alan Jackson presented this and was like, oh, actually, I did my own. He was like actually, speaking of, he did something with airplanes too, Bobby. I don't remember, but he's definitely the smartest guy in the room. Okay. If anyone knows how to read this or cares, please grab the FOIA request because you lost me at hello on these. Oh, this is how they're figuring out. You know what they're doing? They're comparing this, they will, I bet, to the Life 360 because in the Life 360, we have, oh, wait, it's not in that report. In the Life 360, I bet you what they're going to do is compare it to Life 360. Where's our Life 360 report? Please be in here. Darn. But I bet that's what all of this is going to figure out is right where Life 360 said 90. This guy's thing is going to do it too. All right. Well. All right, honey, we're moving to Ohio. Okay, so they were 1 second off. Moving on to the next page. This is the 5:39:42 timestamp from the specific camera vantage point. And again, just as with the first series, it's 1 second later. The vehicles begin to collide with the commercial structure. And then the speed analysis. Oh, that's what we were just looking at. I thought that my Life 360. This is the speed analysis. I am just looking for the Life 360 thing. I have it literally. I thought it was right here. Well, okay, so some homework for Kate is to put all the crash stuff together. I'm going to look at one other thing. And if it's not right here, then we'll just keep going. But I bet that's what they're going to compare it to Life 360. As if we had to double check Google, but whatever. Okay. So come here. Ah, found it. All right, here's our Life 360. I'm gonna, oh. Okay, I bet you somewhere in this, he's gonna say, or maybe they won't even introduce Life 360. I don't know. I've never seen this, but I'm just guessing that it's gonna match Life 360 perfect. Oh, okay. All right, so thank you for your patience while you're flying Con Air. I hope you're comfortable. I'm just grabbing the Life 360 thing so we can, I know it's going to be the same. I mean, it's Google, but. Wow, this is pretty impressive. Maybe it's just my dorkiness. All right, so as that's downloading, I'm going to add, okay, thank you. I'm just adding the Life 360 thing in here so that we can look at it. I understand that part. Okay. All right. Life 360 is uploading. Okay, Clyde with the commercial structure and then the speed analysis. Okay, we just looked at that. So essentially, for the speed analysis, I identified that the Toyota was in the view of these cameras for approximately 2 seconds. From that point, knowing where the vehicle was at the specific points in time, I was able to take measure. I don't even think Mackenzie understands how screwed she is. Or her mom either, because this is pretty much, you're done. At specific points in time, I was able to take measurements of travel distance between these 1 second time intervals. And from that point, it's a simple time over distance calculation to determine the speed for the Toyota over those various time intervals. Simple. Come on, guys. It's a very simple thing. That's at what speed did you determine that the Toyota was traveling? So I did a total over 2 second time window and then broke it down into individual 1 second time set. Whoa. God, he does it by the second. This guy is so good. I'm so impressed. Whoa. I love this. Man, this is right up my alley. Okay. Based on the video obtained from Eurofin's test oil, the Toyota averaged approximately 88.8608 miles per hour over that 2 second time interval. It averaged 97 miles per hour over the first segment. When I broke it down into the individual 2 segments, oh, that was the average, 97. Then 80 miles per hour after it departed the roadway. Oh, so after she leaves, this is still uploading. Okay, let me find it. Whoa. I'm just looking for the picture that he's explaining right now. I am so impressed. Okay. Okay, back it up so we can all see it. Wow. Okay. Oh, this is Life 360. We have another one that shows us more. Okay. He's showing this right here. All right. This is what he's showing. The 88 miles per hour right here and 97. Okay. After it departed the roadway, so that is right, he's saying like right here, after it departed the roadway. Yeah, okay. As it departed the roadway a second time, yep, we have seen this because we know that the boys were here trying to save themselves from this little psychopath. Okay. The roadway the second time and began to crash into the commercial sign and into the Plitco building. As a part of your analysis, are you able to offer any explanation for the reduction in speed? Well, between the first segment and the second segment, the Toyota had already departed from the roadway once or began to depart from the roadway. As the vehicle departs the roadway a second time, we have coefficients of friction and crash rate disruption for how a vehicle interacts with the surface it's traveling. Okay, well, because the friction was the tire spinning but not making contact, I bet. I don't know, I'm guessing. Additionally, as the vehicle struck the commercial sign, okay, back to our sign. I'm going to show us our sign again. She just like, comparatively speaking, barely touched. There it is. Okay, so she barely touched the sign. Oh, so that slowed the vehicle down, not her braking. It was this, hitting this. And by hitting, I mean, yikes. Okay. All right, as the vehicle departs the roadway the second time, we have coefficients of friction and the crash rate disruption. Okay, yeah. For how a vehicle interacts with the surface that is traveling. Additionally, as the vehicle struck the commercial sign, that began to slow down the vehicle prior to striking the building as well. I'll take you to page 12 of your report. This is page 11. Okay, let's get to page 12. Okay, let's get to page 12. And we are also on page 12, okay? I don't know what any of this is, but I'll blow it up for you so you can read it. Oh, we already saw this, kind of. It's like too big for the thing. Okay. So now the court is on page 12 and we are on page 12. Okay. You testified that you went to the crash scene twice. Is that correct? That's correct. After conducting the first mapping, it was actually later that afternoon when I got back to the office, it was brought to my attention that there was a second video. And that was from, oh, that's annoying. This poor guy, he did all the work in the morning, gets back to the office, and then was told or found out about the Parma Lincoln Movers video. So at that point, I reviewed that video and then ultimately returned to the scene at a later date and conducted the same setup process. But it was further east down the road in front of those Parma bitches, Lincoln Movers, to go through the same process and do the speed analysis over that video stretch. You took the same steps that you've already described for the court, the same machine and the same steps, yes. Okay, but I'm going to walk through these and just identify the page, and I'll be moving the diagram here on this page. Again, that's showing all of the measurement points. Okay, we're going to do the same thing. So this is the second one. That's showing all the measurement points that I took, as well as the completed scale diagram to kind of give you that top-down view of the crash scene. Okay, so he's doing the exact same thing from a different angle of the cameras. In the middle images with these 2 points turned off. Okay, that was the image that I took I utilized Google Earth Street View, but the yellow circle is the camera that offered the video for this case. What? Whoa, man. Here's the Google Earth image of the Street View. Yikes. Okay. The yellow circle is the camera that offered video for this case. All right. And the diagram on page 14. Okay. This is really dorky. And so this is where the camera was. All right. Wait a minute. Where are we? So this is before the other cameras, I think. I don't know. Well, let's keep reading. So the diagram on page 14, same as before. This is showing the scaled diagram, the location of the camera with the red circle, as well as the bright green line, showing the approximate camera vantage point or the camera view angle. And then on page 15, you have a screen overlay inserted into the video. Okay, hold on. I want to look at page 15. Whoa. Okay. You're done. Sorry, Mackenzie. Thanks for coming. You're done. And then on page 15, you have a screen overlay inserted onto the video in the squares, indicating the location of the cars that traveled throughout the video. Is that correct? That's correct. That's probably the 40-minute video. I didn't upload it yet. I'll have to find it. Okay. Is that correct? Yeah, that's correct. All right, on page 16. On page 16, that's showing an overlay with the red lines indicating the landmarks that were used to place the vehicle on the roadway as it traversed through. Okay, so next one, and then he's pretty much just burying Mackenzie. Like, you're done. Oh my gosh. Here's the points of interest so that he can do his math. Okay. Did you make any conclusions on the second, or various time intervals? Did you make any conclusions on the second video? Yes, I did. The same type of work that I did with the first video. I determined that the Toyota averaged 97 miles per hour over the duration that it was in view or analyzed for this camera. For segment 1, it was at approximately 97.48 miles per hour. Segment 2, it was at 98.185 miles per hour. Did you reach any other conclusions in your analysis of this crash? Essentially, looking at all of the available evidence, the reports from the Strongville Police Department, as well as the work completed by Sergeant Fox, I did review the airbag control module or the evidence data recorder, the CDR report from Toyota, and used that or compared that to the work that I had conducted. And how does it compare to the work that you conducted? They were within an extremely tight tolerance of one another. One moment, Your Honor. Sure. No further questions. Thank you. Oh, Mrs. Mackenzie. I need a drink before Mrs. Mackenzie starts speaking. Okay, let's just assume we know that Mrs. Mackenzie, that's the name of this attorney, didn't review any of the prosecution's evidence. Why would you try to fight? This is what Chris Cuomo was talking about. Why are you trying to fight data? You can't. There's no argument here. I mean, this guy does not play. And that's why Chris Cuomo kept saying, why didn't you fight her impaired judgment? I mean, I'm guessing that this is about to become a losing battle because nothing that he says can really let's try to poke holes in it. All right. Officer, how are you doing today? I'm good. How about yourself? Oh, I'm tired. I'm going to ask you a series of questions. And if you don't understand the question, just ask me to repeat it or rephrase it. If you answer the question, I'll assume you understood it, right? Yes, sir. Did you talk with the previous witness, McQuaid? I have not. So 0? So 0? Well, I saw him in the hallway, but I had no interruption, just like Mackenzie. Well, I saw him in the hallway, but I had no. It seems like this street progress was a straight street, right? Well, it was relatively straight. If you'd let me finish my last sentence, I believe there was a slight arc at various points, but it was relatively straight. Relatively straight. But are there arcs through there, right? Yeah. Yes. What was the condition of the road when you went through it? It doesn't matter, you dumbass, because he's using points like stationary points like the camera. Well, it was a concrete surface, if memory serves me correctly. A little bit rough in various patches. A little bit rough or real rough? Well, it depends on the patch. Oh, that was a good answer. That was awesome. Correct. I mean, there were potholes there that were as big as 2 feet by 8 inches deep. Is that correct? I freaking hope that he says no. I didn't measure the specific potholes. Oh God, that guy is good. But you were there. I did drive through the scene. I was at the scene twice. Would you disagree that there are at least 25 potholes, chuck holes of significant size? He's going to be like, no, that wasn't my job. My job was the surveillance. Again, okay, wait. Would you disagree that there are at least 25 chuck holes, potholes of significant size? Again, I didn't count. So I don't want to put a number on it, but the road was not in optimal condition. And when you were driving, your car was bumpy, right? A little bit. Okay. Oh, this guy is so disrespectful. Okay, now Patrolman McQuaid talked about hard right turns, a hard left turn, and an extremely hard right turn. Were you familiar with any of that information? No, I'm not. That was not his job. His job was not to figure out how the Toyota turned. Oh. So you didn't attempt to coordinate with his report when those events occurred with what you, oh my gosh, yes, I am so proud of this trooper. He cut him off. Oh, interrupt him. I have not seen his report. I reviewed the CDO, so some report obtained by Sergeant Fox. Who's CDO? That must be, I don't know what it is, but it's somebody's report. Oh no, okay. All right. The CDO report obtained by Sergeant Fox. Would you that 90 miles an hour, 148-degree hard is a hard right turn? Is a hard turn, right? Yeah. How about just a 37 degrees back to the left? That's another pretty hard turn, right? At that speed, it would be noticeable, yes. Right. And you don't know how many occupants were in the car or anything like that? Question mark. I would need, you weren't there. This is so rude. Well, I would need the crash report prepared by the Strongsville Police Department, but no, I was not there. And what type of car is this? It's a Toyota Camry. I'd have to refer to my reports for the year. Sure, please refer to it. It's a 1918 Toyota Camry. Okay, 2 seats up front and then the back seat. I never saw the car, but that's the traditional configuration of a 4-passenger car, like a 4-door, and a center console, right? That's correct. And when I say center console, what does that mean? Well, that would be the area that it's got the flip top you can store items in. Driver, center console, flip up, passenger, right? Oh, okay. All right, hold on. We have another picture for this. That wasn't, so he's just like showing him. Okay, that's correct. But again, not his job. That's not his job to figure any of this out. You didn't see, were you able to determine where the car struck the curb? I was at a disadvantage, being that a lot of the physical evidence was gone by the time I responded. That is why I utilized the measurements taken by the Strongsville Police Department. And obviously, you wish you would have been called out earlier. I do. And do you think you could have done a better report, right? Whoa. And do you think you could have done a better report, right? I do. Okay, not your fault, right? Correct. Did you testify that the car left the roadway 2 separate times? Yes. Okay. Do you know where it was that the car left the roadway 2 separate times? Based on, let's get his report because this guy sucks. All right. So I'm going to do it in the easy to read version that is for me. Okay. So this is what he's asking him. Again, this is his job, but the other questions are not his job. Okay. All right. This is what this okay. Do you know where it was that the car left the roadway 2 separate times? Well, based upon the measurements taken by Strongsville Police Department, it would have been prior to reaching the stop sign. How far prior? I believe I have it documented in my report. In my conclusion, point number 5. Okay, fine. Let's go to his report. Point number 5. Where's the conclusion? I just want to show it. I want to watch him like shut this guy up. Okay. Investigative findings. Evidence, review, analysis, and reconciliation. Okay, in his conclusion. All right. I'm not going to read this yet, but I think he's referencing this. Okay. In my conclusion, point number 5, conclusion number 2, the Toyota, okay, this is from the report, conclusion number 2. The Toyota began to travel off the northern edge of Progress Drive for approximately 32 feet before reaching the intersection with Alameda Drive and returning to the roadway. Oh, there you go. In my conclusion, Point number 2, the Toyota begins to travel up the northern edge of Progress Drive for approximately 32 feet before reaching the intersection with Alameda Drive and returning to the roadway. Okay, so that's one time. Correct. That was, this idiot is trying to, why are you doing this? She got off the roadway when she hit the sign and the building. Correct. That was 32 feet before you would enter the intersection of Alameda. Yes. So sort of close to the stop sign, it would have been right in that area, the approximate area. So is that the first or the second time it left the roadway? Oh my God. Is he trying to trip him up? Because this is like, please don't be as dumb as Mackenzie. Okay, so he's not counting this as the second time. This is my assumption, is that he's not counting this as the second time it left the roadway. I think he's trying to trip him up. I'll just hope that. But he is a prosecutor. Okay, is that the first time or the second time it left the roadway? Well, that would have been the first time. Yeah, and the second time was, well, after it returned to the roadway, and then, okay, got it. Oh, insufferable. After it returned to the roadway, and then, okay, got it. Yes, through that T intersection. Yeah, so through that T intersection right there. Oh, good. And you don't know if that was consistent with a hard right turn, left turn. You just simply don't know. No, that wasn't his job. That was not what he was trying to figure out. There would have been some type of movement that caused the car to veer to the right. However, interrupt. But you didn't record. No, I didn't know. Do you wish you would have? Well, I am not familiar with this report. I can't say one way or the other. And in one of those videos that you showed us, it was traveling on Pearl Road. The car was going normal speed. Correct. Did you do an analysis to see what the speed was? No, I didn't need to for that video, you idiot, because it didn't crash there. Ugh, this is so annoying. I like defense attorneys. I don't like this one. Hold on. Okay, this is what he's talking about. There's something in here that he's asking him if he did this analysis. And he's like, no, I didn't. You could have, though, if you wanted to. Potentially, the camera view and what I had to work with on that video was not optimal to do the same type of analysis. However, it didn't appear that there was an apparent need for the vehicle turning right. No, okay, exactly. But the question was, the court, I'm sorry, what was the last thing that you said? The judge interrupted him. Woo! It didn't appear that and the witness says, it didn't appear that there was a need to do a time distance analysis for that vehicle making a slow right turn. But you could have. Well, potentially, I would have had to examine the video more. But you didn't. But with your naked eye, your trained eye, it seemed like the car was traveling at an appropriate speed. Correct. And are you familiar with that area at all? No, not overly. Not overly. Have you ever been on that road much? Well, prior to this, I can't say that I have. Okay, all right. One moment, Your Honor. Sit your ass down. Miss Mackenzie? Sure. On page 3 of your report, you have a forensic map, right? Well, hold on. We're getting back to page 3 because we want to see what he's trying to do. Page 3. Okay, forensic map to scale. I do. What is the distance of the extreme right point to the point of leaving Alameda? Wait, the extreme right point to the point of leaving Alameda. The extreme. Oh, we're on the wrong map. Okay, sorry. The extreme right point to the point of leaving Alameda. Oh, this. Okay. Okay, back up. Oh, the extreme right point. But I can't read it if I'm too far back. All right, the extreme right point is a tree, a hydrant, a tree, a different building, a tree. Okay, that's the extreme right point. All right, what is he getting at? That's a measurement that that's a measurement that I included with my report. Okay. That is a measurement that I can obtain based off the files that I have saved. However, my analysis actually began when the Toyota came into view. Do you know how far the Toyota had traveled on progress before it came into view? No, I don't know that off the top of my head. Inaudible. You just know it happened somewhere between Pearl and Alameda? Correct. Okay, all right. Thanks very much. No further questions. The court. Is there anything else? Oh. Okay, wait. The court. Is there anything else? Mr. Troop, nothing further based on that, Your Honor. The court. Thank you for being here. You may step down. Thank you, Your Honor. Any other witnesses today? No, Your Honor. Okay. Not resting, though, correct? Correct. So, okay. Not resting, though, correct? Correct. Okay. We will resume tomorrow at 9. Is there anything that we need to address? Mr. Wing. Yeah, I have about maybe. Do you want me to go off the record? Yeah, that would be good. Okay. Discussion is held off the record, and the hearing was adjourned at 4:06 p.m. We are on page 172. What is this? A certificate? I'm just being a little bit nosy and seeing what's happening for us tomorrow at court. I am a stenographic reporter. Wait, stenographic reporter. Okay, we're just taking a sneak peek of court tomorrow. I, James, Ms. Annan, a stenographic reporter, do hereby certify that I wrote the foregoing audio recording proceedings in their entirety on the stenotype, which was subsequently transcribed into typewriting by means of a computer-aided transcription under my direction, and that the foregoing transcript is a true and correct description of the audio recording. Signed on April 15th. Okay, wow, that's... Okay, this is day 2. Man, I'm into this. All right, I'm going to come say hi to you guys. Wow, that was pretty good. That was fun. Very dorky. Hello, Phil. No problem. He's so bad at this. How did she think this was possibly going to go good for her? Seriously, that was wild. I had to step away for a moment. Who's the one asking the questions for this part? I want to meet this guy so he can help me when I go to school. Yeah, this is true. Who's this? Hi, Cindy. I want to meet this guy so he can help me when I go to school for criminal justice. I chose to change my business admin degree to criminal justice because of Dominic and Davian. Awesome. I love that. I love that. He was way out of his league trying to question this guy. This is like Alan Jackson destroying Trooper Paul. Like, I dare you. And now I can really see what Chris Cuomo is saying. Like, why did you go after the data? You can't argue data. You just look like an idiot. Like, this guy was so meticulous. There, literally, you can't argue with the thing that he showed you. That was amazing. I was impressed. All right. Yeah, he was way out of his league. He definitely did his homework. Yeah, Phil. That was... Okay, wait. I've always wanted to visit Massachusetts. Wait, Phil, are you in Mass? I'm in New Hampshire. Bobby, be safe. Oh, you are in Mass. Oh, then you know what I talk about when I'm referencing Karen. They answered, okay, wait. Her jaw must have been on the floor when she found out they had video evidence. Yeah. After that witness, I would have wanted to leave the courtroom too. I don't know if she's smart enough to understand it though, because her parents lied to her about everything. And Natalie's denial leverage is high. I would have been super happy if I was the prosecution or the judge. But see, the thing is, this guy, McDonald, didn't do his homework. He didn't even read the report. He didn't even know that he had a conflict of interest when he got the witness list because he didn't look at it. But Mackenzie was happy with him and she hired him. And she should have turned him away right then when he screwed that up for a conflict of interest. Yeah, once you get the full report, you're going to be pro Mackenzie. No, now I mean pro police in Ohio. They are phenomenal. So far, so good. I have not seen anything dirty so far. I know he put his little stop sign in the picture. That was cute. Well, his picture was really detailed. The one I have is probably from Strongsville, or it's a more user-friendly version of it. It's like easy to it has color. I like this one too. All right. Yeah, this was amazing. It sounds like a jet coming down the street. Yes, it does. And for some reason, to me, it's the same as seeing Christine when they do the I've never seen the notification videos because it's like, I can't. And that crash for some reason has the same effect on me. You know why, Phil, though? They told us because her tires weren't on the ground. And that's what that sound is. Something we heard about it earlier. When her tires leave the ground, she's airborne. That was wild. I do love that he put a little stop sign in there. All right, well, I love. So tomorrow we're going to go back to court. I have to go to the golf course, but keep those super chats coming. Thanks for being here and hanging out with me in these dorky. I love this kind of stuff, and I enjoy reading them. So I'm glad that we get to do it together tomorrow on day 2 of court. A little sneak peek is let's see. Probable cause, volume 2 of 3. Okay, Jennifer O'Malley. Yep, we've got her. And we are starting court at 9:24. But I don't know what time we're going to do it. I'm trying to decide if we should do it before court. Are you guys watching this? I'm just going to give us a little. Oh, Detective Awesome is coming tomorrow. He's testifying. Detective Awesome is on the transcript for tomorrow. Awesome. Okay. Well, my loves, who else is going to be there? I can share this with, oh wait, can you guys see this? Just give you a sneak peek of what's going to happen in court tomorrow. We have, wait, why is by Mr. McDonald. Oh God. I thought they were examining him. All right. So are we on day 2? Yeah, we're on day 2. Mark Sargent. I can't remember who that is. Sargent. Was he the one of the responding officers? He might have been. And then there's Detective Awesome, Dr. Joe Filio. Oh, and then the defense has a few witnesses tomorrow. So tomorrow's going to be a jam-packed day. All right. That's a little sneak peek of what we're going to see tomorrow at court. It has us resuming at 9:24. Maybe we will do that on the East Coast too. I don't have to be at work till noon. It would be kind of fun to go to court before work. But keep those super chats coming, because if we can jam them out, then yours truly could do this all day with you and go down as many rabbit holes as you wanted. I would love to do that. Okay. Yeah, she's screwed. If I was this prosecution, okay. One of the things about the TikTok girl, she's like, oh, this was an easy win for the defense. For the prosecution. Yeah, and it was a way for them to show off how skilled and talented and professional every single person that's touched this has been phenomenal. My hat goes off to Ohio. Not Idaho. No, not Idaho. Ohio. Not Idaho. Idaho, what a joke. All right. Well, I will see you guys tomorrow for court. I have no idea if we're going to go before the golf course or after, but we have day 2 of court, and Detective Awesome will be on the stand. Oh my gosh, you know what will be so different now? Listening to her police or prison call or jail calls during this time when she's like making fun of the prosecution, saying like he wears the same suit every day. She's just being rude. How did she find an attorney that's as rude as she is? Unbelievable. All right, my loves. Thanks for joining me on day 1 of court transcript reading of the bind over court. In conclusion, I'll do a wrap up. Welcome, everyone. Thank you for flying Conair. We are landing in Ohio because that's the safest state so far to land in, other than Florida, because they have the sunshine law. And I think everyone is going to, if they dig a little bit deeper into all of our states, well, certainly New Hampshire. Thanks for doing the deep dive with us on the bind over transcripts that one of our lovely dear friends gave us of the Mackenzie Shirilla case. We just finished day 1 of day 3 of 3 days. It's a 3-day trial or hearing. So far, top-notch professional. I can't speak highly enough of the Ohio State Patrol and everyone involved in the case. Mackenzie is screwed. And now I can really understand and why Chris Como is saying you should have gone after her diminished capacity and not after the data. He just looks like an idiot. I love you all. Thank you so much for coming. Thank you for the super chats. Let's get me out of the golf course and back onto you, or not back, onto YouTube full time. I wanted to compete with the boys. Thanks again for the super chats. Cougarish, Kendall. I know Bobby gave me one. Thanks, Bobby. Thanks, Jamie. And thank you, Freedom Fighters. I love you guys. And I will see you tomorrow. We have court. This is 9:24. I don't know if I want to get started and then have to stop halfway through. I mean, that just took us, how long have we been on here? 6 hours? Yikes. All right. Well, then we should do it after the golf course. Okay. Well, maybe we'll do like our first witness or something. We'll talk with the stat or with the crew and see what if the convicts are tired, we might just keep flying. And with that, I will love you and leave you. Thank you for spending your time with me. Thanks for liking, sharing, subscribing, and doing all the things. You guys are amazing. I love you all. Bobby, sending you love and light. I will look at your video or your email right now. And I will see you on the flip side. I'm zoning out because I'm into I can't wait for day 2. I want to hear what Detective Awesome says. I wish he was only 8. I want to keep going. But I will see you on the flip side. Thanks for hanging out with us today. The crew thanks you. Thank you for flying Con Air. I hope you landed safely. Oh, I did make a commitment. I did say unless it was midnight to get us swag. We need this. We need the swag. It will be so fun to wear it. All right. I love you all. Thank you for flying Con Air. Travel safe. Welcome to your destination, Ohio. I'll see you on the flip side. I love you all. Good night. Good night. Good night. I will see you on the flip side. Love ya.
Oh, you'll never get to wear those figure skates. I'm gonna whack.